I want to give anybody the illusion that I'm about to gavel in. Can't start. Monsters.
Is that what you're ready? The one that fell down?
Yeah, one.
I know.
Hi.
I was expecting to like creep in here.
Yeah, so, question,
Yes.
it's right here. If a hospital filed a death certificate with vital records, I go to vital records and I'm like search for that person's name.
Are you entitled?
Yeah.
You are entitled.
I don't know what that means. What does that mean?
Oh, I see. You're asking, well, what's his face?
We're just asking if
You can if you're entitled. If not, it's
What
100
is it?
years. We have a criteria: child, spouse.
Oh, so if you're not some, but how
100 years.
100
100 years.
Long time for us to get documentation.
Good to see.
What? Yeah. And if they lied.
I will tell you where it is that it says 100. I'm pretty sure it's in the statute. Yeah.
Wild.
Yeah, likewise. But we get them. It does feel like a long time. But that's the same thing, I think, for marriage licenses, like you can't go.
He's listed as remote, but in person.
Then you
Yeah.
have to wait.
His boss is leading the hearing.
Okay.
Tell your house.
Yes.
Is that not privacy?
I think the reason to Owen's point is that a death certificate has medical, has a cause of death, the hospital, there's a little bit of sort of public template information that's different than outside.
Is an elected official in there?
I don't know if y'all were to FOIA, I don't know what would happen. We would tell you. You can't tell you. Address. Yeah.
But the question was around like, I was like, a hospital would have to agree to down the bid time now to the debt, somebody has to sign up. I don't think anybody said their medical license, the debts trying to do that. But there's nothing that requires the death certificate. So it allows for a public narrative that looks very different than.
Yes, but from what I saw, if we're talking about Senator Graham,
The other one.
the other one that is alive.
Maybe.
So they say, well, with the senator,
He was alive when they left him.
it's because he wasn't holding the Washington Post in the picture. That's,
And also looked like he got Botox in his face.
are we taking a recess after public? Congrats.
Yes, you're happy. No, I don't. I go to the too much time. Maybe when it kind of like changes. Oh, I would. Yeah, I'm like tired. Oh, so I was like. You're good. Mic is hot again. Good afternoon. I'm Ward 1 Councilmember Brianna Doe, Chair of the Committee on Public Works and Operations, and I'm calling to order this joint public hearing. My co-chair for this proceeding is at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today is Monday, July 13th, 2026. The time is 1:42 p.m. We're convening over Zoom and in room 123 of the John A. Wilson Building, AKA City Hall. Fun fact, the German word for City Hall is rat house. Today's hearing covers two proposals, Bill 26-492, the Rodent Abatement and Transparency Amendment Act of 2026, and Bill 26-707, the Rodent Education and Management Yields Results Amendment Act of 2026. Both measures attempt to improve how we as a government help prevent and manage rodent infestations. I appreciate that many of our witnesses today are here to advocate for avoiding cruelty to animals. I share that goal. At the same time, you don't have to find rats and mice icky or scary to agree that cities ought to try and keep their rodent populations small. Rodents can cause serious property damage and expose people and other animals to dangerous illnesses. Is that better? Thanks for letting me know. One of the best ways to avoid having to kill large numbers of rodents is to employ responsible waste management practices. That way, rodents won't have a huge food waste supply that leads to unmanageable population growth. Councilmember Henderson and I recently teamed up to crack down on trash can issues. In this year's Budget Support Act, my committee added language allowing the Department of Public Works to buy limited numbers of rodent-proof trash cans without going through the ordinary prolonged government procurement process to try these cans out on a pilot basis. and Councilmember Henderson's committee supplied $100,000 to fund this pilot program. DC Health also has started rolling out a new rodent response pilot program in a few neighborhoods. Among other things, their program involves trying to get rats to ingest contraceptives. I believe we'll hear some feedback from residents about that program during today's hearing. As for the additional proposals we're considering today, I'll give a quick summary of Councilmember Janice Lewis-George's proposed approaches in Bill 26-492. Then I'll turn it over to my co-chair, Councilmember Henderson, to discuss the other measures since she introduced it. Councilmember Lewis-George's bill would do 5 things. First, it would update how DC Health, the agency that's currently responsible for animal control matters, tracks and publishes rodent data. Under the bill, DC Health would stand up a dashboard for compiling and reporting out stats on things like rodent population estimates and frequency of rodent abatement requests, all broken down by advisory neighborhood commission single-member districts. Second, DC Health would need to put together a comprehensive plan for improving rodent abatement efforts. Third, the Department of Public Works, which is under my committee's jurisdiction, would have to notify agencies before removing public litter cans. Fourth, DPW would need to submit rodent activity reports to DC Health when they're out addressing trash violations and encounter rodents or signs of rodent activity. Finally, there's an existing law that allows our government to recoup actual costs when it has to perform rodent abatement work because of a private party's mismanagement. Councilmember Lewis-George's bill would incentivize better behavior by allowing up to triple damages. I'm pleased to have both DC Health and DPW in the same room today so we can get both their feedback on the ideas in B26-492 and hear how else the district might strengthen and coordinate its rodent abatement supports. Councilmember Henderson, would you like to provide opening remarks and discuss Bill 26-707?
Yes, thank you, Councilmember Nadeau, for hosting this joint hearing with me and the Committee on Health today. The second bill that we will consider, Bill 26-707, the Rodent Education and Management Yields Results Amendment Act of 2026, more commonly referred to as the REMY Act, along with, it was introduced along with Councilmember Charles Allen, Matt Fruman, Janice Lewis-George, and Brooke Pinto. The legislation takes a public health approach to preventing and abating growing rodent populations in the district. It focuses on one of the main causes of rodent infestations, which is significant amounts of accessible food, while also providing public education and public health protections against rodenticides. Discarded food and food scraps are a major driver of rodent infestations in the district, particularly in commercial areas with restaurants and food establishments. Rodent-proof dumpsters are significantly more expensive than the standard dumpsters. So many small businesses that sell food continue to use dumpsters that become essentially all-you-can-eat buffets for rats. No amount of traps or rodent treatments will address an infestation where you have food consistently and constantly accessible and available. We hear today and every day, actually, how frustrated residents are. And unfortunately, some are turning to personal use of rodenticides, which, if applied improperly, can pose a significant health risk to residents, particularly children, as well as pets and endangered wildlife, without effectively controlling rodents. One local hospital reported 12 cases of pediatric hospitalization tied to rodenticide exposure in the past year. A recent report from the Department of Energy and Environment also found that 85% of the dead hawks, eagles, and other birds autopsied in the district had signs of rodenticide poisoning. To address the challenges, the REMY Act proposes to do a couple of things. First, decrease the source of food by establishing a commercial corridor rodent-proof dumpster pilot program to support business improvement districts and main streets in addressing areas with high rodent populations. It would protect children and pets and wildlife from rodenticide poisoning by requiring training and certification for the sale and usage of anti-cologicant rodenticides in the district. I'm gonna get it right, and require DC Health to conduct public education as part of its rodent abatement efforts. I definitely look forward to the conversation today, and I'll turn it back over to Councilmember Nadeau so we can talk to the public witnesses.
Excellent, thank you. All right, so for our public witnesses, witnesses testifying on behalf of an organization will have 5 minutes to provide oral testimony, and all other witnesses will have 3 minutes. When it's your turn to join a panel for testimony, I will call your name. If you're here in person, please come take a seat at the witness table. And if you're on Zoom, a member of my staff will change your status to panelist. Please watch for a prompt to accept that promotion. For any technical difficulties, you can send a message in Zoom to any panelist labeled as committee staff, and they'll follow up with you. Finally, I'll note that a scheduling conflict has come up for me, so I'm going to be passing the gavel to Councilmember Henderson at 3 for a little while and then come back, which should be fine because we're a team. All right, so our first panel includes Max Broad, Executive Director, DC Voters for Animals, Holly Gerberich, anthrozoologist and rodentologist at Responsible Rat Management Coalition, Matthew Millage, Director of Public Space Operations with Georgetown Bid, and Roberta Yeomans. Okay, friends, we're going to go in the order that I called you. So once everyone's seated, Mr. Broad, you may begin.
Great. Hello, council members Nadeau, Henderson, committee staff. It's great to be here with you today. I'm the executive director of DC Voters for Animals. Our mission is to lift up the policies and politicians doing the most for animals in our community in the district. We're joined by nearly 1,000 subscribers and over 1,200 followers on social media. We're excited to support these two bills as they fit within our purview of being good for animals and good for our community. So just a little background, I was drawn into this issue when nearly 2 years ago, and Councilmember Henderson, forgive me, as I know you've heard this story many times, but a neighbor spread rodenticides throughout my back alley. And, you know, these lethal chemicals are just as indiscriminate in who they kill as they are attractive. I was astonished by this behavior, especially considering that I live on the same block as a dog park. But I soon found from posts on Nextdoor and Reddit that this is a common occurrence, which I chronicled in my appendix to this testimony. So DC residents are buying rat poisons by the bucket load and taking vigilante rat control into their own hands. Due to a loophole in DC law, only pest control professionals require certification to use dangerous chemicals. Members of the public buy these readily available poisons and deploy them without fear or consequence for those they may harm. You'll hear today about the impacts that these have for children and public health, on wildlife and pets. You know, there are jurisdictions throughout the country and other countries that are working to take action on this, that are both restricting the sale of these items as well as just banning them outright. So you'll see that, you know, today that DC's proposals are not too ambitious and they are fitting within the context of other policies that have been passed throughout the country and the world. The reality is that the actions of my vigilante neighbors came at a real and reasonable, they come from a real and reasonable place, wanting to see fewer rats. What we know is that the poisons are not going to accomplish this. We have been using rodenticides for decades. Many of these poisons have been around for longer than most people in this room. Yet DC is hitting new heights with our rat population. The truth is that as long as food is available for rats, they will keep returning or even expand. Ask any rodentologist. Rather than the proverbial pound of cure, these bills smartly offer the prevention that DC desperately needs. They take a systemic approach to address the main drivers of rat population, tracking rats and eliminating food sources. While these policies will not be an overnight fix, we know we cannot make headway without these. We'd also like to offer some suggestions for the REMY Act. First of all, we deeply appreciate this bill helping prevent future child and animal victims of anticoagulant rodenticides. These anticoagulants are notorious for their long half-life, remaining for months or even years in the animal's body, in the ecosystem, and in our waterways. Thus, they readily work their way up the food chain, while other neurotoxin and calcification rodenticides are less likely to move through the food chain. They still pose a threat for primary victims. With these, the main problem being residents who purchase and improperly apply poisons. These chemicals pose just as much a threat as anticoagulants. While the treatment of anticoagulants can take weeks, the treatment for the most common neurotoxin rodenticide, bromethylene, is bed rest. That's because there's no antidote. Sure enough, in the 12 reported cases of DC children ingesting rodenticides, 6 were unknown poisons, but 2 were from anticoagulants, and the other 4 were from rodenticides that had no treatment. I'm not aware of the prognosis from these cases, but I fear that having a partial restriction will guide consumers to other rodenticides rather than addressing the danger these poisons pose. My other suggestion is to expand the language of the REMY Act, which currently calls for rodent-proof dumpsters. We suggest expanding this language as the business community may request support from a broader array of waste containers. Finally, I'd just like to express my gratitude to the introducers and co-introducers of these bills, Councilmember Henderson and especially Ms. Balkas for all your work in attending the RAD Academy. We're joined here in the hearing by so many great people from DC Health and from the broader community. And I'm grateful for everybody who's been involved in this conversation. We're eager to see these bills approved and ask the committee to also consider the other 2 rat prevention bills that have been referred here. All 4 bills fit squarely within the mantra of DC responsible rat management, which is prevention, not poison. Thank you.
Thank you. Ms. Garbridge?
Council members Nadeau and Henderson and members of the Committee on Public Works and Operations and Committee on Health. Thank you so much for taking up this really important topic. My name is Holly Gerberick. I'm a 25-year resident of Washington, D.C., currently living in Ward 5. I'm an anthrozoologist and urban rodent researcher. I'm also a founding member of the D.C. Responsible Rat Management Coalition, and I'm here today to voice my strong support of these 2 bills. Together, these 2 bills represent a critical transition for the district by moving us away from a failed cycle of reactive poisoning towards proactive systemic management. My research on urban rodents underscores that our current widespread reliance on anticoagulant rodenticides is not only ineffective, but it poses severe compounding risks to our public health and local environment. First, as we heard, these anticoagulants are completely indiscriminate toxins. They bioaccumulate in bodily tissue, moving from insects and arthropods directly up the food chain into our local wildlife. To put this into context, City Wildlife's lead veterinarian found that an astonishing 84% of their intake patients in 2024 tested positive for some sort of anticoagulant, with 75% presenting with 2 or more types in their systems. Second, anticoagulant rodenticides directly endanger DC households. Each year, more than 6,000 children under the age of 5 nationwide are accidentally poisoned by them. This is alongside countless family pets who end up in veterinary emergency rooms facing incredibly costly, protracted treatments, and many unfortunately do not survive. Third, and this may come as a surprise, emerging scientific research shows that external culling can actually amplify disease risk. When we artificially kill off parts of a rat colony, we fracture their social structures. This disruption, along with a reduction in hosts, can lead to an increase in pathogen load and heighten the risk of zoonotic disease transmission. Given the current decreases in federal government disease monitoring and widespread reduction of regulatory guidelines, it's more important than ever that we move proactively to reduce the risk of pathogen spillover into our communities. But right now, there's an easy way for individuals to bypass the EPA's restrictions to these poisons. Anyone can go online and purchase industrial quantities of anticoagulants to be delivered directly to their doorstep. And because these are sold so casually, users are often unaware that they're introducing devastating toxins into our ecosystem. Thus, it is imperative that we restrict these materials to licensed professionals only who are trained on their application and potential hazards.
I'm so sorry. I'm going to interrupt you because there's something going on with the audio
Oh, no.
and they can't hear you online.
Okay.
So you're going to be able to start again,
Okay.
but I don't want you to have to repeat the whole thing again. So let us figure this out.
Okay.
People want to know.
I appreciate that you that you added that you wanted the expansion. I should have. Like, we can say what's good about it, but also like what yeah, or like what we would like to see in addition. Like, this is a good step in the. I think I'd say like this is a good step in the right direction. But I want to.
You can add with that if you want to.
True at the end, because she's. Part of
Double testimony. Good to see you, Matt. How's the fam? Oh, do I need simplification?
You look.
Well, her microphone's on.
That's just being part of outside the neighborhood.
Testing.
Test, test. Audio test from the diet.
They said they couldn't hear on Zoom.
Mhm.
It was on Zoom, they cannot hear.
Okay, she did just hear me from the dais. Should we ask one of the panelists to test again?
Check, check. 1, 2.
Okay, seems to be working now.
Testing. Testing, testing.
Take it from the top. Ms. Garbage, we'll have you repeat your testimony.
Okay,
Okay,
sounds good.
great.
All right. Council members Nadeau and Henderson and members of the Committee on Public Works and Operations and Committee on Health, thank you again for taking up this really important topic. My name is Holly Gerberg. I'm a 25-year resident of Washington, D.C., currently living in Ward 5. I'm an anthrozoologist and urban rodent researcher. I'm also a founding member of the D.C. Responsible Rat Management Coalition, and I'm here today to voice my strong support of Bills 26-492 and 26-707. Together, these two bills represent a critical transition for the district by moving us away from a failed cycle of reactive poisoning toward proactive systemic management. My research on urban rodents underscores that our current widespread reliance on anticoagulant rodenticides is not only ineffective, but it poses severe compounding risks to our public health and local environment. First, these anticoagulants are completely indiscriminate toxins. They bioaccumulate in bodily tissue, moving from insects and arthropods directly up the food chain into our local wildlife. To put this into context, city wildlife's lead veterinarian found that an astonishing 84% of their intake patients in 2024 tested positive for anticoagulants, with 75% presenting with 2 or more types in their systems. Second, anticoagulant rodenticides directly endanger DC households. Each year, more than 6,000 children under the age of 5 are accidentally poisoned by them nationwide. That is alongside countless family pets who end up in veterinary emergency rooms facing incredibly costly, protracted treatments that many unfortunately do not survive. Third, and this may come as a surprise, emerging scientific research shows that external culling may actually amplify disease risk. When we artificially kill off parts of a rat colony, we fracture their social structures. This disruption, along with a reduction in hosts, can lead to an increase in pathogen load and heighten the risk of zoonotic disease transmission. And given the current decreases in federal disease monitoring and widespread reduction in regulatory guidelines, it is more important than ever that we move proactively to reduce the risk of pathogen spillover in our communities. But right now, there's an easy way for individuals to bypass the EPA's restrictions to these poisons. Anyone can go online and purchase industrial quantities of anticoagulants to be delivered to their doorstep. Because these are sold so casually, users are often unaware that they're introducing devastating toxins into our ecosystem. Thus, it is imperative that we restrict the use of these materials to licensed professionals only who are trained on their application and potential hazards. This ensures that if they are deployed at all, they are confined within highly regulated parameters. Furthermore, if we continue to rely solely on lethal interventions without changing environmental factors like easy access to food, as you both noted, we trigger what's called the boomerang effect, which is compensatory reproduction practiced by rats to replace their population numbers, often at higher rates than they were previously. So to break this cycle, we must let colonies decline naturally through resource competition. This means focusing heavily on reducing their access to food. Mandating rodent-proof containerization is by far one of the simplest and most effective ways to do this. Providing grants to business improvement districts and main streets to subsidize rodent-proof receptacles is an easy upstream investment that has the potential to reduce long-term downstream financial and health burdens on the district by lowering the risk of pathogen spillover. And I would agree with Max. I would love to see this expanded to containers outside of just rodent-proof dumpsters. And for these reasons and many more that I'll add to my written testimony, I strongly urge the council to pass both of these bills to protect DC residents, our pets, and the local ecosystem that we share. Thank you.
Very much. Mr. Millage.
Good afternoon, Chairperson Nago and Henderson and members of the committee. Thank you for the opportunity to testify today. My name is Matthew Millage, and I serve as the Director of Public Space Operations for the Georgetown Business Improvement District. Georgetown BID strongly supports both the Rat Abatement and Transparency Act and the Rodent Education and Management Yields Results Amendment Act of 2026. Together, these bills advance a comprehensive approach to rodent management that emphasizes prevention, collaboration, transparency, and education. Managing rodent activity is one of the most difficult public space challenges facing commercial districts across the District of Columbia. Through our work in Georgetown, we have learned that lasting success depends on addressing the conditions that attract rodents, not simply responding after infestations occur. One of our most successful initiatives has been working with property owners, restaurants, and waste haulers to transition from plastic toters to fully enclosed containerized waste storage. The Georgetown BID has piloted two types of enclosed public trash cans that have been extremely successful at eliminating access to rodents. Reducing rodents' access to food has improved sanitation, enhanced the public realm, and helped reduce conditions that support rodent activity. The REMY Act's rodent-proof dumpster pilot builds on this proven strategy and can help replicate these successes in commercial corridors throughout the District of Columbia. Equally important has been collaboration. Each month, the Georgetown BID convenes rodent abatement walks that bring together DC Health, the Department of Public Works, the Executive Office of the Mayor, the Citizens Association of Georgetown, local businesses, and the BID staff. These walks allow us to collectively identify issues early, coordinate responses across agencies, and educate businesses and property owners on best management practices. We have found that consistent communication, education, and a shared sense of responsibility produce far better outcomes than isolated enforcement alone. The RAT Act enforces these principles by improving transparency and coordination. A public rodent abatement dashboard will help agencies and communities better understand where resources are being deployed and measure progress over time. Requiring coordination before public trash receptacles are removed and ensuring rodent activity observed by DPW is reported to DC Health are practical steps that strengthen interagency communication and support more proactive responses. We also support REMY's emphasis on public education and the responsible use of rodenticides. Education has been a cornerstone of Georgetown's success, and expanding outreach citywide will help businesses, property owners, and residents adopt the preventative practices that make the greatest long-term impact. Training requirements for anticoagulant rodenticides will also help protect children, pets, and wildlife while encouraging safer, more effective pest management. Our experience in Georgetown has shown that meaningful progress is possible when government agencies, businesses, residents, and community organizations work together. These two bills reflect that collaborative approach, and we respectfully urge the council to advance both measures. Thank you for your time and consideration.
Thank you. Ms. Yeomans.
Did I start? Okay. I thought you were going to yield some time to me. No? Anyway, good afternoon, Chairman Nadeau, Chairwoman Nadeau, Chairwoman Henderson, and staff. Thank you for the opportunity to testify on these. Oh, sorry. Thank you. Now? Oh, okay. Yeah. Thank you so much for the opportunity to testify on both of these bills, which I think will go a long way to help eliminate rats in DC. My name's Roberta Yeomans. I've lived in DC since 1983, most of that time in Ward 3. I'm a longtime animal shelter volunteer. Thank you, Chairman Henderson, for your work on those issues, and a longtime litter collector. Thank you, Chairman Nadeau, and Louis George for introducing the bottle bill. Litter, of course, can exacerbate the rat problem. I'm also a member of Max's group, the DC Responsible Rat Management Coalition, and I support their positions, of course, but these comments are my own. First, let me thank you so much for having this joint hearing. Having worked on the Hill and for some federal agencies, I know that it's so easy to work in silos. So I think it's great to work on this in a coordinated fashion. Some issues that help to cause increase in rats like climate change, we don't have any control over. But, well, some, but others we do have a lot more control. Others at this hearing will discuss the impact that rodenticides have on wildlife. I will spare you all the gory details of the rat I saw dying on Wisconsin Avenue and a few days before the hawk in the tree that was waiting and a few days before the hawk that was waiting in the tree for its next yummy meal. Few people love rats, but there are a lot of other ways to deal with them. So I'm going to comment on each individual bill. The Rat Act increases the fines for people that don't follow the rules we have on the books. I think it's great that the bill actually says how much you can increase those fines, because only if people are aware of how much they'll be penalized will they take any action. I think the dashboard is also a good idea. We need good data. I think it would be really interesting. I support what's in the bill now, but I know we can't eliminate rodents entirely. But let's be bold. Let's be bold and let's say a 50% reduction in 2 years. I know it's a budget issue, but let's be bold. Now, there's a provision in the Rat Act that I'm a little confused about, and maybe others read it differently and understand it. There's a provision that says before a public litter container can be removed, the city has to provide notice to the ANCs to remove it and then include an intent to replace it. And so I don't understand it. If there's an issue with a public litter container and somebody's asked for a request to remove it, why would anybody object to it? And I also wonder why anybody would need 30 days to do so, especially if there's health and safety. The word intent in the legislation, I used to work on legislation on Capitol Hill. The word intent is also troubling. An intent is not an action and could take months to do. Again, budget issues. Are the containers the problem, or are the fact that trash is spilling out of them or accumulating? If it's that trash is spilling out of the can or the can's falling apart, maybe we should pick up trash more often. Again, a budget issue. Or I know people will laugh at this, but I've been doing a lot of reading about what Japan does. You know, Japan doesn't have trash receptacles in most places. In Japan, people take their trash home. Wouldn't that be nice if we could do? Now on to the REMY Act. I think the REMY Act, I'm out. Oh, well,
It's
in
okay.
my
We'll
written
have some
testimony,
time.
you'll see what else I had to say.
We'll have some time in questions.
Okay, great.
Got it. Okay. Thank you all for your testimony. So, Mr. Broad, you mentioned a couple states have placed limits on rodenticides similar to what's proposed in the REMY results bill. You also recommended imposing similar limits on other classes of rodenticide. Could you please help point us to any analysis of what other jurisdictions have done with non-anticoagulant rodenticides and what the outcomes were for other wildlife?
Yeah, absolutely. So most states have indeed targeted anticoagulants like DC is proposing, but there are other states that have expanded. Maine is the state that has done all rodenticides. Oregon targeted zinc phosphide, which is a different. There's probably people here who are much more knowledgeable about that than I am. You know, the concern is, especially in California, where they only target anticoagulants, that is just pushing people to other poisons that are on the shelf or in, you know, online. You know, I feel like what this bill is really trying to target is people who are just like recklessly buying it and just spreading it around. And I feel like regardless of what the poison is, that's going to be a problem. So yeah, that's why I raised that.
That makes sense. Ms. Garbage, could you please send us the research you mentioned regarding the downsides of culling rodents through extermination rather than food waste control?
Yes, I'm happy to do that.
Awesome. Thank you. Mr. Millage, I appreciate you emphasizing the importance of government agencies collaborating with each other and with residents. Is there anything you think we should consider adding to these bills to make it easier for residents and organizations like BIDS to pitch in?
Yeah, I do believe that as the grants, including money for purchase and installation of these containers, would be hugely important to make sure that is emphasized and that it doesn't leave that aspect kind of lingering for the businesses or the entities that may benefit. And then I also think that just strong sense of collaboration that I think happens already between DOH and DPW on how best management practices are being approached as the installation of these units are being put in, and just thinking of all of the external factors that play into road abatement.
Great. Thank you. Ms. Yeomans, we think the section you were looking at with the can removal, there was a drafting error in there, but the thinking behind it is that cans have been removed without anyone requesting them. Not that there's a conflict between residents and the ANC, and then the ANCs are flat-footed, and then getting them back is really hard. So the notification was meant to protect against that. And I actually think we all thought we had done that in the last bill, so we're coming back.
Great.
So that's that. Thank you for your detailed recommendations, and I appreciate your testimony is grounded in 40 years of experience as a DC resident. So we'll hopefully have more hard data in the coming years, but what's your impression of how rodent management practices and rodent populations have changed in DC over that time?
Oh, I've lived, again, as I mentioned, mostly in Ward 3, sometime down in DuPont Circle for a bit. I don't know if it's because we're not doing enough or because, like we talked about, climate change, or if there's just more people and they're leaving more trash. I mean, the amount of trash I see, especially after parades, food everywhere, after events everywhere, garbage cans overflowing. I tutor in Adams Morgan. Every Thursday when I walk down there, there's bags of trash with food out on 18th Street. And I'm thinking, wait a minute, they're in front of a residential building. Why are they not being picked up? So sorry. So I think it's gotten worse. I think both of these bills and others that have been introduced will certainly go a long way to do it. And the education component, I cannot express enough. On my own, I have printed out these postcards, which I sometimes leave on piles of trash around the city. Trash equals rats. Again, there's other problems that cause rats too, but I think we just have to all collectively do better. So it's gotten worse, but you all know it's gotten worse.
Well, thank you very much. I'm going to turn to my colleague here. Oh, did you have something you wanted to add, Ms. Gerbich?
Can I ask a question?
Yeah.
About the rodent-proof dumpster subsidies? Do businesses include multi-unit residences?
That wasn't what you had in mind.
No, it was only for the commercial quarters.
Okay. And I ask because I've been through alleyways that have.
Oh, no,
Yeah.
you're not incorrect.
Okay.
But also we have some landlords who they haven't set up trash at
Yeah.
all, whether it's rodent proof or any proof.
Yeah.
The dumpster sizes, all
Yeah.
those different types of things.
And I will say that with the Clean Collections Act, which we passed last year and is being implemented now, we did get at, for those properties, proper containerization based on the number of units or
Mhm.
households in the building, which was not in law before.
Mm.
And a lot of times we would talk to those trash management companies and they would say, well, we've recommended more, but our client doesn't want to pay more, et cetera. So that's going to take, there's going to be a little bit of an on-ramp for that, but that is now law. So I think that kicked in October 1 last year for those buildings. So are they rat proof? But should there be enough of them and should they be frequently emptied? That would at least be a start. So I will turn to you.
Thank you so much to this panel of witnesses for your testimony. Holly, I actually want to start with you. You mentioned in your testimony that folks are going online to purchase what I think is essentially like commercial grade rodenticide. What type of suppliers are providing online access for this?
I mean, it can really be any type of supplier, anyone who manufactures these types of anticoagulants
Okay.
can set up a shop on Amazon.
Right, except for where I'm going with this is, there have been instances, even in the last couple of years, where district law has had particular restrictions on the sale of certain items. So for instance, I remember a couple of years ago, this came up about mace, where you actually could not purchase handheld mace on Amazon and have it shipped to the district because of our laws. So that's why I'm kind of a little interested in terms of this, the application of some, protections versus others, depending on what the type of product it is.
I'm not sure what you mean.
Meaning in that, like, if you could go on Amazon and purchase this, but you can't go on Amazon and get mace, you know what I mean? That's
Yeah.
what I'm saying in terms of how they're applying it. Maybe it's just that the, sort of not knowledge of knowing, but,
Yeah. I mean, my assumption is that there are bans on, if it is not allowed to be sent to an individual, then you wouldn't be able to purchase it, right?
Yeah.
And have it sent to an address in DC. But as you know, DC is pretty small. So I think that, getting it sent to my cousin's house in Maryland or Virginia is also an option. And so I think the use of it in DC is the other really important piece of this.
Yeah. I mean, I think some of it, if someone is taking the individual onus to go out, find these items, it is probably based out of frustration, right? Because you've noticed a problem, you probably have reported the problem hasn't necessarily been addressed, and so you're now deciding to take matters into your own hands.
Some cases.
In some cases, but without recognizing the impact of these rodenticides. I mean, I think the stat that you gave at the top in terms of 84% of the city wildlife intake has had rodenticide identified, and in some of them, it's actually more than one. That's a lot.
Mhm.
That's a lot. That's
Yeah.
intake, right? That's
And
everybody.
that's
been
just the ones
impacted.
that died. There were
Right.
other ones that survived that were not tested.
Yeah. Okay. Mr. Millage, thank you so much for being here and the work that you guys are doing in terms of Georgetown bid. One concern that DC Health has raised to us about the REMY Act is that bids, main streets, and restaurants would be eligible to apply for the rodent-proof dumpsters and not the waste haulers. And that did give me sort of thinking, right? If for commercial properties with restaurants, et cetera, sorry, I'm trying to, Roberta, can you turn, there you go. No, it's okay. How have the conversations gone between businesses and their waste haulers to discuss like, hey, we're using a new type of container? Because that's one of the conversations that we had with DPW around like, okay, for our employees, taking it to the truck, can it hook to the truck? All of those different types of things. So
Yeah, I will say the haulers seem to be late adopters. It seems to be, I think, seems to be bids and businesses, main streets that are pushing the narrative of the need for something better than the plastic toters. And I
Yeah.
think it's mostly because of just ease of use and the way that their systems are currently set up with their trucks and with, like you said, the latches.
yeah,
And, we've worked really hard to kind of get over the hauler narrative that this is the only way we can do it. So we've finally found some more motivated stakeholders that are willing to kind of push their haulers and say, this isn't going to work. We continue to get fines. You continue to patch these plastic toters with
Yeah.
wire mesh, and it's just not working. So, and really it is us that are driving, when I say us, the bids and actually the businesses or the community organizations that are there trying to help push the haulers to do a little better. We've got some real successes behind a couple of restaurants that had just ongoing issues. They had really been working the problem, but they couldn't find results until
Mhm.
we got what they're actually using now are bear-proof dumpsters because there aren't quite enough rat-proof dumpsters yet on the market at
Yeah.
a reasonable rate. And they're finding real success, but we had to really work with the hauler on that and push them. And here's a product that might work. Can you use that? So I do think that the funding might best live with the bids and community organizations that can help administer it and be, the stewards of best management practices and push haulers to want to innovate. in
Well,
these things.
so just sort of thinking too, when I see the private haulers, most of them are not in the district. So for us to give money to a private business in Maryland to pick up trash in DC.
Well said. I think serving Georgetown, the vast majority are located out of state and
Yep.
not in DC operators or So I think that's a very fair point. And we would like to see that all of the dollars go to the implementation and more rather than a possible profit markup for haulers as
Yeah.
well.
You know, one of the things, at least since we started talking about rodents, learned a lot. These containers are very expensive.
There's,
And they're like only maybe 4 or 5 companies in the United States who do them, which is its own, you know, like,
monopolistic issue.
that's what I'm saying. Business schools, this is a
know.
market that is
It's a
ripe
case study.
for
Right.
disruption.
In fact, one of the new major ones, Metro Store, is coming from England because they see how big the business is going to be here in America and basing themselves out of Canada to avoid some of the tariffs. And, you know, so yeah, people are working the problem and we're trying to partner with those people in Georgetown. In fact, Victor Stanley, we've been working with them since 2019
Yep.
to do actual public space rat enclosed cans, rat-proof cans, which we have 5 of now in Georgetown that work really well. We've yet to have one be infiltrated. And now we're working with Metro Store on new pilot and a area along the C&O Canal that has historically been very hard to manage and finding real wins by taking away the food. Real sanitation is really the name of the game.
That's
that we
the
find.
hard part of this is that, right? I mean, you know, go walk my dog. I pass 10 cans and 8 of them have a hole in them the size of a rat. But the haulers don't seem to be motivated even to change their approach. Like the plastic is clearly not working.
Exactly.
The rats have figured out your plastic is weak. So why not switch to something else?
Yeah, and you know, I believe with amplified education and enforcement around, you know, some of the poor actors and the trash management and hauling game, because some of them are really quick to jump out and replace toters for their stakeholders as soon as they're identified for having holes. Some want to come and patch. Some put it on the business themselves, like, oh, here's what we would do if we were you, which is, you know, I don't even know how they get away with that in a contract. But the service is very inconsistent, and it is where we see problems spring up the fastest is when a hauler is doing a poor job of managing an account, whether it's through inconsistent just pickup.
Yeah.
We're creating more bulk than needs to be there, especially if a company's already paying for 5 or 6 days a week.
Is there any concern in this? And mind you, this is a pilot situation. In theory, right? Every business on a block would be switching over. So you're not the one that is like the buffet left
Exactly.
open.
We hope that exactly that type of pressure
Okay.
works in the community to say, you know, we want to be a good actor as well. Here's all these people that are doing the right thing. There's already a prescription for it, if you will. And especially if we can start to find who the really good haulers are that want to, you know, win more business through good behavior. And hopefully that also kind of works in the marketplace.
So just for the record, approximately how much did it cost for the new dumpsters?
They're expensive. So we just had a stakeholder place an order that I saw. It's $2,000 per toter to fit, and they have 8 toters, so they spent $16,000 for
Okay,
their.
so these are
enclosures.
toters. These aren't even
These aren't even the full dumpsters. No, because Georgetown's such a unique environment that very rarely do we have enough room for full dumpsters in our alleys.
Right.
So many of our stakeholders are off of the toter model. We do have though, like the dumpsters that I mentioned that are the Bear models.
Yeah.
I believe those stakeholders paid around $4,500 a piece for them, and they had to have them modified because there is the little catch that bears can't get through a drain hole, but rats can.
Yeah.
So they had to take them from what was a really tried and true method for bears and kind of retrofit them to not let rats
Huh.
be able to get through that drain. And they're working. They put their heads to it, and you know, it's kind of the, you know, market forces working together. But it was one of those things we all thought we had it fixed, and then, whoa, 1 second, one last one last piece.
Got it. All right. Thank you. Thank you so much.
You're very welcome.
Thank you so much to this panel. Our next panel is also in person. It includes Kate Dialuski, Assistant Director, Government Affairs, Animal Welfare Institute, David Rubenstein, Commissioner, Advisory Neighborhood Commission 2F, Colleen Hawkinson, Executive Director of the DC Bid Council, and Robert Vincent Branham, Chairman of the DC FCA Legislation Committee. Like right here, right? All right. When you're ready, you may begin.
Good afternoon, council members Henderson and Nadeau and committee staff. Thank you for the opportunity to testify today. My name's Kate Deluski. I'm a 17-year DC resident, and today I'm speaking on behalf of the Animal Welfare Institute and our members in DC in support of the REMY Act. We respectfully urge the committee to vote in favor of this important legislation and advance it out of committee. The Animal Welfare Institute is headquartered in Washington, D.C. We've been here for 75 years, and we work to reduce animal suffering through science-based policy, education, research, and advocacy. We support practical, evidence-based solutions that protect both animals and people, and the REMY Act embodies exactly that approach. The bill recognizes a simple reality. The most effective way to manage rodents is to prevent their overpopulation in the first place. The combination of prevention, education, and responsible regulation in the REMY Act represent a smart and sustainable approach to rodent management. Anticoagulant rodenticides kill animals by inducing uncontrollable hemorrhaging throughout the body, resulting in a slow and painful death through internal bleeding. They're not only deadly for rodents, but also hazardous to humans, companion animals, and non-target wildlife. The National Poison Data System documented 8,916 human rodenticide poisoning cases in 2024, and young children are at the greatest risk of accidentally ingesting rodenticides. Companion animals also face serious risks, either by directly consuming bait or by eating poison rodents. According to annual reports conducted by the ASPCA, the ingestion of rodenticides is consistently among the 10 most common types of poisoning in domestic dogs and cats. The impacts extend far beyond pets. Wildlife across North America, including owls, eagles, bobcats, mountain lions, river otters, and other species, have repeatedly been found to have anticoagulant rodenticides in their bodies. Researchers have also documented rodenticides in aquatic environments and in fish, which impacts food webs. Predators are poisoned when they consume contaminated prey, creating a ripple effect throughout the ecosystem. One study found that 96% of all birds of prey that were tested were positive for anticoagulant presence in their bodies. These widespread, unintended consequences demonstrate why reducing reliance on poisons is both a public health and a wildlife conservation priority. Fortunately, effective alternatives already exist. Non-lethal rodent management tools include habitat modification, biorepellents, biological control through natural predators, and EPA-approved fertility control products. These all provide safer approaches that can reduce rodent populations while avoiding the harmful collateral damage associated with anticoagulant poisons. The REMY Act recognizes that successful rodent management requires addressing the conditions that allow rodents to thrive, rather than relying primarily on poisons that endanger children, companion animals, and wildlife. This legislation is practical, evidence-based, and forward-looking. For these reasons, the Animal Welfare Institute respectfully urges the committee to pass the REMY Act. Thank you, and I would be happy to answer any questions.
Thank you, Commissioner.
Good afternoon, and thank you for the opportunity to give testimony today on the two bills under consideration. My name is David Rubenstein. I live at 1453 S Street Northwest in Logan Circle. I am the ANC representative for 2F01. 2F01 is made up of row houses and apartment buildings and includes a portion of the 14th Street commercial corridor. Residents of 2F01 cite the rat infestation as one of their chief concerns about the neighborhood. Rats have damaged almost every trash container, run freely in the alleys, damaged parked cars, and infiltrated homes. While I'm supportive of the two bills under consideration today, I remain concerned that they do not directly address the needs of 2F01. ANC 2F's efforts to enforce sound vermin control measures through liquor license settlement agreements have had some success, and so at this point the issue appears to be primarily with how residential trash collection is handled. The trash receptacles currently in use are too easily damaged by rats, which means that any garbage placed in the receptacle becomes an available food source for the rats, as we all know. We need a program that replaces the current damaged receptacles with new, more durable containers. This replacement should be implemented on a block by block or alley by alley basis. I personally have given residents of 2F01 information on how to order new receptacles through the 311 app, but unless the receptacles in the immediate area are also replaced, any new receptacle is likely to soon be chewed up by the rats. We also need an active information campaign about proper handling of trash. The campaign should inform residents about proper handling of trash to control rats and inform residents about requirements pertaining to when trash can be put out for pickup and when emptied receptacles need to be removed from the public space. As an ANC commissioner, I've reached out to residents in each of the homes in my SMD and provided them with this kind of information. However, this effort needs to be supplemented by DPW inspectors who can do informational ticketing. Finally, the district needs to establish a program with resources attached to build upon the excellent work of the DOH rat team so that the district can put in place physical barriers to rats, including wire mesh and stones where rat burrows are pervasive in public space, including the areas around street trees. For example, in Logan Circle, there's an infamous tree at the corner of Peace Street and 14th Street, which is riddled with burrows, but I've not been able to find anyone in the city who can put in place physical barriers to the rats. And I've reached out to DPW, DOH, and DSLBD, which manages our neighborhood's clean team. In closing, while I do support these two bills, I urge the council to go further and press the relevant agencies to implement the kinds of changes I've outlined. Thank you.
Thank you very much, Commissioner Hawkinson.
Thank you. Good afternoon, Chairperson Henderson and Chairperson Nadeau. My name is Colleen Hawkinson, and I'm here today representing the DC Bid Council, the association of the district's 13 business improvement districts. Together, we work every day to ensure DC's mixed-use commercial corridors are vibrant, welcoming, and safe. I want to specifically thank both of you for your leadership, as well as the co-sponsors of the Rodent Abatement and Transparency Act of 2025 and the Rodent Education and Management Yields Results Amendment Act of 2026. It is no secret that Washington, D.C. is facing a growing rodent population. Rats are more than a nuisance. They impact public health, economic vitality, and the overall quality of life for residents, visitors, and workers. One of the key pillars of intense focus for the bids is clean and beautiful. While bid clean teams and ambassadors work in the neighborhoods day in and day out, we know we can help maximize outcomes by working hand in hand with the Department of Public Works and the Department of Health to tackle this issue. Some examples: data sharing, hotspot mapping, and coordination. Bids routinely flag emerging and known rodent hotspots directly to DOH inspectors to ensure rapid baiting and enforcement. Bids also organize walkthroughs with stakeholders and the appropriate DPW and DOH teams. Bids have also worked in organizing adjacent property owners to coordinate private rodent eradication efforts to maximize outcomes. Regarding coordinated waste removal, bids remove trash from public hands throughout their neighborhood on a daily basis. This leaves times and resources for DPW to put efforts elsewhere. And finally, in innovation, you heard some of this from Matt of the Georgetown bid, but bids have collaborated with fabricators to modernize trash cans with heavy gauge materials, self-closing mechanisms, and seamless bottom seals that are proven to eliminate the entry points and gnaw zones. The DC Bid Council strongly supports the spirit of both pieces of legislation before us today. We are particularly encouraged by two critical elements: a mandate for modernized, data-driven tracking and standardization, and funding of rodent-proof dumpsters and waste receptacles across high-density hot zones. To truly maximize the impact of this legislation, we urge closer, formalized coordination between the Department of Public Works and Department of Health. Currently, these agencies manage two halves of the same coin. DPW oversees prevention through waste removal and infrastructure, while DOH drives rat eradication. By breaking down these silos and integrating data and agency staff expertise, the district can bridge the gap between prevention and eradication. This unified approach allows us to move away from a reactive whack-a-mole game of pest control and toward a proactive, data-driven system that aims to achieve permanent abatement. The bids in the DC Council stand ready to partner with the Council and continue our partnership with DPW and DOH to implement these initiatives and to scale our current efforts for greater results. Thank you for your leadership and the opportunity to testify. I'm happy to answer any questions you may have.
Thank you, Mr. Branham.
Greetings and salutations. I am Robert Vincent Branham. I am President Emeritus of the DC Federation of Civic Associations, a former ANC Commissioner, and a military service-connected disabled veteran. I am here to testify on Bill 26-492 to require the Department of Health to create a rodent abatement dashboard and to report on rodent abatement efforts. It would require the Department of Public Works to provide notice to ANCs before the removal of public trash cans in residential zones and require sightings of active rodent or vector activity during enforcement activities be referred to the Department of Health. Bill 26-707 creates a pilot program within Department of Health to provide grants to business improvement districts and main streets to subsidize or purchase rodent-proof trash receptacles for commercial businesses in rodent hotspots. It will require DOH to conduct public education campaign, rodent prevention, control, and rodenticide health risk. While I support both these measures, I suggest Bill 26402 be amended to allow DPW to greater coordinate with community civic associations and other leadership organizations such as the DC Federation of Civic Associations. This would enable and provide enhanced community partnerships free of politicization. Section 9.2 of 26-0707 should be stricken or amended. If rodenticides can be used by government agencies as permitted under the bill, they should be permissible for use by certified commercial operators and educated consumers. Bloomingdale has been greatly negatively impacted by rodent feedings from open trash containers, damaged trash containers, and trash left behind from sanitation trucks. I do wish to commend the Department of Public Works for its responses and community walks within Bloomingdale responding to neighbors' concerns about rodents. I assert public education and responsibility are key to rodent control. It is not advantageous for overall neighborhood cleanliness and sanitation to leave food out for rodent consumption. Community health and cleanliness require the cooperation of residents, businesses, government, and animal lovers. As I indicated earlier, I am a former ANC commissioner. However, I am urging this council and agencies to expand their community outreach beyond just ANCs and to include civic associations such as the federations. There is trouble brewing in community wars against certain ANCs, and over time and unfortunately, many residents are waking up to how some elected commissions, unlike Commissioner Rubenstein, who is here today, who is not being influenced by outside interests, their own personal agenda, and groups with dubious financial stakes in efforts working against the grain of interests of the neighborhoods in which you live, work, worship, and pray. There are worries some commissioners falsely ignore community concerns, significant civic issues such as rodent abatement. These commissioners are not willing to be contacted by voters in their own ANCs at their own ANCs dc.gov email addresses, unwilling to receive lawful and informed community messages from their voters. How would it feel if a ANC was told by a commissioner, don't contact me, don't use my government email address to contact me? We need to overcome this false narrative that ANCs represent interests of the people. We need more commissioners like Mr. Rubenstein expressing support for what's happening in our communities. I thank you.
Thank you so much. Ms. Deluski, a member of the last panel recommended restricting additional classes of rodenticide. Does Animal Welfare Institute have a position on that idea?
We would support that as well.
Great. Commissioner, you mentioned a tree at 14th and P where you're advocating for rat barrier installation and no agency has risen to the occasion. That's concerning that even our ANCs can't find a willing and able partner for this kind of remediation. What'd you hear back when you reached out to DPW and DC Health?
No one has money in their budget for that kind of mitigation effort. So they can treat, but they can't, apparently don't have money for, wire mesh and stone, that kind of treatment, the physical barriers. And so DOH, DPW, and DSLBD through the Clean Team program, they don't have funding.
Oh, yeah.
I even tried to work with DSLBD and say, if I could come up with the little bit amount of funding,
Could you do
can
it?
the Clean Team do that kind of work?
Yeah.
And I got back, no, it's not in the contract. I was actually asking, amend the contract so they can do that kind of work. That would be really right up their alley.
Is that where you're in the Shaw or Logan? Main
That's
Street?
Logan Circle, but
Logan
that
Main
P
Street.
and 14th
Yeah.
at the outside of the CVS.
Right. Got it.
Yeah.
I've seen them do mesh and stone. I've seen DGS do it at parks, but with a contractor. That may be part of the issue too. Oh, I said I've only ever seen DGS do it, but at parks with a contractor. So that tracks what your experience has been. So you said your commission's been successful at getting rodent control measures into settlement agreements with businesses that need licenses from the Alcoholic Beverage and Cannabis Administration. ABCA recently came under this committee's jurisdiction. Are there any provisions that you think would make sense to extend to licensees more broadly?
Not really in terms of rats. I do have other thoughts on other areas which they leave to the ANCs on the settlement agreement, which I don't think they should.
Well, the record is still open from last week's hearing for like
Okay.
another week. So we'll
Okay.
take those comments
Yeah.
too. Send them over when you're ready.
All right, thank you.
Okay, good. Okay. Ms. Hawkinson, you recommended greater data integration between DC Health and DPW beyond the one-way reporting contemplated in the RAD Act. And I'll have some questions for the agencies later about their data capture and tracking practices. Any particular kinds of data you'd want me to ask them about?
Yeah, we're interested in, so a lot of the bids are doing their own identification of rat burrows, keeping track of that and keeping numbers. We'd love to be able to provide that information to either Department of Public Works and Department of Health and get some information back from them as well. That I think that's one of the quick ways because everyone probably already has that information. Also, scheduling strategic abatement efforts that are going on where Department of Health is going to do the rat abatement efforts. I want to be clear that both DPW and Department of Health have very strong, knowledgeable teams, and they are always accessible. So the issue is empowering them to be more collaborative and then collaboration with getting the data that the bids already have as well.
Great. Thank you. Mr. Branham, I definitely recognize your concern with your past fellow commissioners, but I tend to think the solution to unhelpful behavior by ANCs is for folks to run against them rather than to work around them. That said, are there specific types of organizations you would add into the bill to receive notice alongside ANCs?
Thank you. Let me say that I have served on the board of a Main Street, North Capitol Main Street.
Yeah.
Some years ago. And there are many rats go everywhere. Rats have, they're not restricted to where rats, raccoons, and they burrow into the ground into homes. And there are, the issue is that the agencies, unless the council states that they should receive information and inquiries and concerns from churches, businesses, daycare centers, schools, because it impacts the entire community. And this should not be saying, well, the only community group that we want to hear from are ANCs. And a lot of ANCs are not taking up the issue of voting control. You know, we don't have many Commissioner Rubensteins across the city to do that. My commissioner is one of those that it has worked with, and DPW has been responsive and come out on walks. But we need to think outside our comfort zone and box and say that there are many entities in the community that have issues and concerns about rats, and their quality of life should be people vote, rats don't.
Right on. Though some folks in Ward 1 keep saying the rats are winning. No, that was a campaign slogan this year. It's very exciting. Thank you. I'm going to turn it over to Councilmember Henderson.
I did a event at the National Press Club, and one of the questions was, how can we engage the National Guard in the war on rats? That was a last summer endeavor. Anywho, thank you so much to this panel of witnesses for your testimony. Ms. Hawkinson, thank you so much for being here. You mentioned in your testimony how bids have been keeping some data around, you know, where you're seeing burrows and those kinds of things. Are you guys sharing that info back out with DC Health or DPW?
I will have to get back to you on that. It's on an individual bid by bid case, so I can find out which bids are in fact sharing that information out and to whom.
So funny enough, in the midst of all of us doing this, right, on Friday, DC Health is like, hey, we're rolling out our new rat dashboard. Now, I'm not going to say they did it before this hearing, but the timing seems very interesting. Now, of course, there's some issues with the dashboard in that, like, it's not mobile accessible. So when you pull it up on your phone, you really can't use it. But it's a start. The problem, though, is that much of the data and information is just based off of 311. Which, you know, Mr. Rubenstein, you might do it, and or Mr. Branham, you might do a 311 request, but Mr. Branham, as you sort of said, not every part of the city is made equal. And so even then, there's some underreporting if the only way that we're learning about rodents is whether or not a resident has gotten frustrated enough to decide to report it to 311. So I'm going to assume that our numbers are way off. And also there are whole swaths of the city for whom is not on our radar as a rodent issue.
Yeah, I think that's a fair assumption. I would also add that the difference between someone spotting a rat and putting it into 311 and someone seeing a burrow, which is indicative of, I don't know how many multiples rats, but would prefer not to think about that number.
It's fair. I've learned a lot about rats. Too much. But I honestly feel, though, the public education portion of this is super important. And Kate, I want to bring you sort of into this conversation, because once you realize what, like, the fertilization of rats, how quickly it occurs, how large their litters are, and also the food component to it, I think it makes you start to think a little bit differently when you walk past a public, like a public receptacle that doesn't have a lid, but you see someone has dropped their half of their Popeyes box into the trash can. Now, yay, you put it in a receptacle, and yet now the rats are like, let's eat.
Right, right. And I'm glad you brought up the birth control issue, because the Department of Health was just doing a pilot, and with one of the bids they used as a pilot for that location, which was Adams Morgan, and we still aren't clear on the results of that pilot, and I believe it wrapped up in early to mid-June.
Yeah.
And so having that information would also help us know, okay, this is the baseline from that program and what should we be expecting and looking out for? And then we can also help collect data on that.
Yeah.
And B, as you said, the education is important. BID's already doing that, but we have direct lines through newsletters to community, business, everyone, and can easily add information, additional education information through those channels.
Yeah, I think one of the concerns in terms of the Adams Morgan pilot was that there were like 3 or 4 interventions done at once. So you can't really say which intervention was actually successful, or do you have to do 3 or 4 all at the same time? Now, variety, the neighborhoods are changing. Commissioner Rubenstein, you sort of talked about how on your corridor, you have both residential and commercial. And so you've addressed some of the commercial issues through using APCA, which I think is a very creative way to do it from a liquor license standpoint, but that a lot of the issues are in terms of residential. Is that accurate? When you guys, and they're not necessarily the subject to this, but like, do you report certain buildings to Department of Buildings or to Department of Public Works, and what has been the outcome of those reportings if either a building isn't getting frequent enough trash pickup, their cans are not of the right size, or they just have a rodent issue in their exterior? If you could turn your mic on. There you go.
Well, and I would say in Logan Circle, it's many of the apartment buildings are new. And so they've got a more up-to-date system.
Yeah.
Our problem is the residential.
Townhomes or private residential?
Row houses.
Row houses.
You know, with the DPW pickup. And it really stems from the inadequacy of the containers that are provided by the city.
Okay.
Every container is chewed up. So if we're going to make an impact, we need a better container, and then we can start replacing them, and then we can start enforcing them.
Yeah, I again learned a lot about rats, go down a rabbit hole. So I went back to 2013 when Mayor Gray was like, we're going to replace all the super cans. And that was about a $20 million endeavor over 5 years, give or take. And even now when we were just trying, Councilmember Nadeau was talking about in terms of the pilot that we've been working with DPW for in the public space. And it was going to be something like $2,500 per can. So that is trash and the recycling can. So I don't know what inflation is today, but like just sort of tack it on. If we were to replace every super can in the city, I imagine with the write-up, it would probably be a $40 to $50 million endeavor. Not saying that we shouldn't, but I also feel like we should not go with plastic, or at least the plastic that we currently have if we're going to do it.
I don't think you have to think of the same solution for every part of the city.
Okay.
Right? Because we're maybe denser parts of the city need a different solution than Chevy Chase, right?
Right. Nope, that's accurate. And that's also part of why through our pilot with DPW, we've asked them to try out different models to sort of address the point that you just said, like it's not a one size fits all problem, and it certainly won't be a one size fits all solution. Kate, I was going to ask you a question that I'm now thinking I probably should have asked Holly, but just from a science perspective of, I think for the public, someone might not think that a rodenticide could transfer from one animal to another. Does that make sense? So they're like, no, this is only for rats. So just because the bird happens to be dead right here, it doesn't mean that it's transferable. Do you have some information on that?
Sure. Are you looking for scientific papers on that?
Well, I mean, just for the public awareness. So
yeah, absolutely. These poisons are stored in the body. We see this with different substances, including lead ammunition in wildlife. Anticoagulant rodenticides are another example where when prey species, including fish and small rodents, eat these substances and their body becomes contaminated, then whatever animal preys upon them ingests that same poison and can be affected.
Yeah, that's sort of what we're trying to highlight of, it's not just circle of life, but there are other things at play. We've been joined by Councilmember Louis George. Councilmember Louis George, I don't know if you had any questions for this panel. Okay, all right. What's that? Yes, I know you probably have an opening statement. I'm going to excuse this panel and then Yeah. Okay, great. I'm going to excuse this panel. If you haven't provided your written testimony for the record, please upload it if you can. And then I'm going to turn to Councilman LaGeorge to give an opening statement, and then we'll go to our public witnesses. Go ahead.
All right. Thank you to Chairperson Henderson and Nadeau for holding today's hearing. I'm grateful to be able to join the discussion, and I know the hearing has already been underway, so I will be brief. Oh, you can't hear me. Let me get louder. There we go. Thank you so much, Mrs. Johnson. For the residents, the district rep problem, as you know, is not abstract. It means worrying about rodents near homes, playgrounds, businesses, and trash collection areas. It means dealing with damaged containers, extensive property damage, especially to vehicles, unsanitary alleys, and repeated 311 requests without always knowing what action was taken. As we know, every resident deserves to feel safe and comfortable on their block, and to know that when they report a problem, the district will respond. One of the reasons I introduced the Rodent Abatement and Transparency Act with Councilmembers Parker, Allen, and Doe, Pinto, and Henderson was because the bill was designed to just make the district's response more transparent, coordinated, and accountable to the people we serve. Residents should be able to see where problems areas are being reported, what treatments or corrective actions has taken, and whether those actions worked. And they should not be passed when between agencies or left out of decisions when public litter cans are removed from their neighborhoods. This came up for me in many of my neighborhoods in Ward 4, Petworth, Riggs Park, as so many areas. And I can tell you that neighbors, ANC commissioners work tirelessly to get responsiveness, and oftentimes are left without a level of understanding of what actually has happened, what treatment has occurred. And sometimes what happened is they would treat one area, but not the area. And so we sort of wasted money because we treated one house on the block and not all of the houses. So the rats just moved temporarily and then came back. Not being transparent and coordinated and accountable costs the city money, because we are just doing these efforts and then to no avail. They will be back. And so we wanted to make sure that there was some level of understanding for the community, the public, and the government, so that we can improve the issues, but also be smarter with how we're using our government resources to address those issues. When I introduced the Rat Amendment Act in the fall, one of the requirements was the creation of a rodent dashboard. I was glad to see that DC Health has now rolled out an initial dashboard, and I look forward to discussing more with witnesses who have interacted with the dashboard on sort of what that has produced. I was also proud to co-introduce with Councilmember Henderson the REMY Act, which complements this work by addressing food waste, improving public education, and promoting safer, more responsible rodent care. No single intervention will solve this problem. Residents need reliable trash infrastructure, effective prevention and enforcement, clear information, and sustained coordination across agencies and neighborhoods. And so as I joined the conversation today, I was especially excited to hear residents really come up with some real solutions around these key areas. And I look forward to working with my colleagues, our agencies, and our communities to strengthen both measures and deliver the cleaner, healthier neighborhoods our residents deserve. So thank you, Chairperson Henderson, and look forward to hearing from more witnesses today.
Great. All right, we're going to go to our next panel, Drew McCormick from Animal Defenders International. Okay. George Cooper. Ooh. Is George here? Okay. Tess Kusin. Sorry if you said Kutchin? Okay, Kutchin. And Arman Hansen Chopra. Okay, Mr. McCormick, when you're ready.
All right, can you hear me? Okay,
Yes.
good. My name is Drew McCormick. I represent Animal Defenders International. I'm here to ask you on behalf of our DC supporters to please support these bills. And more recently, I've developed my own rodent problem in my home. And on Friday, about a gallon of rodent urine fell onto me. And I told my landlord about this issue April 29th. I have contacted the Department of Buildings, Department of Health. Nothing has happened. There are stains of rodent urine on my ceiling. I think I'm gonna have to break my lease as a breach of habitability. And I guess I support these bills because they would take preventative measures. Reactive measures have proven to be unsuccessful. And one big reason I'm here is to talk about the use of rodenticides. So not only are reactive measures proving to be inadequate, given my situation as an example, but the rodenticides are not something that we want to use in our community. We talked about how animals and the like can accidentally consume rodenticides and that can injure and kill them. But another thing that we need to talk about that has been hinted at is how these rodenticides stay in the bodies of the animals who consume them, and then the predators of those animals will consume the prey, and it can pass down into their system and spread throughout the ecosystem. Second-generation anticoagulant rodenticides are engineered to kill by causing the victim to suffer from painful internal bleeding. eSCARs also cause widespread bruising, bleeding into body cavities, and blood in the urine and feces. If the bleeding is sudden and significant, then cardiovascular shock and death can result. Bleeding can occur internally and externally and can affect any part of the body. The second-generation anticoagulant rodenticide poison remains active in the animal's body for weeks, passing up the food chain to owls, hawks, foxes, and eagles. Animals who feed on poisoned prey and suffer the same fate: internal hemorrhaging, prolonged suffering, and death. Rodenticides are toxic to many species of birds and mammals, including pets, farm animals, and wildlife species. They are also a threat to the companion animals that live in the homes, such as my cats, who have caught fleas, even though our neighbors have 12 cats and we use the same flea medication. Not a single one of their cats has a flea, but I do. So I would love to see that be taken care of. Second-generation anticoagulants are especially hazardous for several reasons. They are highly toxic. They persist a long time in body tissues. The eSCARs are more likely to be toxic in a single feeding than earlier products. But since time to death is several days, rodents can feed multiple times before death, leading to carcasses containing residues that may be many times the lethal dose. Predators or scavengers that feed on poisoned rodents may consume enough to be harmed. Furthermore, there are multiple humane methods that might do a better job of preventing the rodents from infesting residences such as my own from ever getting there in the first place, such as ultrasonic deterrents, which provide humane solution by driving rodents away rather than killing them, making them ideal for homeowners who want results without harm. The strong scent of peppermint oil is known to repel rodents effectively. A mixture of vinegar and water sprayed in areas frequented by rodents can act as a repellent due to its strong odor. Planting mint around the perimeter of your home can act as a natural barrier against rodents. Small cages and painless traps operate as a home and can act as a natural barrier against rodents. Poison bait can pose significant hazards to curious animals or young ones, but humane traps eliminate these concerns entirely. They use a secure and closed mechanism that ensures only the targeted rat is captured, keeping everyone else safe. Not only does Bill 0707 restrict the use of rodenticides, but these two bills together would create education programs and implement measures to prevent rodent infestations. Bill 0492 would establish a rodent abatement dashboard with publicly available information. I certainly wish I had that before I moved into my house. Bill 0707 would create a public education program to inform residents and their landlords how to prevent rodent infestations. Bill 0492 would also require the advisory neighborhood commissions to notify before trash cans are removed. And together, these bills would implement the preventative measures necessary to prevent this from being an issue in the first place. Thank you.
Thank you. Mr. Cooper.
Good afternoon. As a DC resident in Ward 3, I have had the unfortunate experience of sharing my home with rodents against my will. At the same time, I'm also deeply concerned about the welfare of people and other animals affected by the poisons intended for rats. That's why I would like to speak in strong support of the REMY Act. This act provides evidence-based solutions to managing the rat populations in DC in line with laws and policies in other jurisdictions that have shown great success. It smartly prioritizes education and sanitation while mitigating the harmful effects that poisons can have on children, pets, and wildlife. Both the federal government and many state and local governments have already enacted similar regulations of the anticoagulant rat poisons that this bill restricts. The EPA prohibits selling many of the second-generation anticoagulant rodenticides, which are designed to be especially toxic to consumers. California, Connecticut, Maine, Rhode Island, and Washington State all have restrictions on the sale and/or application of anticoagulant rodenticides similar to the REMY Act, particularly for the second-generation anticoagulants. New York and Vermont are actively considering similar legislation as well. The REMY Act's education campaign also follows in the footsteps of successful efforts in other jurisdictions. New York City has a Rat Academy, which has programs for educating the general public and pest control professionals. Their programs include rat walks, where New Yorkers can walk through the city and see firsthand how human behavior affects rat populations. Public education is essential for any effective, comprehensive rat management strategy. Our individual behaviors, from how we dispose of our trash to how we secure our homes, have a tremendous impact on rat populations. While all of us want to do our part, we can do so much more effectively if we are empowered with the information that we need. Ensuring that waste is properly secured in sealed receptacles, as the REMY Act does, is another essential component of any rat management strategy. A pilot program in Harlem initiated in 2023 that provided sealed containers for trash in residential buildings resulted in a 55% reduction in reported rat sightings. After seeing its success, Mayor Mamdani announced that the city would expand the program to 6 more districts across the city. I'm confident that with similar measures in place in DC, we can do the same. Again, I urge the council to pass the REMY Act. The legislation will provide DC with a comprehensive rat management strategy that focuses on proven approaches while safeguarding the health of DC's children, pets, and wildlife. Thank you so much for your time and for your careful consideration of this important bill.
Thank you. Tess?
Chair Henderson and members of the committee, thank you for the opportunity.
George, can you turn your, okay. Tess, you just have to lean in. Hug it a little. There you go.
Chair Henderson and members of the committee, thank you for the opportunity to testify today. My name is Tess Cutchin and I'm here as a concerned DC resident in strong support of the REMY Act. At work last Tuesday, my supervisor and I heard whimpering and were drawn to our ground floor office window. We saw a squirrel in distress, panting, shaking, and crying with every breath out. We monitored the squirrel, who continued to vocalize and show signs of distress for several hours while we coordinated care efforts. The squirrel was brought to DC City Wildlife, which shared that based on her intake exam, they suspected the culprit to be anticoagulant rodenticide. Because her blood would not clot in the appropriate time, she was anemic, and her radiographs showed less detail in her abdominal region, which often points to internal bleeding, commonly occurring with lethal doses of anticoagulant rodenticides. These rodenticides work by blocking the recycling of vitamin K, which is essential for blood clotting. They can deliver a lethal level of toxin in one feeding, but it can take another 5 to 7 days before the victim slowly bleeds to death, experiencing labored breathing, weakness, shock, and paralysis. DC City Wildlife administered fluids, anti-inflammatories, and a treatment of vitamin K to begin flushing the rodenticide out of the squirrel's system, but unfortunately, after prolonged suffering, the squirrel passed away. This is just one example of a non-target wildlife death from rodenticide, but it illustrates how rodenticides have many unintended consequences, including risks to pets, children, and other non-target wildlife, and ecosystems that can become polluted with poison. We can imagine how difficult it would be to see a beloved cat or dog suffer the same fate as the squirrel. No animal, rodent or otherwise, should be subjected to days of suffering. I support the measures outlined in the REMY Act, decreasing food sources available to rodents by establishing a rodent-proof dumpster pilot program, limiting the use of anticoagulant rodenticides by requiring training and certification for their sale and use, and increasing public awareness for effective prevention and abatement strategies. I urge you to vote yes on the REMY Act. Thank you for your time.
Thank you. Armand?
Hello, my name is Armand Hansen Chopra. I'm a rising 11th grader at Benjamin Banneker Academic High School, living in Ward 4 in Brightwood. I fully support the REMY bill and believe that it will save countless animal lives while making the city much cleaner. The outcome of this bill is extremely important to me, as I'm an animal lover and my neighborhood has many rodents. I'm interning at DC Voters for Animals, an organization that advocates for pro-animal policies this summer to help animals in my home city. Today, there's a large trash issue throughout the city. This trash not only makes streets dirtier, but it also attracts rodents. Many restaurants and businesses use rodenticides as their main way of deterring rats from their dumpsters. Wouldn't it be great if we addressed both the rats and the dangers of rat poisons by making trash bins rodent-proof? That is exactly what the REMY Act proposes to do. A study from the University of California found, and I quote, evidence that invasive rat population levels are highly correlated with human waste quantities. In the experiment, researchers recorded the number of rodents found around the university's dining halls during normal conditions and under simulations of COVID lockdown conditions. During the experiment, rodent populations around the university drastically decreased during lockdown conditions when compared to normal populations. The researchers concluded that efficient waste management is an effective and less harmful form of rodent control over standard poisons. I've always loved learning more about the natural world. This has sparked my immense interest in science, specifically biology, from a young age. I enjoy using research and data to solve real-world problems. For this reason, I believe that it is essential to incorporate the findings of empirical research into city policy. I urge you to vote yes on REMY to keep DC residents and wildlife healthy. I would also like to thank Councilmember Henderson for introducing this bill and helping to humanely manage rodent populations. Thank you very much for your time and consideration.
Thank you, Armand. And thank you so much to this panel of witnesses for your testimony. Tess, your experience, you and your coworker, first off, actually hearing the squirrel, but then also choosing to act on the distress that you were witnessing and things like that. But I think it actually kind of points to something that I don't think a lot of people realize about rodenticides, which is that it's not immediate. Which was a lesson for me to even think that a rodent can ingest rodenticide and still, keep moving for 2 to 3 days or so, which might explain in some cases where, I've walked my dog and I see a random rat in the middle of a sidewalk, which it's very clear that you didn't get hit, you didn't get run over or anything like that. It's just sort of like you drop dead in this particular space. Even though rodenticides are not necessarily immediately impactful, why do we think lots of people still turn to them? And this could be for anyone on the panel, even you, Drew, who I feel like has a lot of knowledge here.
I definitely have a lot of thoughts on this topic. Would love to talk about it more. So your question is, why do people turn to rodenticides?
Yeah, why do people turn to rodenticides even though it doesn't immediately abate your problem?
Well, one, I don't think people know that. I think also too, it's very easily accessible. It's sold online. Anybody can get it. It seems like an easy fix. You say you threw out rodenticide and you think that you've solved the problem and done what you've needed to do. And I think at the end of the day, a lot of people just don't know or don't care.
Okay. Tess, I don't know if you wanted to add anything.
No, I think that's a accurate assessment. I think people who are turning to rodenticides are very frustrated with I think that people who are turning to rodenticides are likely very frustrated with the problem, and it would be better to have preventative measures like trash methods
Yeah.
instead of having people turn to rodenticide.
I think what's interesting in terms of the testimony that all 4 of you presented is the idea that both things can be true. You can be frustrated and not want a rodent infestation and also want us to use a more effective way to stop the growth of the rodent population. Is that accurate? Great. All right. I don't have any further questions for this panel. Councilmember Lewis George.
You covered all my questions. Thank you, but I learned a lot. So thank you so much.
It is really fascinating once you get down into it. And I think actually, is Rat Academy this week? Yeah, DC Health Rat Academy is this week and it's sold out and it's been sold out. And I say sold out, it's free.
Is it? Oh, it's free.
Yeah, but like you got to sign up.
Okay.
Spaces are gone.
I wanted to shout out our Ward 4 student from Banneker over there, though. Thank you. You did an excellent job testifying, and I hope this is the first of many times you come and advocate for your community. Thank you.
Great. Thank you guys so much. Again, if we don't have your testimony, please upload it for the record. We're going to go to our next panel. Blas Fuentes. Sorry if I said that incorrectly. I did? Oh, great. All right. Jim Monsema. Oh. Rachel Downing from Humane Rescue Alliance and Jocelyn Johnson. Okay, Mr. Fuentes, when you're ready. You gotta turn on your mic. Yeah, that's fine. There you go, it's on.
Good afternoon, Council. My name is Blas Fuentes. I am an incoming senior at Columbia Heights Education Campus. I am currently an intern at DC Voters for Animals. I live in Ward 4 in DC in the Brightwood Park neighborhood. I support both the REMY Act and the Rodent Abatement and Transparency Act. I believe that these two bills are a great way to combat the growing rat population that DC has, while also preventing rodenticides and protecting our animals, such as improving our trash and recycling bins would stop these rats from getting food and possibly decreasing their population. Preventing the use of rodenticides would mean that less animals and people would get harmed from these rodenticides. These two bills are important to me because I don't want to see innocent animals getting harmed accidentally over a poison that is not meant for them. Many of us own pets such as cats and dogs, which is why it is important to prevent the use of rodenticides because it can harm our animals other than the rats. While researching about animals that have gotten harmed by rodenticides, I came across the story of a pet chihuahua named JJ in a news article by Animal Poison Control Center. JJ had accidentally consumed a block of rat poison, but luckily his owners acted quickly and took him to the veterinarian for him to get treated. JJ's blood work showed that he could face kidney failure. His treatment was 6 months long. 6 months of visiting the veterinarian. But luckily, JJ pushed through and fully recovered from this. Unfortunately, many other animals face the same problem, but sadly, they aren't able to recover. I chose this story because I previously owned a Chihuahua, and I'm a dog person. But there are countless other animals getting harmed from these rodenticides. Now I ask if you could approve of this bill. This bill will better our safety and the safety of the animals in this community. I want to thank the council for listening to my testimony.
Thank you. Jim?
Good morning. Thank you, Councilmember Henderson, Lewis George, and Nadeau when she gets back. I'm Jim Monsma, one of the co-founders of City Wildlife, the nonprofit that does wildlife rehabilitation in Ward 4, in fact. And I would like to voice our gratitude and our support for these bills, both timely and wise efforts to control the city's rat problem through smart organic trash management and through education. This approach follows the recommendation of rat biologist Jonathan Richardson, who says, quote, cities have to start really embracing this concept of integrated pest management, where instead of just applying poison baits, most of their efforts are dedicated to eliminating those conducive conditions that support the rats. For decades, our city has been relying on poisons, which have proven to be ineffective. There are bait boxes everywhere, and there are rats just about everywhere, too. And the poisons pose numerous dangers to people, pets, and wildlife. It's the latter that I'd like to focus on today. In 2025, City Wildlife, my own group, noticed an increase in the number of wild animals other than rats who were suffering from rat poison. So, with a $4,000 grant from the Department of Energy and Environment and an additional 6,000 from our own donors. We sent over 100 samples to veterinary labs to get results. Now, I will skip this part since so many people have mentioned this, and indeed it has shown up in your own introductory remarks. But one thing I will point out, which hasn't been mentioned, is these hawks and owls that we have been poisoning are providing our city with free, very effective rodent control. Any hawk will eat 1,000 rats a year, owl as well. But now we are killing them for doing this, for providing this free service. I think it's counterproductive. It's not just the raptors. We test other birds are showing up positive, opossums, squirrels, as we just heard, different animals come back positive for the poison. And what's more, we know that from research done by others, the rat poison severely weakens the immune system of foxes and other mammals, and they die of mange. One of the most common phone calls we get, people concerned about the foxes with mange. What they don't understand is that is a rat problem, a rat poison problem, because it compromises their immune system and the animal dies, not necessarily from the poison in every case, but from the mange, which they get because they've consumed rat poison. Even worse, we've now found that rat poison is showing up in fish. It's showing up in bats. Now, bats don't go into these bait boxes, but they get it from the insects. It's getting all through. People eat the fish that they pull out of rivers, and these fish will now have rat poison in them, so we're starting to poison ourselves. The death of these wild animals are an early warning for the dangers of scattering lethal poisons throughout our urban environment. As others have pointed out, and I would like to reiterate, the dangers to people and pets have already been well documented in the district. With all of this in mind, states such as California, Connecticut, Maine, Massachusetts, Minnesota, New York, Rhode Island, South Carolina, Vermont, Washington State, many towns and cities are taking steps to make some poisons illegal and, more commonly, restrict the use of rodenticide to licensed professionals, just as your own bill does. Currently, in our city, lethal poisons can be purchased by anyone. There are even, I'm told by DOEE, poisons that are illegal for professionals to purchase. They cannot be purchased by a licensed pest control agency, but individuals manage to get them if you have an Amazon account. And although it's illegal, people frequently apply the poisons in ways contrary to the label, which is absolutely irresponsible and frighteningly dangerous. Thank you for fixing this. That's very wise. One thing we would ask, in the education portion of the bill, you include a clause, if you suspect that a child has ingested rat poison, here's a number to call. If you suggest that your dog has ingested poison, here's a number to call. Could we add that for wildlife as well? 2 numbers, DC Animal Control, my own organization, City Wildlife. Just 2 numbers added to the bill, because wildlife does get poisoned, as we well know. So thank you for the opportunity to share our thoughts, concerns. City Wildlife supports you. And thank you above all for the thought and the caring that you have put into crafting these bills. They're very promising.
Thank you, Jim. Rachel? Oh, hold on one second. There are too many mics on. So Jim, can you turn yours off? And Ms. Johnson, you turn your, there we go. Great.
Okay. Good afternoon, council members Henderson, Lewis George, and Nadeau, along with committee staff. Thank you for the opportunity to testify today. My name is Rachel Downing. I'm testifying on behalf of the Humane Rescue Alliance in support of both the Rat Abatement and Transparency Act and the Rodent Education and Management Yield Results Amendment Act of 2026. For more than 150 years, the Humane Rescue Alliance has served the people and animals of the District of Columbia. As one of DC's largest community animal shelters, we provide animal rescue, adoption, low-cost veterinary care, and programs that strengthen the bond between people and their pets. We also operate innovative initiatives like our Blue Collar Cats program, which places cats that are not well suited to life as traditional house pets with businesses, warehouses, gardens, and other properties where they can live safely while helping to deter rodent activity. Our work gives us a unique perspective on the importance of protecting both animals and the communities they serve. We strongly support these bills because they recognize that the most effective way to manage rodents is to prevent infestations before they begin. Investments in rodent-proof waste containers, public education, better coordination among district agencies, and greater transparency
will help address the conditions that allow rodent populations to grow while reducing reliance on rodenticides. Our perspective today is centered on companion animals and the people who love them. Rodenticides are intended to kill rodents, but they can also pose a serious risk to pets. Curious dogs may ingest bait directly while exploring a yard, park, or alley, and both dogs and outdoor cats can be exposed after catching or scavenging poisoned rodents. Many pet owners have no idea an exposure has occurred until their animal becomes seriously ill. Our veterinary team has emphasized that anticoagulant rodenticides are among the most dangerous toxic exposures a pet can experience. They can cause severe internal bleeding, weakness, difficulty breathing, bruising, collapse, and death. Because symptoms often do not appear immediately, the window for effective treatment can be very narrow. Once a pet begins showing clinical signs, it may already be fighting for its life. Such cases can be seen not only in our own medical centers, but on a weekly basis at emergency veterinary clinics. This is why prevention matters. One of the things we appreciate most about the REMY Act is that it prioritizes reducing the need for rodenticides in the first place. Public education, improved sanitation, rodent-proof waste storage, and integrated pest management are all strategies that reduce rodent populations while reducing the risk that pets will encounter dangerous toxins. Our Blue Collar Cats program reflects that same philosophy. Every year, we place cats that are not suited for traditional homes with local businesses and organizations looking for a safe, long-term rodent deterrent. These adopters provide food, shelter, and lifelong care, while the cats help discourage rodents from settling on their properties. It is not a replacement for comprehensive rodent management, but it demonstrates that communities have creative, effective tools available that complement prevention efforts and reduce dependence on toxic rodenticides. We also appreciate the RAT Act's emphasis on transparency and coordination. Better communication between agencies and better information for residents will help the district respond more effectively to rodent activity while also supporting animal control officers, humane law enforcement teams like our own, and animal resource organizations across DC. At the Humane Rescue Alliance, we see every day how deeply people care for the animals in their lives, whether they are beloved family pets or working cats protecting local businesses. We believe effective rodent management and animal welfare are not competing priorities. By investing in prevention and promoting responsible rodent management, the district can reduce rodent populations while better protecting pets, the people who love them, and the animals that help make our communities stronger. Thank you for your time, your leadership on this issue, and your consideration. We respectfully urge the council to advance both the RAT Act and the REMY Amendment Act of 2026.
Thank you. Ms. Johnson?
Hear me? Okay. My name is Jocelyn Johnson, and I'm a Ward 4 resident, senior citizen. And I'm really coming from a completely different perspective. I'm actually coming as a result of having talked to 7 pages of people, residents in Ward 4 who have signed a petition to try to get the Department of Public Works and Department of Health and all to deal with our issue of our ongoing long-term rat problem. Someone said in the first panel that people buy rat poison. It's not good. It hurts kids and all that kind of stuff. And the reason that happens, and the people have shared this with me, is because they have not seen action from this council or our mayor to deal with the problems that we have that have made us have what we consider a problem with the rats. We have seen no accountability to the DPW sanitation group. We see consistent, almost on a daily basis, of litter that comes as a result of every time they come to pick up our trash and our recycling, and ours happen, most of us are on Mondays. It's Thanksgiving for the rats every week. And we see if it drops, it stays. They don't pick it up. They don't pretend to pick it up. And I'm talking about corn cobs, peach, the big seed of the peaches. I'm talking about watermelon rinds. I'm talking about dirty sanitary napkins. I'm talking about dirty Pampers. I'm talking about adult diapers. I'm talking about, you name it, it's food product for rats. We have to do something. So we can't say, well, we didn't know that this was not for children. We don't know what's going on, because when we call in our problem, we get nothing but talk. We get good gimmicks. a lot of people have told me as I've gone through this process since April, after we had our walkthrough in our alleys, that we were going to have some concern, a real strategy, which we think is good, that DPW and health are going to go and put rat bait down in every house on the blocks. So I call myself going to the named streets as well as the number streets to get them to sign on the petition. At every house I went to, I didn't just ask for them to sign, but they wanted to give me the story that they had with regard to rats and nobody responding year after year. So what I tried to start doing in last summer was to not just send an email, but send pictures. And it took from last summer to March the 30th to actually get a walkthrough. And I didn't want a meeting just at any time. I wanted it to be on Monday so that when the people come, they would actually see what DPW left behind. We have to do something about that. I don't know about what's going to make the kids sick and all that. We're going to have a meeting tomorrow, which actually Channel 7 spoke about last night on the news. They called it a rat summit because we don't want any more gimmicks. We don't understand birth control for rats because we want to understand if they're getting a birth control, does that mean that the rats that don't get killed or die from poison are going to be allowed to live? Whose house are they going to live in? Your house? Because I've had them in mine. I'm sick of it. And when they come in my house, when they come in our houses, they're not pretty. It's scary. A lot of us are afraid of rats. To me, they're all this big and this high. I want them out. And this is frustration that the people who are coming to the meeting tomorrow are ready to say, council member, staff, whoever, we need help. If it's the bad poison and we don't want to kill dogs, we don't want to kill babies, we don't want to kill cats, but we do want rats to die because they are not fun, cute, pretty. They're awful to us who live in the houses where they've come in. And since we aren't successful in getting DPW to have accountability for the district staff that picks up trash and leaves it behind, then we got to come up with a plan. We can't get the leaves collected, so they live in the leaves. They jump and jump and jump across leaves and trash cans. They eat the cans. It's taken 40 years to say, oh, they eat cans. Plastic is probably like a Hershey bar to them. Maybe they need something like acrylic or metal or something, but plastic don't work. So we need to have some strategy that really works, and we are tired of gimmicks. I got more to say, but anyway, thank you. Thank you.
Thank you, Ms. Johnson.
You're
You want to start? Okay. I'm going to start with the questions. Thank you so much to this panel of witnesses. Jim, your testimony was, I swear I learned something new every day. Had no idea about hawks and the number of rats for which they take care of on a yearly basis. I'm curious, you mentioned in your testimony about the presence of rodenticides also showing up in fish. Is this because of stormwater runoff or some other means?
We don't know is the answer, but the assumption is that insects are crawling into the bait box, eating the bait, which are designed to be attractive to all kinds of different animals, and then land in the water where they are eaten by fish. Again, it's the same thing as going up the food chain.
Okay.
That the fish are eating insects, which is also what happens to bats. Bats don't go into bait boxes,
Right.
but the bats, which control not rats, but control insects, and we're poisoning them for eating insects. So.
Okay. All right. So, I mean, truly the circle of life here in terms of its impact. We're putting it down for one particular population, but others are sort of picking up on it too.
That's the problem.
And I think also in terms of part of the education about rodenticide being that it's a couple-fold. So I imagine that someone is like, okay, as Ms. Johnson says, I'm frustrated, so I'm going to go take on this problem on my own. Fine. I put it out. You don't know, it takes 4 to 5 days for it to operate. So what do? You probably put out some more because you're like, it's not working. And then once you do that, now you really have sort of put this kind of piece out there, but also without having the knowledge of that, it doesn't just go away once it's in your yard. It doesn't just go away once it's in the alley. It's got to go somewhere. It's not evaporating.
Yeah, no, a couple of things. We're all talking about the same thing. Nobody wants rats. We all want effective management, something that works. And my point is, when we end up poisoning all these animals that are helping us control rats, we're doing ourselves a disfavor. No one should have rats in their alley. No one should have rats in their house. No one is saying that. But we need effective. And all the science is saying, listen, as long as you don't control your trash, you're going to have rats.
Yeah.
There's no other way. And the other thing I would say is, a number of people have pointed out that the rats don't die immediately. They ingest these poison. Then they're little rodenticide pills walking around the streets. That makes it much more likely that these hawks and owls are going to pick them up. They have 3 days or 4 days or 5 days to find a rat that's been poisoned and eat it, because they've been poisoned, but they're still walking around, little poison pills.
Yeah.
And they don't get picked up.
Okay. Thank you for that. Rachel, thank you so much for your testimony and and sort of the insights of some of the things that you guys are seeing at HRA. Mr. Fuentes, thank you for your testimony, and hopefully you are learning a lot this summer via your internship. Ms. Johnson, I don't disagree, right? Folks they're tired of the various pieces, but I wouldn't necessarily consider all of our strategies to be quote unquote gimmicks. I think we all know.
See them as gimmicks.
I know, but we all know how birth control works. Well, of a certain age, we all understand it. But I think also, and birth control does not kill. So we know that, right? It's talking about fertility. It's not talking about offing the current population. But part of the reason it's multi-strategy, as I was talking with Jim, is because on the one hand, all right, you need hawks. You need hawks to sort of take care of some of that. You have rats who probably die due to natural causes in the circle of life, aging, etc. And also, if you have a rat that can produce a litter of 12 to 18 per birth, and they can give birth every 21 days, and we're not doing anything about our food, you see how and we're not picking up behind our trash, and we're not doing all these other pieces. You can see how we get to this sort of spiraling of it kind of being out of control. And so it won't be a one size fits all solution, because I think some of the challenges for residential are very different than commercial in terms of some of them all around about the waste haulers and what we're using in those regards. And it's also in some cases what we're doing as humans in terms of human behavior, right? So when you talked about watermelon rinds and things like that, I'm thinking all of that should be in compost. And it shouldn't be in your trash.
But when it falls out of the can and lands on the ground is the point.
Right.
It
And then
stays there.
and then some of those cases too, I think on the education front, right? No one should be putting fresh food, not wrapped, into a trash receptacle, which happens very often. Because, yes, they could chew through plastic, but at least make them work for it. We're not making them work for it.
May I, if I could?
Yes, please.
Because I agree with all of the above, but the point that I'm making is, once it spills out of the can,
Oh, no, you gotta lean into your mic.
Sorry, my bad, because I'm.
Yep.
Yeah. Exactly.
Yes.
Once this whatever spills out of the recycle can and the trash can, and we're watching out the windows, and they leave it, is my point. Once like when they pick up behind the dog, and that's in the plastic pouch, and they put it as part of the trash or the recycle, wherever, and it spills, and they people run over with the trucks, the cars, whatever, that then becomes smushed up poop on the ground with the plastic and blah, blah, whatever. All of that is food for the rats.
Yeah.
And then the part I forgot to say, we have issues with bulk trash. So we have mattresses that stay on the ground. They said when we had our walkthrough, they're not supposed to put them out until bulk trash tells you to do it.
And you're supposed to wrap it in plastic.
We do all of the above, and they don't pick them up. That means in one instance, we had one of our residents that said, and I saw her because she was on the side of me, the mattresses stayed outside for 3 weeks. That meant 3 Mondays. The trash saw it, the recycle saw it. They didn't tell them, hey, y'all better send a truck over here and pick this stuff up because they're not going to take it back in the house. So the rats and the rodents and the raccoons and blah, blah, make homes in it. All of these things, be it trash, recycle, whatever, since the trucks have a broom and a shovel, pick it up. If they don't do it, then we do, we step on the gas and get blah, blah, because we got to kill it because this is coming in my house. And after all these years, and this is before you, before her, before Ms. Nadeau, we have had the frustration of saying it every time we testify. We've told Ms. Nadeau, we've told the trash cans are busted up. They've eaten holes this way and this way. It's a gimmick to us because who cares about a dashboard? We don't need the dashboard to know where the rodents are. They're behind my house. They're in the alley behind my house. I don't care if they're in Ward 8, Georgetown, Palisades. Do something about it. So we won't say it's a gimmick because it looks like anything other than talk about poison. Because everybody's telling me, but you know what, Ms. Johnson? They're going to put down birth control. But we haven't heard anybody say, and poison. So I think the one solution, 2 things I'd like to say is, and
I'm well over my time. So
Okay,
yeah,
but-
it's almost 4 o'clock. We still got a long witness list. So thank
We're
you.
going to have solutions, and we're trying to say, please have residents part of the solution.
Yeah.
And the other thing is the accountability, because if we feel that maybe there's a consequence for leaving stuff behind, and there's no third crew that comes to clean up, put trash cans back where they belong, certify that the alley is clean when you left it, then maybe there's a consequence that might stop some of it. Or maybe there's a good positive thing that if you don't have complaints, they may get an award for it, or DPW could be Department of the Year because all of the complaints stopped.
Okay.
Something got to happen.
Thank you, Councilmember Nadeau.
Thank you so much. What a great panel. Mr. Munsma, your written testimony indicated that spread of rodenticide through the local ecosystem is sort of a new or growing program. You said you got a grant to test harmed animals after noticing an increase in 2025. Do you know why there was such an increase?
It's been blank. Well, Mr. Gerard Brown is the source of my information, happens to be in the room, but it had something to do with the COVID pandemic. Am I right, Mr. Brown?
We can ask him too later, so
okay.
we'll get into it. Yeah.
But yeah, that it had something to do with the COVID, and I don't know what. All I know is we saw the incidents go up.
Got it. Okay, great. I'll let the rest of you go. I know you had a thorough round with Councilmember Henderson, so thank you so much. All right, you want me to keep going? All right. Okay. We will get that. You can send us written to follow up. Okay, great. Yes, ma'am. Thank you. Okay. In person, we have this is a split panel, in person and virtual. So we have Bobby Corrigan, Bob Sisson, and Chrysantha Corniotes. I'm sorry, I may have butchered some names here. Oh, okay. We have some other witnesses who are here in person. Moshe Barber and Ashley Barber and Moshe Ekman. Sorry, got it. Okay. That's 24 and 26. Are there, oh, yeah, come on up. Great. So that'll be a full panel, and virtually, we have Purva Sahijwani, campaign advocate, DC Voters for Animals, and Shira Davidson, Commissioner ANC 1A. Oh, okay. And Chrysanthe is on Zoom now, so we have a robust panel. All right, so we're gonna start with our in-person witnesses. We'll just go in the order that you're seated, but since it's a little different than the agenda, if everyone could reiterate their names so everybody know who's speaking, and then we'll go to our virtual panel. So, please.
Good afternoon, committee members and attendees. My name is Bobby Corrigan. I live in Westchester, New York. I'm a rodent scientist by both degree and by occupation as a consultant. I specialize in designing rodent control programs for metropolises nationally and internationally since 1996. I've authored 2 textbooks, 3 formal textbook chapters, and over a dozen peer-reviewed journals on this subject. I'm here today to earnestly support both the REMY bill introduced by Christina Henderson and the RAD Amendment Act, Bill 0429, introduced by Councilmember Louis George. These proposed bills are important to me because both bills address the scientific root causes associated with the 6 decades of endless cycles of the rise and fall and rise again of rat populations in our cities. I have 2 specific reasons for my support. First, the ecological elementary rule that we actually learn in high school for limiting the growth of any animal population is limited food equals limited population increase. Of course, this is so basic, but quizzically, everyday citizens, businesses, and even cities themselves, after centuries, still can't be mindful enough respective to our everyday food waste. Rats are thriving in our cities primarily because we are completely dismissive of this simplicity. They are not thriving because of the popular lay perception that is due to all the construction occurring in modern day cities every day. Second, if we care at all for protecting the future of the District of Columbia's precious natural wildlife, such as hawks, American bald eagles, owls, fish, and even songbirds, just to mention a few, we must stop the significant environmental damage to the poisons that we use to kill rats are causing to innocent bystander species. This harm has been irrefutably proven by scientists the world over during the past decade. In essence, we now know that each time a bait box is installed out of doors and around our cities and towns, it is essentially an environmental landmine. Many such boxes installed over several blocks, which is very, very common, it equates then to a minefield of ecological threat to that community's wild fauna. Sadly, perhaps 99.5% of the citizens of such a community are completely unaware as to this ongoing diminishment of their coveted natural asset in which they live and enjoy the beauty of their trees, plants, wildlife as listed above. In summary, it is important to note that after 7 decades and millions of tons of rat poison applications in the District of Columbia, we have nothing to show for it relative sustainable suppression of the scores of rats that still plague Washington, D.C. What's more, recent scientific studies, and I'm one of the authors of this, show rat populations among 16 major global cities are still dramatically increasing. And in fact, the District of Columbia leads this list, despite a continuing onslaught of these rodent poisons day in, day out. I sincerely thank the City Council for your help in addressing this important public health and environmental issue.
Thank you.
Hello. Sorry. First I would like to say hello to Miss Henderson, Miss Nadal, and everybody. Sorry. And everybody in attendance. My name is Ashley Barber. I am a junior and rising senior at Phelps Ace High School, an intern for DC Voters for Animals, and I live in Ward 5 of Washington, DC in Fort Lincoln. I care about this topic because I want to go into environmental studies and eventually help our world maintain its natural state. So I fully support this bill and believe that with it, we can effectively reduce DC's rat population. To show that this bill will be important for Washington, DC, I would like to use cats as an example, like before. There are roughly 200,000 cats in DC, and they could suffer from the rat poisonings that aren't even meant to be targeting them. There was an incident on Reddit with a black cat who accidentally ate a rat in their owner's backyard. Fortunately, the rat regurgitated much of the poisoned rat, and the main issue is the owner setting up traps that are designed to administer poison to the rat. According to the top comment, a vet tech recommended calling poison control, but thankfully, the poison is likely in the clear since it was only a nibble and some throw up. I chose this animal because personally I love cats, And I also have two black cats that stay at the house, and I hope that none of this ever affects them in the future. But after hearing the possibility of other animals being harmed by rodenticides, I wanted to give my personal input on this bill and that it should be passed. Excuse me. Finally, I would love to thank Councilmember Henderson for her support in this bill and taking the initiative to help improve the lives of DC residents and wildlife. Therefore, I would like to humbly ask the members of the committee to vote yes on this bill. Thank you very much.
Thank you. Hello, my name is Moshe. I'm here to submit testimony in support of the REMY Results Amendment of 2026. There are a number of reasons why this amendment is important, but one to highlight is the safety of children. Between 1993 and 2008, U.S. Poison Control Centers received between 12,000 and 15,000 calls each year regarding children under age 6 who had been exposed to rat poison. According to the Environmental Protection Agency, the unreported child exposure rate may actually be 4 times as high. When poisoned, children can experience internal bleeding, bloody urine, bloody stools, bleeding gums, coma, anemia, and blood coming from their ears. In one example, a mother put out 2 green blocks of poison and they disappeared. Her 2-year-old son broke out in a fever and his stool was bright green. The safety of pets is another major issue. A few years ago, a man in Manhattan was out for a walk with a 7-month-old puppy named Callie when Callie ate some rat poison. Callie's liver started failing as well as her kidneys. Thousands of dollars worth of dialysis were needed for her to survive. Callie was in so much pain that the man and his wife ultimately decided to euthanize her. The harm does not stop there. Rodenticides work their way up the food chain and harm other wildlife as well. These include mountain lions, eagles, coyotes, and other animals. It is clear to me that rodenticides are not a good solution for rodent population management. A public education campaign on rodent prevention and rodent-resistant trash receptacles are much better strategies. These strategies are outlined in the REMY Act. I want to thank the council members for helping us address the unintended consequences of rodenticides and considering better solutions for rodent management. Thank you. Thank you.
Good afternoon. My name is Bob Sisson, and I am not a resident of the district, but I've owned property in the district for 20 years or so. This is my first visit to the Wilson Building, and I wasn't even aware of these initiatives until a few days ago, but I want to lend my voice in support of them and thank the council members for, and all of the residents who have supported these efforts, these new efforts. I've only got really 2 points. The green rollout containers that we have, I call them child size containers. The district needs to make a major investment by throwing every one of those in the trash and having those recycled. It needs to go to a much larger container, one that can be closed in the alley. Go to Chicago and look at those alleys and look at those containers. I'm over there quite frequently and I see the condition of their alleys. I come back to DC and I am aghast at the level of rat feces and trash in our alleys. I don't know if we should start assigning our street sweepers to go through the alleys like we do on the streets, but something has got to change. It was mentioned $50 million earlier in the hearing about replacing our containers. So what? How much are we spending on painting our streets green and then repainting them green for bikeways? That's important, but on a scale of importance, the cleanliness of our neighborhoods is probably more important. Secondly, there is apparently a policy in the Public Works Department that our trash crews have the responsibility of deciding which containers they're going to pick up if our residents have placed the wrong types of trash into these containers. I submit that should not be happening at all. Our trash crews should pick up 100% of whatever is in those containers whenever they walk by. If there is some enforcement that needs to take place, they should be given pressure-sensitive stickers to put on the containers, but our trash crews should pick up 100%. I don't care if it's plastic in a trash container or vice versa. Everything needs to be picked up in those containers. Thank you again for your willingness to listen to the residents, and I appreciate the opportunity.
Thank you. We'll now hear from Chrysanth Corniates.
Good afternoon, council members Nadeau and Henderson. You can call me Cece, Commissioner, or former ANC Commissioner. Cece is fine. My name is Chrysanthi Corniotis, and I am a Ward 4 resident of almost 15 years, a parent advocate, and a public health policy expert. I thank you for the opportunity to testify in support of Bill 26-492, the RAT Amendment Act, as well as the REMY Act. These two bills are complementary. The RAT Act strengthens transparency and accountability, while the REMY Act focuses on prevention, education, and long-term management strategies. Rodent infestations are more than a nuisance. They are a public health, environmental health, and habitability issue that affects residents in every ward, some wards more than others. Rats contaminate food sources, damage infrastructure, and create ongoing concerns for families, seniors, people with disabilities, pet owners, and businesses, as has been mentioned throughout the afternoon today. As a former ANC commissioner, I spent a lot of my time and focus on the rat issue, given my public health background, and I can cite a couple of examples, one of which is at the senior residence of Todd A. Lee on Kennedy Street. One of my fellow ANC commissioners was actually living there and has not lived there in over a year because of the fact that there was a rat infestation that has caused her to have continuous pulmonary issues, where she has lived in a rehab center basically for over a year now. And we were able to bring Council Member Louis George, the Department of Buildings, the Department of Health into the residence, but because of the management company being complacent, I believe the issues remain at that specific resident, which is again a senior residence facility. And as a mom to a toddler with some special needs, I am very OCD when it comes to requesting that our alleys be cleaned. I remember when I first moved into my home almost 15 years ago, we had alley cleanings on a quarterly basis. That does not happen any longer, and that would be a very short term. If alley cleanings were done more regularly, I think that would have a positive effect for this issue. And finally, I recommend, and I don't want to go over time too much, I use these mint scented trash bags, and before putting my trash into my trash bag, I actually double them. I know that sounds crazy, but my trash cans are in good shape because of that. And so that's those are the two main recommendations.
Thank you so much. All right. Purva Sahishwani.
Hello, good afternoon, council members Nadeau and Henderson, committee members and committee staff. My name is Purva Sahijwani, and I am a DC resident from Ward 3, testifying as part of DC Voters for Animals Education Fund. Through my work, I've had the opportunity to hear residents' rat stories. That's usually ranging from complaints about chewed up rat holes in their trash bins to seeing like rats poisoned by rodenticides lying on their driveways. And it's not only rats who are affected by rodenticides, particularly when they're improperly applied. Rodenticides pose a public health risk, particularly to children 5 and under. According to data from the 2024 annual report of the National Poison System, which is the most recent one available, U.S. poison centers logged nearly 8,452 single substance human exposures to rodenticides in 2024. And of those, nearly 2/3 involved children 5 and under. And honestly, we need better solutions that focus on prevention instead of having DC residents feel as though they have to resort to applying rodenticides to deal with the issue on their own. So the Rodent Abatement and Transparency RAT Amendment Act of 2025 and the Rodent Education and Management Yields REMY Results Amendment Act of 2026 are part of the solution. So the RAT Act, with its focus on data reporting and increased coordination between DPW and DC Health, that helps to increase transparency and fill in key gaps. And then the REMY Act is also key. Walking around alleyways, I always see many trash bins with chewed up rat holes. Once you really start seeing these like chewed up rat holes, you really can't unsee them. And so the creation of the rodent-proof dumpster pilot program is a huge step towards solving this. And additionally, preventing rats requires a community level effort. So that's where the DC Health public awareness provision is really critical. And then lastly, the rodenticide provision is also critical. By restricting anticoagulant rodenticide use to those with the proper training, we are reducing the public health risk posed by improper application. So with so many young children poisoned by rodenticides every year, it's very critical that we apply these restrictions in DC. And then while poison control reported, a lot of the cases of children ingesting rodenticides in the last annual report, less than half were anticoagulant rodenticides. The rest were chemicals such as bromethylene and strychnine, which are powerful neurotoxins, and cholecalciferol, which mobilizes calcium from the bones into the bloodstream and causing heart and kidney failure, and zinc phosphide, which forms a lethal gas in the stomach. None of these has an antidote, and many of these are still available for general public purchase by DC residents. So to protect our communities, I also think that in addition to supporting the RAT and REMY Acts, that we should also consider making all of these restricted use rather than guiding consumers to these deeply potent poisons by keeping them on our shelves. Prevention is very much so the solution that DC needs for rats. Unlike rodenticides, prevention measures help to meaningfully reduce the carrying capacity of rats, thus getting at the heart of the issue instead of acting as a band-aid. By leaving rodenticide application in the hands of those trained while arming the public with the prevention knowledge they need, the REMY and RAT Acts are important public health bills. Thank you for your dedication to building a safer district and for this opportunity to testify. Thank you.
Thank you. Commissioner Davidson?
Hello, is my audio okay?
Yes.
Okay, great, thank you. Good afternoon, Chairperson Henderson, Chairperson Nadeau, and members of the committees. My name is Cher Davidson, and I serve as the Advisory Neighborhood Commissioner for SMD 1A08 in Columbia Heights. I'm testifying today on behalf of ANC 1A pursuant to our resolution R26-0009, which unanimously endorsed the RAT Amendment Act and called for a more comprehensive, coordinated, and proactive approach to rodent mitigation in the district. Over the past year, ANC 1A has engaged extensively with residents, DOH, DPW, DOB, and council offices on this issue, and this testimony reflects what we learned. I want to begin by thanking the sponsors for introducing this bill. This legislation is addressing what has become an urgent issue. Rodents are not simply a nuisance, they are a serious public health issue, a pervasive quality of life issue, and a continuous equity issue. This rodent epidemic has become a defining characteristic of our city. Something has to be done. In Columbia Heights, rodent infestations are among the most common concerns we receive. Rodents damage trash and recycling containers, chew through vehicle wiring, infest homes and businesses, discourage uses of parks and public spaces, and diminish confidence that the government can effectively maintain the public realm. These impacts fall disproportionately on neighborhoods like ours with a high population density, aging infrastructure, extensive construction activity, and urban heat island conditions. The district's very new rodent control dashboard is a promising first step towards transparency. It also underscores why this legislation is needed. Ward 1 generated more 311 requests than any other ward, representing approximately 21% or 1 in 5 of all rodent complaints citywide. While these 311 data illustrate the severity of the problem in neighborhoods like ours, they should not continue to serve as the sole measure of need or success. 311 data cannot wholly capture the extent of need or what interventions prove successful. It captures who has the time, awareness, access, and trust in government to make a report. We can no longer approach this issue reactively. Nearly a decade ago, the district actually reached the same conclusion. In 2017, the Office of Budget and Performance Management CAPSTAT rat abatement report recommended proactive electronic data tracking, expanded public education, stronger interagency coordination, and modernized enforcement, among many other interventions. Those recommendations remain highly relevant, but still most not implemented. This bill provides an opportunity to finally translate those recommendations into action. One provision that we particularly wanted to highlight is the emphasis on interagency communication. Requiring DPW to notify DOH when inspectors observe rodent activity is respectfully way overdue. This coordination capitalizes on existing capacity, it can be implemented without significant funding or resources, and it prevents the duplication of efforts. We know that where there is trash, there are rats. Solving this issue requires thoughtful interagency coordination. ANC 1A also strongly supports the bill's enforcement provisions. In Columbia Heights, we unfortunately frequently encounter negligent property managers and chronic noncompliance that allow rodent conditions to persist for months and sometimes years. Without meaningful enforcement, responsible residents and neighboring property owners bear this consequence of others' inaction. However, enforcement must be paired with education that is accessible and multilingual, and both actually reaches and appeals to the individuals contributing to these issues. Residents, businesses, and property owners want cleaner neighborhoods. They want fewer rodents, but many simply do not realize that their actions produce the conditions for rodents to thrive. Education and voluntary remediation must be the first step. At the same time, where repeated violations do continue and property owners are not responsive, enforcement must be timely. Design and implementation of this legislation must be thoughtful and not create administrative or financial barriers for residents most impacted by rodents. I implore your committees to ensure this legislation is fully funded. Legislation is only as effective as it can be implemented. Moreover, investing in proactive rodent mitigation is fiscally responsible. Preventing infestations reduces the need for repeat inspections, repeat baiting, property damage, and other costs to the district. Finally, I encourage the committee to consider strengthening the bill's long-term goals and overall reach. Requiring DOH to produce a report is a significant step towards transparency and accountability. However, the district should not allow planning to become a substitute for implementation. Cities such as New York have demonstrated that aggressive coordinated investment can produce measurable and timely reductions in rodent activity. The district should be equally ambitious. There must be measurable benchmarks, regular public reporting, and sustained investment. Furthermore, DOH and DOB must be granted expanded authority to access, remediate, and secure rat-infested, vacant, blighted, or chronically non-compliant properties. These function as uncontrolled breeding grounds and undermine surrounding abatement efforts. The council should further explore ways of providing vouchers or subsidies to residents and commercial establishments to improve waste infrastructure. In sum, ANC 1A strongly supports Bill 26-492, the Rat Amendment Act, because it moves the district towards a smarter, more transparent, and more proactive approach to rodent control. We respectfully urge the council not only to pass this legislation, but to fully fund it, its implementation, and continue strengthening it so the district's ambitions match the scale of the challenge facing our neighborhoods. Thank you very much for your time and consideration, and I'm happy to stand for questions at the appropriate time.
Thank you very much to this panel. I don't have questions for everybody, but I did want to ask Mr. Corrigan, we've been hearing a lot today about the harms of anticoagulant rodenticides. The REMY Results Act wouldn't fully ban them, but would limit who's allowed to deploy them. What do you see as the appropriate context for the use of these poisons?
You know, having them only available to professionals, trained professionals, is one step, but it's not enough. There has to also be criteria as to when the professionals are going to employ them as well. If the professionals have them and there's no restrictions on them having them, a lot of times you can't make any money as a pest control company if you simply say you need to clean up your trash.
Yeah.
So people are very, this was discussed earlier, people are mostly, they want to do something. They want to use something. You know, we're a species that, you know, we feel if we can spray something away, we'll use a spray can, right? If we can use a magic device, we'll use that. So it's a case of, I think these are tools They should be used very, very carefully, even by professionals and under very specific situations. And after they've been used, they should be collected and back to non-essential second-generation anticoagulants.
Thank you. Very helpful. For folks who can't make it to your education session in DC this week, what should we look for in an effective rodent management education program?
You know, as I sit here today, it's been very rewarding. You know, I mean, I've heard tremendous things come from the different panels, right? And much of it's been covered as to how essential it is to have the complete package. And I think both of your bills address many of those issues. But in the academy this week, we basically tried to start at root causes and stress the reasons for rats, just like we heard today. And I've been teaching this for years and years to my students at Purdue University. No food equals no rats. But yet, it's tough to get us to do that at all the levels, not just the residents, but, you know, businesses. And there's been a lot of talk about dumpsters and rodent-proof dumpsters. That alone is not going to do it, right? We have to go deeper and deeper. We have to even include, make sure the cities themselves are doing their trash management policies and practices and procedures correctly. So at the Academy this week, we're going to talk about, you know, how important it has, you know, we call it a toolbox in New York City, an IPM toolbox. So we stress, of course, sanitation, we stress exclusion, we stress non-chemical, and as a last resort, we stress chemical. But the other piece of that toolbox is we have to, and this was mentioned today, we must start incorporating strong data management into these. These are rodent populations, not rodent individuals. We have to manage these populations the same way we manage trying to increase the whale populations of oceans, you know, and fish populations. We have fish biologists that do that. But the way it is for many, many years is when you see a rodent, put out some poison. When you see a rodent, put some dust on a burrow. We don't address populations. So at the Academy, we're going to strongly suggest we have to look at this from neighborhood level, not property level.
Great. Thank you for that. I appreciate it. And Mr. Sisson, I definitely hear your frustration. I mean, I think everybody agrees here that we want clean alleys and we want less trash. But one of the reasons we have smaller trash cans than we did in the past is because we are trying to reduce the amount of landfill waste, right? There is a mission here. We are trying to reduce the amount of landfill waste. We are trying to increase recycling. And for the past several years, we've had a municipal composting program, which gets the food waste out of the waste stream. So I want to make sure you understand, we don't want to go back to super cans. That's the wrong direction. But we do need households to work with us. So what do you think is the resident responsibility when it comes to trash management?
We have a rooming house that we've just invested significant sums in remodeling on 16th Street. And we have people coming and going all the time. And we have people going and coming at all times. So it's very difficult for us to keep everybody educated as to what they're supposed to do. And frankly, I have not used the compost program yet. We have a private trash hauler, and the dumpster is always a mess. The lids aren't close to closing. And so the property owners need to do a better job. You know, if I can find a company that can give me a 100% closable lid, I'll do that. But I don't know if that exists yet.
Yeah. Okay. Well, I appreciate that additional info because I think it's an acknowledgement that we all have to play our part here and that it's hard. I mean, you have direct contact with your tenants and it's still hard to get them educated. And DPW does a lot of direct education, as does DC Health. But we all have to work together and also share this common goal. And I think the green cards say it all, right? That Ms. Johnson left behind.
Could I say 10 more seconds? The smaller containers are, you know, they have a high center of gravity,
Mhm.
so that when people pile trash on the top of them, they topple over
Okay.
more easily.
Yeah.
So I don't know that I can agree with your statement that that's not the direction to go in to get the bigger cans.
Well, I think frankly, the direction to go in is a pay to throw model where people pay more for the more trash they produce because that's how we have to clear it as a city. That will be politically unpopular, but I can say it because I'm not running again. But that's what you have to do to reduce trash. You may have heard earlier, we did pass a law last year, 2 years ago, the Clean Collections Act, that does require commercial haulers. Yeah, wow. Speak of the devil, she appears. So that sort of mandates the number of containers you have to have per household, per in the building, et cetera. And so all of the hauling companies now are supposed to be following those guidelines and working with multifamily buildings. I don't know how your contract works, but the point is that there's meant to be enough containers per household, per building now. And if there's not, there are fines, et cetera. And the same has to go for single family homes. So some have more than one container, for example, if they have more trash. But at the end of the day, I think we need to go the other direction because, I mean, I would love for my kids to not have to worry about their world being taken over by landfills. Okay, I digress, but I think we agree on a lot of things here and just we have to work through the various aspects of it. Okay, so I'm going to turn to my colleague, Councilmember Henderson, for 7 minutes, and then we'll go to Councilmember Lewis George if she wants to. I know you may not want this panel, but I'll let you. If you want another 7, you can have them. Okay.
Okay. Thank you, Chair Nadeau. Thank you so much to this panel of witnesses. First, I'm going to start with Ms. Barber. Thank you so much for your testimony. Again, I hope you're learning a lot through your internship this summer. And, you know, lots of people have animals and pets. There was one fateful day that my dog was in the backyard for a little too long. And then he came to the door and I told my husband, you deal with it. Because he came to the door with a rat in his mouth. And I was like, I can't. That's on you. He doesn't go out in our backyard anymore. And so there's that. But I'm sort of thinking about where you're talking about from the cat perspective of like, it's crazy to sort of think that could have been it could be deadly for my pet because of, you know, him killing a rat that, anywho, nonetheless, thank you for your testimony. Dr. Corrigan, the legendary Dr. Corrigan, I've heard that your presentations at the Rat Academies stand above all. So thank you so much for giving more of your time and being here and being part of this hearing. I wanted to ask from your experience in terms of the work that you've done in New York and other places, why can't we get the trash cans correct in terms of ones that are, they close like Mr. Sisson was talking about, they can't be breached by, you know, the rats sort of breaking through. What's the friction here?
You know, we can do, this is not that complicated. And it's been proposed many times. And at a city level, the pushback always ends up the budget. And the pushback always ends up like, you know, and to be honest with you, having spent my whole life with rats as vermin, anything that's mentioned for vermin in city legislation always falls to the bottom of the list. It always has. And so here we are, you know, at this hearing, what have you, because it's really come to a critical point. But for many, many years, in fact, all the way back to 1910, rat scientists back then were saying rat receptacles need to be made rat-proof and garbage has to be maintained in a certain way. But nobody was listening. That's 100 years, more than 100 years. So can we design rat-proof containers, litter baskets, dumpsters? You know, we're using pilots in New York City right now called Empire bins. They definitely are rat-proof.
Yeah.
Okay, but it took.
Wait, you said they're not rat-proof?
They are rat-proof.
Okay, I was like, wait, y'all spending a lot of money in.
Yes.
Yeah.
Yes. But it's just this money pushback constantly. And some of it's operational within the cities. Like, you know, we could get those cans, but they're going to take more effort to empty them or to collect from them and what have you. And so it's a very complicated issue we end up in, and it's a conundrum. And so, but because it's vermin, we tend to dismiss it and move on to the next item on the budget.
But then it's costing more money on the back end. Because I'm sort of thinking about, like, again, when we did the trash can receptacle replacement in 2013, 2014, it was this huge headache because, one, no shade to our wonderful staff at DPW, but like all of these old trash cans basically ended up in a dumpster. They were not properly recycled. It was a whole to-do. And we spent millions of dollars on a model that we knew wasn't sustainable. And I'm kind of thinking to myself, like, if we had taken a beat as opposed to just trying to be very reactive, I believe that was a election year, perhaps, right? We might have been able to find something in another way. The Empire bins in New York, though, are not for residential.
They are for residential of certain sizes. for
Okay.
31 units and larger, the Empire bins. You know,
Okay.
and then there's smaller, different types of receptacles for units that are smaller than.
Are there any other cities who are doing this better?
You know, we just did a pretty extensive, we call it the Boston Rat Management Plan, BRAP. And Boston right now seems to be one of the leading cities that have taken rat management to a higher level. They're looking at everything from rat-proof litter baskets on streets to really going after and enforcing bad actors, as we call them, in businesses and residential areas, and getting government, the Mayor Wu, the Mayor of Boston, very, very aggressive on this particular issue, because they too see, just like you do, they see the populations increasing to an alarming rate.
Yeah. And again, it's sort of cyclical. I know you sort of talk about the budgets. The budget piece is real, right?
Sure.
Because we can't carry a deficit, so we gotta pay for it some
Yep.
way. But if we don't pay for it now, then there's property damage, there's this, there's that, and all of these other issues that kind of come on the back end. Mr. Assistant, I just wanted to mention really quickly, the clean collections bill that Councilmember Nadeau is talking about. I had a provision that was included in that legislation, which dealt with cooperative buildings and condominiums. So I don't know if that hits your 16 or your the home that you have on 16th Street, but essentially the city, we do trash and recycling pickup for a single family residential, but if you're in a larger building, then it is your responsibility. One of the things that we are supposed to be doing, well, we do, is we provide essentially a tax credit back to residents who are at condos and cooperatives, basically to say, because you're using your tax dollars to pay for a service that you're not actually benefiting from. Only problem is we haven't updated the credit in like multiple decades. So for some of these buildings, they're like, yeah, well, the $100 that you're giving me as a tax credit is not enough to pay for the waste hauler, which is why we're starting to see for some of these residential buildings, either you don't have the right size, you're not getting the frequent pickup, et cetera. And anyway, OTR is supposed to be doing a report to talk about what should the new credit be in comparison to the market research. So hopefully that can help a little bit. But I'm mentioning that to just suggest that like we are trying to hit this from all various angles as best we can. But hopefully with the next administration, a bit more urgency. And with that, I'm done. Thank you.
Thank you. You're good, Councilmember?
Yep, I appreciate this panel. And some of you I will reach out to because I want to talk to you more about what the future of that looks like, of urgency looks like. Thank you.
Very good. All right. So we appreciate this panel. Thank you very much. You are free to go. I'm going to try to pull together a last panel. I just want to double check. Is there anyone else in the room who signed up to testify? Or anybody in the room who didn't sign up but desperately wants to talk about rats? Okay, so we're going to finish up our virtual witnesses now then. Okay. I am reading from the list of virtual witnesses who we see in the Zoom. If I don't call your name and you are in the Zoom to testify, please raise your hand. Annie Acosta, Josh Jacobson, Alka Chandna, Tanya Martin, Sage Max, Joe Gravel, Stephen Franz, owner and director of Global Environmental Options, Amanda Brady, law clerk, Center for Biological Diversity, Karen Gall, chairwoman, public safety director, 3D CIC Community Safety Foundation, Inc., Megan Striegel, senior director, public policy, National Pest Management Association, Joe Bishop Henchman, chair, Advisory Neighborhood Commission, 5F, Rachel Johnson, Allison Shaw. If I said your name without any sort of organizational affiliation, you will be getting a 3-minute speaking opportunity, and the others will have 5. So we will begin with Ms. Acosta. When you are ready, you may turn on your camera, unmute, and give your testimony. Ms. Acosta, if you're ready, you can begin.
I'm gonna tap to unmute. Okay. Can you hear me?
Yes.
Okay, great. Can you see me? I pressed the button.
We cannot see you.
Oh, okay.
But we will be happy to take your testimony even without your video.
Okay, thanks. Anyway, thank you very much for the opportunity to testify. My name is Annie Acosta, and I'm a longtime resident of Ward 3, and I'm also a supporter of the Rodenticide Coalition. We're hearing a lot of great testimony on the significant harms of anticoagulant rat poison today. I share this growing concern and voice my strong support for the 2 bills under consideration today, the REMY Act and the Rat Amendment Act. I'd like to share my personal story of an aspect of rat prevention that has not gotten as much attention, and that is composters. I've learned quite a lot about them recently after discovering that I had inadvertently been housing a small family of rats in my backyard composter. Like many people in my neighborhood who are concerned about the impact of food waste on the environment, I applied for the city's popular compost pickup program and was put on the wait list. In the meantime, I set up my own composter. I found many different products online, from solar digesters to indoor electric composters. I started with buying a solar digester from Walmart, and this turned out to be a complete farce, not coming remotely close to the promised 2 pounds of food digested per day, in addition to attracting the rats. After ditching the solar digester, I then began looking into indoor kitchen composters. On Amazon, I found 173 products ranging in price from the low 200s to a whopping $4,300. The advertisements promise odor-free and rapid breakdown of food scraps. They also promise rich compost that can be applied immediately to a garden. But here's the problem. Most of the supposed composters are just food dehydrators and grinders. In other words, they make for a great variety of items in a delicious rat buffet. Fortunately, the other type, which are called microbial composters, do not produce rat-friendly food. But because they rely on living organisms rather than heat, they're a lot slower. They take days to weeks instead of just a few hours for the compared to the dehydrator grinder version. But why would consumers choose the slower product if they don't know about the risk of attracting rats? The vendors certainly don't mention this risk. Only a public education program would do that. I look forward to the enactment of the REMY Act and the implementation of its public education program to include composters, as they are both part of the solution and the problem in controlling rats. Thank you for your time and attention.
Thank you so much. Mr. Jacobson?
Good afternoon, Chairpersons Nadeau and Henderson and Councilmember Janice Lewis-George. My name is Josh Jacobson. I am the chair of ANC1E, but this testimony is in my personal capacity. I appreciate the council's work on legislation to reduce the district's rodent population in a more humane and effective way. My concern is that DC Health's current rodent fertility management pilot, as designed, will not produce the evidence the district needs before deciding whether to expand the use of these products. Earlier this year, I connected with 2 of the world's leading experts in rodent control and fertility management. I've attached a resolution from ANC1E in my uploaded testimony that discusses their credentials and encourages rodent control to meet with them. I've now participated in 2 meetings with rodent control team and these experts, where myself and these experts have raised concerns about both the evaluation design and the products being considered. Each pilot location follows this sequence. In week 1, a rodenticide is placed in the burrows. In week 2, a tracking powder rodenticide is used, followed by burrow closure. In week 3 and weekly thereafter, fertility control products are deployed. DC Health is starting with contrapest and also considering Evolve. Throughout the pilot, DC Health provides education to residents and business owners on the importance of trash management. These interventions are layered together in a short period of time. If rodent activity declines, the district is not able to determine which specific intervention or combination of caused the decline. The purpose of a pilot should be to answer the question of how to effectively reduce rodent populations. If the district is testing whether fertility control is ineffective in urban conditions, then the evaluation design needs to be able to measure the fertility control intervention independently. Otherwise, DC may invest in products that are much more expensive without knowing whether they are effective. The best evidence for contrapest is in a lab-based setting where the entirety of a rodent's food source is controlled. It takes upwards of 50 days of a rodent eating the bait to reduce fertility. These products perform differently in controlled settings than they do in urban neighborhoods, where rats have many competing food sources. Bait uptake, repeated consumption, sanitation conditions, and site selection all matter. If these issues are not built into the evaluation design, the pilot will tell us very little about whether these products work at scale. Evolve has similar issues. In addition to limited evidence for efficacy in urban populations, Evolve lists cottonseed oil as the active ingredient, but gossypol is what impacts fertility. Repeated exposure of gossypol causes death in pets and wildlife, and so DC Health should explain what they are doing to prevent that exposure before deployment. I respectfully ask the council to take the following actions. First, direct DC Health to revise the pilot's evaluation design so that fertility control treatments can be measured independently before additional locations are enrolled. Second, request a public briefing from DC Health on the pilot methodology, including how the agency will address confounding variables, bait uptake, site selection, outcome measures, and non-target risks. Third, withhold any scale-up of fertility control products until interim data shows that they are effective in real urban conditions and can be used safely. And lastly, hold a public roundtable with DC Health and these independent rodent control experts on best practices for rodent fertility management. I'm also happy to connect your offices with these independent experts if that would be useful. Thank you for your time.
Thank you very much for your testimony. Alka Channa? You'll need to unmute.
Sorry about that.
That's okay.
Good afternoon, all. Thank you for the opportunity to testify. My name is Alka Channa, and my husband and I have been homeowners in Ward 4 since 2011. I'm here today in support of both the REMY Act and the RAD Act of 2025. I'm particularly encouraged that both bills emphasize prevention rather than poison. The evidence, as you've heard today, this afternoon, is overwhelming that rodenticides are failing to solve our rodent problems while creating new ones. Just over the weekend, I read about a study in which Rutgers researchers analyzed rats and mice from New York City, our fair district, Washington, D.C., New Jersey, and the Philadelphia region. Roughly 70% of the mice they tested carried genetic mutations linked to resistance against commonly used rodenticides, meaning that the poisons that were intended to eliminate rodent numbers may already be far less effective in a large share of the population. The researchers also found that rats are becoming increasingly adept at avoiding traps and other extermination methods. We cannot win a chemical arms race against rats and mice. Each escalation simply drives new adaptations while leaving everyone else to bear the consequences. As others have testified this afternoon, the consequences extend far beyond rodents. When we put poison into the environment, other animals inevitably pay the price. Throughout my adult life, I have had the distinct honor of sharing my home with many beloved cats. So I was deeply distressed to read a study published this spring in the Journal of the American Veterinary Medical Association. The researchers documented entire litters of nursing kittens poisoned by bromethylin after likely being exposed through their mother's milk without ever directly contacting the bait themselves. The kittens suffered tremors, paralysis, seizures, and sudden death. If you go to the paper, which is in my written testimony that I've submitted, you can find videos of this. Some showed evidence of neurological injury for up to 46 days. The study also noted that these poisonings are difficult to diagnose and that bromethylin poisoning has increased as restrictions on anticoagulants have shifted the market toward this even more dangerous neurotoxin. Now, this final finding is especially important because Bromethalin would not be prohibited under the REMY Act as it's currently drafted. If our goal is to protect wildlife, companion animals, and the broader environment while moving away from ineffective poison-based approaches, the legislation, I believe, should include all rodenticides, including bromethalin. I know my time is up, so I just want to thank everybody very much, the council members who introduced and supported both acts, and everyone for your attention. Thank you.
Thank you so much. Ms. Martin? Ms. Tanya Martin?
Hello, this is Tanya Martin. I'm a Ward 4 resident for life. I'm born Washingtonian. And I'm going to just say, we had to create an act. It's almost like council act like we just all of a sudden just started having rats. Rats have been, I've been talking about rats for 6 years. So at the same token, we're in an election, now we got to create an act in order to curtail rats. It's out of control. Ward 4 is a new ghetto. You ride around Ward 4 and it smells a stench of trash, filth, dirt. It's shameful. You don't even smell fresh air in Ward 4. What is going on? What it is that you ride around. I'm a trash can police. I ride around every public city trash can is filled to the rim. People are taking bags of trash. I don't know what kind of people is in this city, and they throw it on the corner where you see a public trash can. What you think? What it is? Rats, birds, all type of rodents. I don't know what's going on. It's unacceptable. Why do we need all these public trash cans on every corner? You go up Warner Street. They have Bruce Monroe Parkview Elementary. They have 5 trash cans around one school. And when you ride up there, every last one is full to the rim. It's just unacceptable. The air, it's a stench in the air. And this is Janice, Georgia. This is her ward. There's filth in where I live at. Illegal dumping. You can't even get a legal dumping sign when people just throw stuff on the corner. I guess they think that when you walk out in the street, that trash people are like, oh, there's some trash, let's pick it up. That's not how it works. They're not gonna ride down the street, see trash, and just pick it up because they're garbage men. That's not their role. And so someone needs to explain to you, why do we need to act in order to do it? And we gotta wait. You should have been doing this years ago and coming to the community and asking the community what kind of trash can. No, you just go get a trash can. Didn't even check it out. If you look through the alley, all the trash cans is holes in the trash can. I'll pay for my own trash can if that's going to deter these rats. It's out of control. I walk around my neighborhood. I'm doing run for ANC 4C07 because my ANC is doing nothing. And people, all they talking about is rats, rats, rats. People can't even sit on their porch and enjoy the fruit of their labor because there's going to be rats running around. So explain that. All of a sudden now we need to act in order to do something about it. And I don't believe none of these acts going to do nothing. It's a scam. It's just to say something. Because I can guarantee you the same thing is going to happen if we don't get these rats in control, get people's behavior in control, and remove some of these trash cans. That's what it is. And I got pictures. I got so many 311 calls about trash. It's unacceptable. So tell me why we had to get an act in order to do something about rats. Thank you
very much for your testimony. Next, we'll hear from Sage Max.
There, thank you so much, council members Nadeau and Henderson, and Janice Lewis-George, committee members and the committee staff. I really appreciate all of you taking the time to hear us today and for caring about this issue. I can tell that you really care and you ask great questions. So my name is Sage Max. I'm a resident of Ward 2 in Foggy Bottom. I'm also a passionate part-time nanny, and I look forward to raising kids in DC in the future too. So I'm testifying today in support of the REMY Amendment Act and the transparency measures in the RAT Amendment Act as well. And I want to focus my testimony on one piece of the REMY Act that I think deserves the committee's full attention, which is the requirement that anyone selling or applying anticoagulant rodenticides in the district be trained and certified first. And I'm going to focus on how dangerous these products are for children. So I've done a modest amount of research to prepare for today. Can't guarantee that I can answer any of your good questions, but I've learned so many fascinating things about the topic, so I'm sorry for a little info dump. But I'd like to ask you all to consider these chemicals from a child's point of view, because a child's body handles poison very differently than an adult's. An infant's brain, nervous system, and organs are still developing after birth, and a baby's liver and kidneys can't clear toxins the way that an adult's can. Children also breathe faster and have more skin surface relative to their body weight. Fascinating. So they absorb more of whatever is in their environment pound for pound than adults do. So they live closer to the floor as well. They crawl on the carpets, they touch baseboards, they play in yards. And that's often exactly where a bait station might be tucked out of an adult's sightline, but well within a toddler's reach. And young children, of course, explore the world hand to mouth, which has been a source of stress for me as a babysitter many times. So you can imagine how a stray rodenticide pellet that looks like nothing to an adult can look like candy to a 2-year-old. I believe one of my colleagues may have shared statistics earlier. One of the other people giving testimony, that a study in 2024 found that there were 5,416 cases involving human exposure to rodenticide, specifically in children under 5, and that resulted in hospitalization. I'm running out of time. Okay, so anticoagulant rodenticides are a particularly dangerous category to get wrong because they don't announce themselves. Skip ahead. A case published last year in Frontiers in Pharmacology that I've linked in my testimony described a pregnant woman who was accidentally exposed to one of the chemicals, and she had no idea that anything was wrong until she developed sudden nosebleeds and blood in her urine. And by the time that doctors identified the cause, her coagulation levels had collapsed and her baby had suffered a fatal intracranial hemorrhage in the womb. So I'm going to skip ahead a little bit and just say that these kind of things are the gap that REMY closes. Requiring certification before these products can be sold or applied means that the person setting the bait in a row house, basement, or an alley behind an elementary school actually understands the placement, storage, and risk to the small bodies nearby. Thank you all so much. I urge the committee members to move both bills forward, and I thank you for the opportunity to testify.
Thanks very much. We'll now hear from Joe Gravel.
Oh, hello. Thank you everyone for your time. So I'm from Ward 1, and I'm submitting this testimony in support of B26-707, the REMY Results Amendment Act of 2026. It funds rodent-proof trash receptacles for small businesses in DC's worst rodent hotspots. Rat management has been a problem on my block for years. The garbage bins of the coffee shop across the street are filled with chewed-through rat holes, and they house a ton of rats. Occasionally, someone will do the normal things like fill rat burrows with dirt or cement, lay out rodenticide, but the rats always come back. A few weeks ago, a neighbor had to take their dog to the vet after a close call with the rodenticide. Sadly, this is an issue that affects pet owners all over the city. As we've heard from so many people today already, the American Society for the Prevention of Cruelty to Animals, this rodenticide is the 7th most common pet toxin in the US, accounting for 6.5% of all pet toxin exposures. While usually treatable, rodenticide exposure can be fatal for pets, and there's plenty of cases in the news. For instance, NBC covered a high-profile one of not high-profile, but a dog, Callie, dying days after eating rat poison. I'm hopeful that this act can be a step towards targeting the source of rat problems in DC without putting other animals in danger. Thank you again. I'm supportive of both acts, but specifically, I wanted to talk about REMY.
Thank you so much. Next, we'll hear from Stephen France. Yeah, you got to hit your button there. Oh, there it is. You're good.
Oh, it is?
Yep, now we can hear you.
Excellent, thank you. The opportunity to hearing what chemical biologists deal with disease systems, but just for decades. Like Johnson, School of Hygiene and Public Health, consultant, research for CDC, development.
Mr. France, I'm going to stop you. Your audio is really weak. I'm wondering if maybe you turn off your camera. It might strengthen your audio.
Turn off the camera?
Yeah, let's try it. I want to make sure we hear your words as much as I'd love to see your face.
Let me see. Let's see if this works. I'm not sure. Wait, maybe I just click on it. Yeah, I
Yep,
did.
that's it. Yep, try now.
That
I was
help?
hearing about every other word before. It's something about the signal, so this should make it easier. Go ahead. You proceed.
Does that help? I mean, it works?
Yeah, that's actually much better. Thank you.
Okay. Well, anyway, I consulted and conducted research for CDC, the World Health Organization, internationally, nationally, India, Iraq, Kuwait, Trinidad, etc. And I support both REMY and RAT acts, but I have lots of questions, most of which will probably end up in my written testimony. But we have to remember that the immediate problem here is to manage, not necessarily to control. And control is really a euphemism for kill. And successful rodent management sometimes is as simple as sealing a hole or closing a door. Habitat manipulation may often be accompanied by trapping or rodenticide baiting, both of which should be considered supplemental measures to more permanent interventions that reduce food, water, and shelter resources. Basically, we're trying to reduce the environmental carrying capacity of rat populations. So I base my work on, well, I was going to say, about half of the problem is rats, the other half of the problem is people. And I base my work on integrated pest management. I won't go into that now, but it provides effective alternative interventions that do not put children, pets, and wildlife at danger of poisoning and even death. Public education and habitat manipulation, supplemented by trapping if necessary, are the most important interventions of IPM programs. And by somebody mentioned earlier, trash does equal rats. I agree, trash equals rats. Basic habitat manipulation interventions include sanitation, exclusion, and rodent proofing. And I'm not sure what proportion of the overall rat and remedy programs will be applied to the various interventions, but I think that your public dashboard maintained by the Department of Health and coordinated with the Department of Public Works will provide important metrics that can be monitored and will assist in planning and developing ongoing abatement efforts. I have a lot of questions regarding the different amendments, but I have so little time. I think I've got to, I think a major issue I was concerned about was it had to do with the rat proof and rat or are the containers you're using actually rat proof or rat resistant? For example, if the pilot project would use cart and bag enclosures that are not rat proof, that might not be rat proof, I don't know. They might provide interior rat access and become unintentional feeding stations. If containers in these enclosures are normally kept open within an enclosure, it must be designed to exclude rodents. And that's been emphasized by the people. You need rodent-proof containers. And we have to be concerned, are there, well, if you're using conventional dumpsters, do they have drainage holes that are kept capped? Or only open for drainage purposes? Do the pilot project dumpsters enclosures have drainage openings that can be capped, or so on? Are all conventional? I'm sorry. Are all conventional litter containers and trash dumpsters and recycling containers and composting containers always kept a minimum of 3 feet away from all rodent access climbing routes, because they'll climb up and get in that way. If the containers are rat proof, but the lids are loose, the lids are overfilled, rats will get in. Let's see. Let's see. There's a residential trash replacement program by DPW where container damage has occurred. Are conventional trash cans being replaced with conventional trash cans, with rolling carts with attached lids, with rolling carts, or Metro store bagging cart enclosure or other? I don't know. I'm not sure what they're replacing them with. And it's best to not do it all at once, because if you do it all at once, rats will simply move to a different neighborhood. You need to do it slowly so that the population can, you're reducing the carrying capacity so that the population can die off by attrition. On second generation anticoagulants, IPM and rodenticides. When rodenticides must be used in an IPM program, a product is selected, and I think some of this is covered by your DC pesticide project, but only if it will be effective on a target species. It has a short biological half-life and has a readily available, effective antidote that can typically be administered in time to save an accidentally intoxicated animal or human. So we've talked a lot about second generation anticoagulants, and we'll talk about them again. But because they're killing viable wildlife, these deaths are destructive to natural ecosystems, but they also lost our valuable rodent management services that wildlife species provide. And of course, they've mentioned young children, mostly under 6 years, are also at risk. Antidotal therapies are costly and not a probable outcome for secondarily poisoned wildlife. They must be applied in a manner that renders them unavailable to all non-target species, and poisons. Biological half-life must be short enough so that a hyperlethal dose is not likely.
Mr. France, I'm gonna just stop you there, and we will also work off your written testimony for the hearing today.
Can I give one closing statement?
Well, we're already a minute over, friend.
Okay.
Okay, thank you so much. Amanda Brady.
Good afternoon, Chairperson Nadeau and Henderson and members of the committee. My name is Amanda Brady, and I'm here on behalf of myself, my employer, the Center for Biological Diversity, our 439 members and 2,448 supporters in Washington, D.C., and our staff and office located in the district to express our strong support for the REMY Results Amendment Act. The Center for Biological Diversity is a national nonprofit conservation organization dedicated to the protection of imperiled wildlife and the habitats they need to survive. We work to address threats to biodiversity, including the widespread impacts of toxic chemicals on wildlife and ecosystems. Rodenticides pose a well-documented and escalating threat to urban ecosystems. These chemicals do not remain where they are placed. Instead, they move through food webs, poisoning non-target wildlife such as raptors, foxes, and other natural rodent predators that play an essential role in maintaining ecological balance. Secondary poisoning has repeatedly been documented in wildlife across the country, demonstrating that rodenticides cannot be effectively contained once they enter the environment. The impacts of these chemicals are not theoretical. They are occurring here in Washington, D.C. As has been mentioned, a recent study by City Wildlife found that 85% of tested urban wildlife had evidence of rodenticide exposure. These findings demonstrate that rodenticides are moving throughout the district's urban food web and affecting species far beyond their intended targets. This is especially concerning because many commonly used rodenticides are designed to persist in animal tissues. When a rat consumes poison bait, the toxin remains in that rat's body. When that animal is eaten by a hawk, owl, fox, or another predator, the poison moves up the food chain. Predators exposed in this way can suffer from impaired blood clotting, internal bleeding, anemia, and a slow, painful death. Because predators often consume multiple poisoned rodents over time, exposure can accumulate and create serious risks for the wildlife species that help maintain healthy urban ecosystems. The REMY Results Amendments Act recognizes that lasting rat management requires addressing the systemic conditions that allow rodent populations to thrive. The district cannot solve its rodent challenges through short-term chemical controls that create additional environmental harms. Instead, it must invest in evidence-based strategies that address the root causes of infestations, including improving waste infrastructure, reducing food availability, strengthening public education, and preventing access to buildings. By prioritizing durable waste management improvements and coordinated education efforts, this bill advances principles of integrated pest management and supports a cleaner, healthier, and more resilient district. These upstream solutions reduce rodent attractants, limit the need for toxic chemicals, and create long-term resiliency for residents, businesses, and the wildlife that share the district's neighborhoods. Importantly, supporting integrated pest management does not mean accepting unmanaged rodent populations. It means addressing the conditions that allow rodents to proliferate while using the most effective and least harmful tools available to control their populations. By adopting this approach, the district can protect public health, preserve urban biodiversity, and develop a sustained model for rodent management. The district has an opportunity to demonstrate that effective rodent management does not require sacrificing environmental health or urban wildlife. By supporting the REMY Results Amendments Act, you can advance a science-based approach that protects communities while preserving the ecological systems that make cities healthier and more resilient. For these reasons, I urge you to vote in favor of B26-707. Thank you for the opportunity to testify, and thank you for your consideration of this important legislation.
Thank you very much for your testimony. Karen Gall.
Good afternoon, chairpersons, Council Member Janice Lewis George, and the members and staff of the council. My name is Karen Gall, and I appear before you today on behalf of the 3D CAC Community Safety Foundation, where I serve as the founding executive director. The foundation is the 501c3 implementation partner of the 3rd District Citizens Advisory Council, built to turn public safety policy into direct services on the ground across our 8 police service areas. My written testimony as 3D CAC has already put the policy case on the record. The data and the human toll and the amendments are all we're asking for. We support each one of the acts. I'm here this afternoon to speak only to capacity, because policy without delivery does not reach every single alley or a single trash can behind a restaurant, and the foundation exists to be that delivery partner. I ask the council to consider 3 things as you move this legislation. First, direct the implementation funding to community-based organizations like the 3D Safety Foundation, not to our private companies that are not based inside of DC. They're based outside of DC, so they do not see the real problems day to day that we always see. Second, extend the REMY Act's subsidy program beyond business improvement districts and the main streets. Include our residential partners. Our residential corridors need the same rodent-resistant infrastructure this bill is funding for commercial ones. And right now, the grant language only does not reach that particular population. It only reaches for commercial access, and we need it strictly for what we need it in addition to our to add the residential component to it. Third, give the 3D Safety Foundation a formal role administering the residential piece with using our block captains already on the ground, the same way business improvement districts already administer the commercial side, so implementation reaches block by block instead of stopping at the edge of a commercial corridor. Ward 1, the 3rd District, carries a completely disproportionate share of the crisis. Adams Morgan and the U Street corridor concentrate some of the heaviest restaurant and bar traffic in the city, and that means concentrated late night food waste, overflowing containers, pet waste, and human behavior that outpaces any single agency's collection schedule. That is not only a containers problem, it's a behavior problem at 2 in the morning on a Saturday, and no dashboard fixes that. It takes people on the ground at the night rate hours who know the corridor. A resident testified earlier during the hearing that DPW crews routinely leave food waste and pet waste behind after their own collection routes. It took her months of photographs and a petition just to get agencies to walk the alley with her. That is not only an Ward 4 problem, that is a problem that we see identically as a pattern here in Ward 1 in the 3rd district, and it's exactly the gap a partner who is already knows each one of these blocks and who's always on our corners looking at what our community is going through can close. This area has watched agencies treat one house or one building on a block and skip the next. So the rats moved next door and they came back. We see litters of rats underneath concrete in buildings of our vacant buildings and in occupied buildings. We see landlords and homeowners try to abate these issues without effectiveness. The city and the residents are overpaying for ineffective treatments. That is the coordination gap that this partnership will close. Our block captains are already walking the Adams Morgan, U Street, and Columbia Heights area in every quarter in this district on active patrol, and we're ready to work those same blocks side by side with the Department of Public Works crews the week that the council decides to pass this act. We are ready to formalize a joint deployment model with the Department of Public Works Clean Team, and one where rodent abatement is written into the contract itself, so that the trash removal, alley cleanup, and prevention education happen on the same block on the same day, carried out by the same people who are already there. We ask you to write a completion standard into the same contract, a block certified cleaned before the crew moves on, so there is accountability on both ends and not just a schedule. It does not require new bureaucracy. It
Thank you,
requires
Ms.
this
Dahl.
council.
Thank you so much for your testimony. We'll definitely take.
Oh,
note of it in
okay. I'm
writing.
already 20 seconds. Thank you.
Yes, ma'am. Megan Striegel.
Good afternoon, Chairperson Nadeau, Chairperson Henderson, and members of the Public Works and Operations and Health Committees. My name is Megan Striegel Thomas, and I'm the Senior Director for Public Policy at the National Pest Management Association. Really appreciated the opportunity to comment on both pieces of legislation and also just listening in to the other interested stakeholders speak today about the importance of using multiple tools to be tackling rodent in the district. NPMA is a nonprofit organization with more than 4,000 member companies across the country, as well as active in the district, who are committed to protecting public health, food, and property through providing quality pest management services. My members do this through a comprehensive integrated pest management, IPM, as we've talked a lot about today, strategy, including cultural, physical, mechanical, and chemical control methods. NPMA strongly supports public education and supports the spirit of these bills, which recognizes that successful rodent control depends on shared responsibility among residents, businesses, and pest management professionals. I know that the focus today is on Department of Health and Department of Public Works and these pilot programs there, but when it comes to rodenticide use in the district, the Department of Energy and Environment is also a critical voice in this conversation, as they regulate and approve pesticide registrations, which include rodenticides, as well as they handle the certification licensing for all professional pesticide applicators in the district and investigate pesticide misuse claims. Appropriate funding for these activities is necessary to see the results that this bill desires, which is seeing less rats. As written in Bill 26-707, or the REMY Act, Section 910, ensures that the continued use of these effective tools by licensed applicators and registered technicians under the direct supervision of licensed certified applicators continues, which is critical for the protection of public health, food safety, and property across DC. As DC looks to address other roots of rodent control problems, including food and trash collection, and collecting data on rodent infestations, the discussion of restricting acute rodenticides or non-anticoagulants should be tabled for now, as by removing all of chemical control methods from members of the general public could disproportionately impact those who cannot afford professional rodent control services. It is for these reasons shared that we support the council moving forward with these bills as proposed, and NPMA looks forward to being a resource for council members in the future on professional pest management issues. And I'll give you 2.5 minutes back to your time.
Thank you. I appreciate that. Thanks for your testimony. Commissioner Bishop Henchman.
Good afternoon, Chair Nadeau, Chair Henderson, Councilmember Lewis George, and other members of the committee. My name is Joe Bishop Henchman. I'm chair of ANC 5F in Edgewood and Eckington, and ANC 5F has endorsed the provisions in B26-492, and I've included the resolution for the record. We especially are very excited about and think are very important the provisions to gradually replace current non-rodent-proof metal public litter cans with rodent-proof bins. the provisions to proactively replace all rodent-damaged residential trash cans on a block when any one can is replaced due to rodent damage. And we are especially supportive of the direction to DPW to give 30 days notice to ANCs before public litter cans are removed from any location, and to give great weight to any comment from an affected ANC. I know there was discussion earlier in the hearing, which I've listened to all day, about why would anyone oppose the removal of a litter can or oppose the placement of a litter can, but it certainly happens. And I do appreciate both all the council members, including especially Chair Nadeau, for kind of responding to some of the public comment on that at the hearing today. When a litter can disappears, which happened quite a bit between the years 2018 and 2023, and then we had quite a few disappear last year with the better bus changes, all of which involved no notification to the ANC. It's the commissioners who get the angry phone calls. I think council members get some too, but especially commissioners. I just this past weekend, I got another complaint of what happened to that litter can that used to be at Lincoln and R, which was removed as a result of the better bus changes. And unfortunately, there still seems to be this mindset out there that litter cans cause trash rather than the other way around, and that if you take away the litter can, the trash disappears. And it's certainly not the case. And the community members and all of the people working on this are overwhelmed due to the lack of this infrastructure. And so we're very excited about having litter cans in more areas, not just the non-residential commercial areas that they've been limited to before this and other legislation that you've championed, but also making sure that they're better litter cans and ones that are not just the rat buffets that we've seen. I think what we've heard throughout today, what I've certainly heard throughout today, is backed up by the statistics that DC is not doing great in its fight against rats and all of the associated health issues that accompany that. And it requires bold but informed action. So I certainly want to compliment all of the council members in working to develop those ideas and to move forward with them. And very excited to see the dashboard unveiled by the Department of Health last week. I think Councilmember Henderson pointed out some areas where it falls short compared to what is envisioned by the proposed legislation, and certainly hope that those thoughts are incorporated into the bill. When we have a house treated or a rat treated, I think it's helpful to be able to zone in on that information so that other people on the block know that this is happening. And when a trash can is taken away because of rodent damage, it's good to know that that's happening, and everyone else should check for rodent damage. This is not a one-off. We're not going to get there with one-off solutions. We need more systemic stuff, more ANC-wide stuff, more wards-wide stuff, and more city-wide stuff. And it's good to see those approaches being incorporated into these bills. So again, the ANC resolution's been submitted for the record. I'm very happy to answer any questions. And again, very happy that the committees are moving forward with this stuff, which is desperately needed. Thank you.
Thank you so much. Next, we'll hear from Rachel Johnson.
Hello, I think we can see me. Good afternoon, everyone, chairpersons and members of the council. My name is Rachel Johnson, and I'm a resident of Bloomingdale in Ward 5 and a marketing and community strategist, testifying in strong support of both the RAT Act and the REMY Act, with a strong recommendation for this committee to push both further. This is in addition to my written testimony, so my spoken testimony will be slightly different and shorter to match the time. I support the RAT Act's limits on rodenticide and the REMY's Act training and certification requirements for anyone applying it.
These poisons are highly toxic to pets. I know from myself, my dogs have ingested this and thankfully survived, but this affects me personally. And it also affects our hawks and owls and that eat the poisoned rats, and as you've heard in many other testimonies. But limits only work if we also address what creates the rats, the overgrown bush in our alleys and on our sidewalks, our dirty alleys, and really no coordination between our neighbors, businesses, and overall the city on generalized upkeep. My specific block of U Street in Bloomingdale, my neighbors and I have coordinated a weekly sweep to coordinate on the days that our streets are getting swept. So we sweep and then we power wash like every other week, just to keep the neighborhood relatively clean as best as we can within our own capacity. This effort should really be something that the committee should back block by block through block captains, ANC reps all throughout the city. The bill also requires a 30-day notice to ANC before the public litter cans are removed. And that's definitely a start, but it stops short at the real question here, which is what replaces them. Removing a can without a rodent-resistant substitute doesn't reduce the rat activity. It pushes the food waste to the ground, into the alleys, into illegal dumping that gets into our waterways. The district should really look at the infrastructure that works elsewhere and replicate that here in the city. Now, overall, the trash infrastructure, there are a few buildings in my generalized neighborhood here within my block that have 10 or more open cans actively sitting on the street right now with only 5 units. The REMY's rodent-proof dumpster pilot for commercial corridors is the right model, and it works. It needs to extend to the residential multi-unit buildings too, like Empire Cans from New York City, etc. I do want to say that the district is doing an amazing job with the MetroStar FX partnership for the food waste cans, but that program needs to expand. We need to launch a partnership between the ANCs and the neighborhood members in order to put more in our neighborhood. Just this past week, and I know I'm short of time, so I'm just going to finish this last thought. Just this last week, I partnered with our neighbors to launch our rodent resistance program here in Bloomingdale. It's our petition to DPW to go house by house, alley by alley, to create street captains, to help maintain a clean neighborhood here. And I'll just go down to the bottom, and you can read this in my written testimony, but we're ready to invest. Homeowners here are ready to invest. We need a partner in the city. And honestly, the city needs a marketing plan. I do this professionally, and I can tell you directly that a coordinated outreach campaign, not just your website, not just your dashboard, is what turns this pilot program from Adams Morgan into something residents across all 8 wards are actually going to use. Thank you for your time.
Thank you so much for your testimony. Final witness is Allison Shaw.
Hello, council members, committee members, and staff. Thank you for going over with me. My name is Allison Shaw. I've been a Ward 6 resident for 13 years, and I'm here to support the REMY Amendment Act of 2026. I want to tell you about one particular animal affected by this issue. So in the spring of 2024, a pair of red-tailed hawks raised their 2 nestlings on the east wing of the Jamie L. Whitten building, which houses the administrative offices of the U.S. Department of Agriculture. My birdwatching friends had named the baby hawks Major and Mini-Me. You can see Mini-Me is the bird in the picture behind me, photographed by Brian Wee. Over several weeks, we observed these young birds flap their wings and hop across the ledges, their early attempts at flight, and we watched as the adult hawks returned with rodents, lizards, and smaller birds for the nestlings to eat. It was such a delight to observe these growing raptors and chat with federal employees who were similarly enraptured. But soon, Mini-Me displayed unusual behavior. He began twisting his head in an unusual position, like you see in the photo. And Mini-Me died when he was only about 2 months old. While his remains were too far decomposed to perform a definitive analysis of his death, evidence suggests he was suffering from secondary rodenticide exposure. Major similarly died soon after. Their deaths were likely very painful. Anticoagulant rodenticide interferes with vitamin K1 metabolism, which prevents blood from clotting. This leads to death by blood loss or organ failure due to internal bleeding, which is likely what happened to Mini-Me. The bleeding itself probably is not painful, but the accumulation of blood in the abdomen or around the heart is likely to be agonizing, and bleeding into the lungs or airways likely feels like drowning. These hawks aren't unusual cases, as you've heard a lot today. I've been listening. A 2024 city wildlife study found poisons present in 85% of the animals tested. Most of these animals had multiple poisons in their system. Our indiscriminate use of rat poison does not only impact rats. Washington, D.C. is a human city, but it's also a wild ecosystem, a web of connections between habitat, plants, and animals. Red-tailed hawks, eagles, opossums, foxes, and raccoons, animals that all hunt or scavenge rodents, are our neighbors too. I urge the Council to support the REMY Amendment Act of 2026, which will restrict the use of anticoagulant rodenticides and will focus on prevention, not poison, to reduce rat population. Thank you so much for your time and consideration.
Thank you very much for your testimony. Okay. So once again, I don't have questions for everybody, but I do thank you all for your testimony. And I know some of you have also submitted written testimony that has even more in-depth information. So we will be reviewing that. If you haven't submitted your testimony for the record yet, please do upload it after the hearing today. Commissioner Jacobson, has DC Health been receptive to your suggestion to do some control measurements before introducing interventions in additional locations?
They have not.
Okay. What have your conversations been with them generally?
We've given them feedback in both of those meetings, and they politely told us that they wouldn't be able to make any modifications because they've already announced the pilot.
Got it. Do you have a sense of how it's going?
It doesn't really matter how it's going, because if they don't have controls, then it's not really a valid experiment. And like these fertility management products are not proven outside of a lab setting, and so we don't know the correct way to deploy them. And even if we do get results, they could just be because rodenticides can have an impact, and better trash management can have an impact on rodent populations, and closing burrows can have an impact on rodent populations. So we have no clue as to what is causing that impact. And my understanding is these fertility management products are usually around 10 times more expensive to deploy. So I don't think it really makes sense to invest more effort into them if they're that much more expensive.
Okay. Thank you. I appreciate that. Councilmember Henderson, do you have questions for this panel?
I do. Thank you all for being here and for your testimony. Dr. France, you in your testimony was talking a little bit about trash receptacles, and I know that you've done a lot of work on this. Can you speak a bit more about what you believe are like the most effective ones and the approximate costs?
Can you hear me, or do I need to get rid
No,
of
I can hear you.
Okay. No, I don't have hands-on experience with like the metro projects and so on. I mean, there are rodent-proof containers, and they must be rodent-proof, not rodent-resistant. Whatever you're using must be rodent-proof. And I can't give you details on the cost. But I do want to mention one thing I didn't get to mention, and that is that I recommend literally banning all applications of ESCAR, second generation anticoagulants, by anyone on or in DC operated or DC owned property. It's only a start, but it's a good start. And it's happening in cities all over the place. So it's not like it can't be done. It just must be done.
Okay.
Yeah, I'm sorry.
Thank you. Ms. Striegel, I think you probably have really like the minority opinion in terms of this whole hearing around pest management and rodenticide. Do you disagree that rodenticide shouldn't be deployed by people who don't have the proper education about how to use it?
So we're supportive of how these bills are maintaining access to trained and licensed applicators and registered technicians, but we are also very much aware that professional pest control services can be expensive. So rather than advocate for everything to be removed from consumer uses, we want to make sure that there's still something that consumers can use in a pinch where if they can't hire a professional to come out. Obviously, I would love for them always to hire my members because we are trained and we know what we're doing. But we want to make sure that there's still something for consumers to be able to use to address the problems themselves.
But it doesn't need to be at this particular level that we're talking about.
I would say, we always turn back to the regulatory agencies that are in charge of looking at these products to be sold. That's why I brought up Doe earlier, because they are the ones that look at these products and register them for use within the district. So it's ultimately, we point back to the regulatory agencies and the registration decisions that they make, rather than kind of, pontificating ourselves.
Got it. Thank you. Josh, Mr. Jacobson, thank you so much for being here. And frankly, for all the, I would say, freelance free work that you've done in terms of trying to up the technology products that we have available to us for the good of, the public. You've looked at some of the data in terms of the reporting. I'm specifically talking about 311 in terms of the rodent pieces. One of the things that I kind of hypothesize is that there's underreporting happening because not a lot of neighborhoods are using 311 at the same level of frequency. Is that something that you've kind of seen sort of in the data around like who is reporting rodent issues in comparison to others?
I haven't, but I'd be very skeptical of any 311 data at this point, because if you look at the May 1st to June 15th timeline when the 311 app was broken, like you just couldn't submit requests. There were a lot of people who weren't submitting requests, and requests were down, I think, like roughly 10% compared to the same time last year. So any sort of data there is very suspect at this point.
Okay.
But if there are specifics of what you want to see from the data, I'm happy to take a follow-up and find other ways to visualize that.
Yeah, I mean, I think it would just be helpful in terms of, everyone kind of thinks that like 311 is the great equalizer, but I imagine that residents in 5, 7, and 8 are probably submitting less 311 requests than what you might see in 6, 4, and 3, for instance.
Yeah, I can follow up with you after.
Yeah, I mean, because in a different context, in a different hearing, when we were up doing street light management, so city service in the weeds, but this was with DDOT and having to talk about like replacing street lights, which our whole process for replacing streetlights in the district until we changed over our system was literally, did someone submit a 311 request? And that's how we would know whether or not the light was out. That is not effective. And so you had whole parts of the city that were dark because someone didn't know, oh, you got to submit a 311 request to sort of get this addressed. And I feel like it could be the same situation in terms of public rodent issues. If like folks don't know, hey, if your Triangle Park is having a bunch of burrows, you need to submit a 311 request, and then, DC Health can come out, or DPW, et cetera, then we're not going to sort of see that piece. I wanted to switch really quickly. Oh, sorry. I wanted to switch really quickly over, excuse me, to the dashboard that DC Health recently released, and sort of like the data / information. And I know that in Councilmember Louis George's bill, it really is wanting to sort of delve deeper into some of the data. And I wanted to give you opportunity to speak on that.
Yeah, I would love for all of the data to be available online, including the burrows that they treat and the products that they're deploying. The burrows that they treat, that data is made available in their dashboard, but it's not very accessible. I don't need to go into all the details there, but it like I had to just do some special things to scrape it, and it isn't up to date and doesn't give like geographic locations. And on the other 311 data, they just are reporting the wrong numbers. The press release said that there were 5,000 requests since the beginning of this year, and they're actually 10,000. That's because they weren't counting May and June due to some data reporting issues on their end.
Okay. Thank you. Thank you to everyone for being here and for your testimony on these legislation. I told Councilmember Nadeau I didn't anticipate, what is that, 4 hours of public testimony about rodents, but it just goes to show how much of an issue that this certainly is. So thank you guys for being here.
Thank you.
We will get to it, but we're not done yet because first we hear from our government witnesses. Yes, ma'am. It's 2 weeks from today. Okay, so also thank you all to our witnesses. You are free to go. I can't believe it has never occurred to me until this conversation that we need to pay for success model for rat abatement like we had for streetlights. It's like just in time for me to leave.
I know you coming up with all these ideas.
I know. Well, it's okay. I'll write some up. All right. Okay. So we've now heard from all of our public witnesses. Thank you, everybody, for participating today. Our attendance rate was through the roof, meaning not only the number of people who signed up, but the people who signed up and showed up. Usually there's a lot of attrition by 5:30. Okay, so our government representatives will now join us. We have Anthony Crispino, Interim Director of the Department of Public Works, and Dr. Ty Moore, Associate Director for the Office of Community Protection at DC Health. And I am going to swear you both in. So once you get set up, we'll do that. All right. You raise your right hand. Do you swear or affirm under penalty of perjury the testimony you are about to give to the Committee on Public Works and Operations and the Committee on Health is the truth, the whole truth, and nothing but the truth? All right. Very good. Thank you. You may begin your testimony. Let's start with Director Crispino. Great. Thank you.
Good afternoon, Anthony Crispino, Interim Director of the Department of Public Works. Given the hour, I'm going to forego reading my written testimony, submit it, and then we can just go straight into questions.
Okay. Love him. Yeah. All right. Okay. Dr. Moore, would you like to testify? You are welcome to do so. Do not be pressured by him. There you go. Yeah, turn on your mic.
Yes, I would like to testify today. Thank you. Good afternoon, Chairperson Henderson, Chairperson Nadeau, council members, and the staff for the Committee of Health and the Committee on Public Works and Operations. I am Dr. Ty Moore, and I am the Associate Director for the Office of Community Protection within the DC Health Environmental Health Administration, EHA. On behalf of Dr. Ayanna Bennett, I appreciate the opportunity to testify on the Rodent Abatement and Transparency Amendment Act of 2025 and the Rodent Education and Management Yields Results Amendment Act of 2026 to share DC Health's perspective on both bills. DC Health supports the intent of both pieces of legislation to reduce the district's rodent population. However, there are elements of both bills that requires further discussion as they cover subjects better regulated by other agencies. DC Health works to reduce rodent activity as rodents can adversely impact people's health. Diseases such as leptospirosis and hantavirus can spread from infected rodents to people through direct contact. Rodents can also trigger severe asthma attacks and allergic reactions, especially in individuals with respiratory illnesses. Exposure to these diseases is especially dangerous for vulnerable populations such as our children and older adults. Much like other major cities across the country, the district is experiencing an increase in its rodent population. This is due to three primary factors: access to herbage, food, and water. Unfortunately, many areas across the district have an abundance of these elements. This is especially the case in neighborhoods with higher volumes of trash, which includes areas with restaurants, large multi-unit housing facilities, and vacant or blighted properties. Additionally, given the impact of climate change, milder winters have increased rodent survival rates throughout the coldest months, leading to increased populations. The Rodent and Vector Control Division is staffed by 16 certified rodent inspectors who work diligently through a combination of strategies to address these underlying contributing factors. The division's primary responsibility is to respond to all rodent-related 311 requests. In calendar year of 2025, this translated to 25,720 boroughs identified through all 8 wards. During those service calls, the team inspects impacted areas, treat rodent birds when appropriate, and takes enforcement action to reduce conditions contributing to rodent activity. Earlier this year, the division launched the Rodent Abatement Blitz pilot program in 3 neighborhoods: Adam Morgan, Eastern Market, and Gallery Place, Chinatown. The locations for the pilot were identified based on high rodent activity and leveraged 3 distinct strategies, including the rodent fertility treatment. DC Health is actively analyzing data collected in each pilot area to measure success, which will inform future deployment and abatement strategies. However, preliminary data indicates that while these chemical interventions are highly effective at reducing rodent populations in short term, community partnerships are needed for long-term success. Given rodents' 21-day reproductive cycle, these chemical interventions have limited long-term impact if they are not accompanied by ongoing prevention efforts. These efforts must be supported by the community and are centered in 2 primary activities: trash and property management. The proper storage and disposal of trash reduce easy access to food sources for rodents. When New York City enhanced their public trash management and improved enforcement, there was an associate 55% decrease in rodent sightings in one of their pilot areas. Similarly, effective property management is critical to reducing access to water and garbage sources. This includes regular landscaping and removal of items that are used by rodents. Given the importance of these prevention efforts, the team engages in robust community engagement and education to inform residents of these strategies. The division regularly attends advisory neighborhood commissions and other community meetings, conducts community walks with other district agencies, and hosts the annual Rodent and Vector Control Academy for residents and other stakeholders. DC Health firmly believes that effective rodent control requires all district residents, businesses, and government partners to play their part. Through a combination of ongoing prevention as well as mitigation efforts, the district can achieve long-term rodent population reduction. Both pieces of the legislation are aligned with DC Health's goal of protecting the public health and safety of the residents and visitors of the district by reducing rodent activity and other vectors through proactive surveys, inspections, baiting, enforcement, community outreach, and public education. The RAT Amendment Act of 2025, introduced by Councilmember Louis George, requires DC Health to create a publicly accessible rodent abatement dashboard and to submit a report to Council that outlines the department's rodent abatement efforts, their outcomes, as well as their recommendations for reducing the rodent population. Furthermore, the legislation allows the mayor to assess residents the costs incurred by the district for any corrective or enforcement action related to rodent abatement. Finally, the legislation requires the Department of Public Works, DPW, to notify council and ANCs before litter cans are removed from residential blocks and notify DC Health if there is evidence of active rodent activity in that area. The REMY Results Amendment Act of 2026 creates a pilot grant program to install 10 rodent-proof dumpsters within commercial corridors with high rodent activity. The bill also restricts the use, sale, or distribution of anticoagulant rodenticides on public or private property by those who are not district or federal government agencies, contractors, or certified to apply pesticides by the Department of Energy and Environment, DOEE. Any violations will result in a notification to remove the anticoagulant rodenticide in 7 days, as well as civil fines, penalties, and fees if someone receives more than 2 violations. Lastly, the legislation requires DC Health to establish a public education program to further reduce the rodent population and activity within the district. Currently, the Division of Rodent and Vector Control engages in many of the activities listed in both bills. The division engages in public education through community walks, conducting town halls to promote best practices, offering technical assistance to residents during inspections, and hosting the annual Rodent and Vector Control Academy that details best practices in pest and rodent control. Throughout its public education efforts, the division promotes effective rodent control interventions, strategies to reduce the risk of disease transmissions, and processes to limit adverse impacts from improper use of rodenticide. DC Health was pleased that Councilmember Louis George bill highlighted the need for more data transparency through a publicly accessible rodent dashboard, and we are happy to report that as of July the 9th, 2026, the dashboard is live on the Rodent and Vector Control Division webpage. This tool is designed for stakeholders to understand the scope of the rodent problem and DC Health activities and responsiveness to residents' concerns. We welcome feedback from the council and the public on the dashboard for future iterations. As rodent inspections and treatment services are provided by the division across the district are provided at no cost to residents, the agency must absorb all costs. This, recovering costs for repeated actions, as detailed in the RAT Amendment Act of 2025, will promote greater compliance with rodent control measures and potentially allow DC Health to further invest in the rodent and vector control program, which will lead to improved program efficacy. In addition, DC Health supports improving dumpster infrastructure, which is an effective method to decrease rodent activity, especially in areas with significant commercial activity. DC Health encourages additional discussion on the resources needed to implement the grant program, as in many cases, businesses are not the ones purchasing or managing trash services, but rather the landlord or other third party. Both pieces of legislation outline requirements that have the potential to reduce rodent activity within the district. However, these additional analytical and administrative functions, such as developing multiple reports and implementing a pilot grant program, will require enhanced resources for DC Health to implement them effectively. DC Health understands the public health implications that incorrectly handling rodenticides can have. We want to ensure the district residents, especially children and pets, do not come in contact with these harmful agents. With that said, DC Health supports restricting access to these rodenticide products given their harmful impacts when not used by professionals. However, given their existing regulatory role related to pesticides, DC Health believes that DOEE is better suited to regulate these rodenticide products. In closing, DC Health supports the intent of both pieces of legislation to reduce the rodent population and activity in the district through maintaining a dashboard, allowing the district to recoup costs for corrective and enforcement actions related to rodent abatement, and establishing the rodent-proof dumpsters pilot grant program. Thank you for providing me the opportunity to testify, and I'm available to respond to any questions councils may have.
Thank you very much for your testimony. And thank you for not testifying. Okay. Before we begin, I'd like to give you both an opportunity to respond to the public witnesses we heard from today, whether that is specific statements you want to address or general impressions. And Ona, we'll do 10-minute rounds.
I guess I'll dive right in. Look, this is a hot button issue. I mean, rats are vermin. They're not something that folks want to deal with. And it isn't any secret. It isn't any secret that we have a sizable population here in the district. But I don't want it to be said that the Department of Public Works is not proactively working towards solutions already, because we are. We've had many hearings with you and other council members on some of the steps that we're taking. in this fiscal year and last fiscal year within the appropriated budget. I'd like to, I guess, specifically address the young lady who is still sitting behind me, who was talking about the issue that is created by some of the trash crews. Every trash route has a number. Those numbers are associated with addresses. If the crew in question on that route is not performing the task to standard, I encourage that information be forwarded to me. I think you and Councilmember Henderson both know that if a complaint reaches my desk, I will take action. I would like to start with education of the crew first, but if it came down to it and I had to take administrative action, I have in the past and I will again. We are a customer service oriented agency, and when we do a job, the expectation is that we do the job well. We don't leave the neighborhood worse than when we found it. When that information comes across my desk, I'm more than happy to take it up. But I'd like to, I guess, to get the conversation going, I mean, I'd like to turn to what the esteemed doctor from New York had to say. We can talk about containers. We can talk about, DC Health will certainly talk about their aspect of this program. But I think the point that he raised actually hits the head on the nail. And rats are only going to go where there's food. So if we address that issue and we continue to double down on the efforts that the agency has already started to make to remove waste from the waste stream, the population goes away. If there's nothing for them to eat, nature will self-control the rat population. And in that regard, as I've testified in the past, since its inception in late 2023, the curbside compost collection program, which is the program that has, I believe right now, 12,000 residents enrolled, and the room to expand to more, budget permitting. DPW and its vendor have collected 6 million pounds of food thus far and removed it from the waste stream. So that's 6 million pounds in that program alone that is not going to waste to energy, that is not going to landfill in the event of a diversion at ReWorld, and that is not available for rats to eat. In addition, we've had the long-standing food waste drop-off events at the farmers market, and we added new weekly locations at the Marionberry Avenue Market, Trinidad Farmers Market, and the Bloomingdale Farmers Market, which brings the total number of weekend drop-off locations up to 14. That program, since its inception, has removed 6 million pounds of food waste from the waste stream. So those two programs combined have removed a total of 12 million pounds of food from rats and out of the general waste stream that we dispose of. Turning to the program that I am extremely proud of, and I believe one of the panelists online had mentioned expansion. We also have the standalone bins, which are the Metro stores. So DPW is working with one of the leading vendors of rat resistant, because I don't know if a rat proof container exists, but as resistant as it can get, Metro Store is one of the vendors that's producing those containers. We currently have 30 around all 8 wards. And those existing bins that are already in the inventory out on the street working, by August, they should reach the 1 million pound threshold. So that would bring us up to 13 million pounds of food waste that is being composted as opposed to being turned into landfill or waste to energy, and it is no longer a food source. But going back to the question that one of the panelists had, DPW last fiscal year, with your assistance and based on our conversations at previous hearings and the mayor approving the budget, this year we bought an additional 20 standalone bins, and we anticipate delivery of those bins in late July, so late this month, with installation in August. That will take the total up to, I believe, actually 51 standalone bins across the district, because there is also one at George Washington University. The goal, working with my team in the Office of Waste Diversion, it's not only an environmental goal, but also a rodent vector goal. We are aiming to have a standalone bin within a half mile of every resident in the District of Columbia. And that jives with the overarching development plan for the district, where we are less dependent on vehicles. We are including folks that are using electric bicycles, pedestrians, the metro system. We want everybody to be able to access these bins. They don't cost anything. They are we use data to place the bins. The program manager is very thorough, and we're trying to get the most bang for our buck. When you come up to these bins, all of the instructions are on the sides. There's a keypad. You enter a code. The top opens up, unlocks, and opens up. You deposit your food scraps, and you're on your way. So I think when we're talking about the home receptacles for just regular trash collection, if there is an existing method right now to combat that and you're not enrolled in our curbside composting program, I just emphasize, please, as we install these bins and the standalone bins, and we will continue to use so, if you don't want your can chewed up, just take the food scraps to those bins. You put it in a compostable little bag, or you can just take a plastic bucket and dump it straight in. It doesn't matter. And then there's no food source in your bin anymore. We're trying to make it as accessible to everybody. And that doesn't just include the residents that we service on a daily basis, which are the single family to 4 units or less. You can be an apartment dweller. You can use these bins. If your building is your landlord or your building is not providing a means for you to compost food and get that food waste out of the stream, you can use our bins. They are available. I encourage you to do it. It is proven. We have a 97% satisfaction rate across our composting programs, and right now that's the best way to go about addressing that. I know there'll probably be a question, so I'll just jump right on it because we've talked about it in past. In the previous budget cycle, you both made sure that we had, I believe, 4 additional sweep inspectors, with the understanding that they would be utilized for identifying harborage and other vectors related to rodents. All 4 of them are in place. They're in the field. One was hired on May 18th. The next was May 31st, and 2 were hired on June 1st. So the total of 4 inspectors that were budgeted in the budget cycle are now available to assist Department of Health. Where do I go next? I guess staying on sweep. In addition to those positions, the agency has been working very diligently with DOH, and I think it's been a great partnership. As you know, I'm very in the weeds with email traffic amongst my line folks, especially when it comes to enforcement and taking action that needs to be escalated. And DPW and DOH have been conducting multiple walkthroughs. There are several alleyways where there have been weeks-long exchanges and multiple trips, not only by my inspectors, by the DOH inspectors. Our sister agency, DOB, has been involved. That's the Department of Building. So when I'm doing government speaking acronyms. So the partnership, I think, is starting to work. I think where we are applying the combined efforts, it is making meaningful strides towards improving the situation. And it can only go up with this continued relationship. Sticking with the Department of Buildings, another area where DPW has made anecdotal observations in terms of rat control has to go with DOB's Ballywick, and that's the nuisance properties. DPW works very closely with DOB, especially when there are large-scale buildings that don't fall within our normal service portfolio. However, either through sometimes it's a lapsed contract, other times it's an issue with the buildings changing hands. The private hauling contracts fall through the cracks, which means you end up not with just a single super can's worth of trash, but now you're talking about 9 cubic yard dumpsters, the surrounding area, which means tons of trash just open to the air. And DPW has been utilizing its crews, especially in response to council or ANC requests, to come abate those as they arise as soon as possible so that they don't become harborages or vectors for rats or other larger vermin. So we are making strides. I am not by any means saying that it's been perfect, but I do think that the agency has made meaningful progress even since the last hearings earlier this year.
Thank you very much. I'll turn to my colleague for questions as well.
Thanks so much for your testimony and for the work of both of your agencies in terms of dealing with this. I'm going to start with some general questions just so we can sort of level set, and then we'll get into some specifics about the legislation. So when a resident or a business uses 311 to report an apparent rodent infestation on public or private property, can you walk us through how the city responds to such a complaint?
Yes, when we get a complaint response, we get it through the 311 service. We get it through our.
You just got to lean in. It's you. Just lean to it. There you go.
All right, thank you. Yes, when we get a 311 complaint, we get it through, when we get a complaint, we get it through 311, which is a proper protocol. When we get that complaint, we download it on our app. We have we have inspectors in each ward that address each complaint. And
Okay.
then we close out once we finish addressing the complaints.
Okay, so you close out not upon inspection, but upon some sort of action being taken by
Yeah.
DC Health? Okay, and in terms of the internal, I'm like, it's me. In terms of the internal protocol, the internal protocols, so your inspector goes out, they take a look. If they substantiate, then what happens?
So if it's need to treat, they would treat. If there's no action taken, they would note no action taken.
So they would need to treat like on the spot. It's not something that they would need to call in a team to come do or.
So no, treatment products are with us. So if there's a active rat bird, is that me? Is that me? So if there are active rat birds, we would treat on site. It's not you look, investigate, and then come back and treat. No.
Okay. Have you guys ever, when you analyze the data of the requests that you get from 311, is there any other method by which you are alerted other than 311 of a complaint?
Yes, that's one of the points I would like to talk about, the dashboard.
Okay.
The dashboard is very encompassing. It's not just 311 complaints. It includes our hotspots. It even includes communication that we receive from emails. For example, let's say an ANC commissioner or yourself email myself or one of our office members, like, hey, we detect rodents, we address that as well. So we get other information more than just the 311 requests.
Okay. So I'm curious though, from a public education standpoint, how has the agency communicated with the public, like, hey, this is the proper protocols for reporting, as opposed to just being frustrated and speaking to the sky without actually reporting it to the government?
Yes, there's definitely an opportunity for more aggressive communication and transparency on what we're doing internally. Currently, right now, we ask people to submit requests to 311 because it is a proper protocol. It's accurate tracking and record keeping.
Okay. So that's for boroughs and things like that. How would you guys address it from an alley perspective? Which is often where we're getting a lot of the complaints of people saying they're seeing rats in the alley. I mean, Director Crispino, I'm sure your workers have probably seen their fair share of rodents in the alleys.
Correct. So with our sweep inspectors, as you know, every ward has assigned sweep inspectors, not just the 4 that are focused on the new ones that are focused on rodent vectors. They are out in the community every day, and they can enforce the same types of violations that they observe that are related to rodent populations. And so as they're out and about, they are not only doing educational meet and greets with residents, but when they are either directly observing, the agency is getting emails, or we're getting 311 service requests that were coming through. If it's in their area of responsibility, they go directly to the site and then they take appropriate action. That also includes looping in Department of Health. Sometimes we have to open our own 311 request so that it goes to the proper protocols that the doctor is referencing. But then other times, as you know, I get emails and then I dish it out to the appropriate parts of DPW to address. And that can also include street and alley beautification. It really depends on what is needed if we're cutting back vegetation. Does the alley need to be swept? Do I need to have a route supervisor come in and pick up orphan cans that have now become collection points for trash when people are transiting through the alleys?
So earlier today, there was a testimony by Commissioner David Rubenstein, who talked about an issue that they've been having around a tree at 14th and P. It's been reported there are burrows around the tree. I'm not sure specifically if DC Health has applied treatment there, but one of the things that they have, or I think he talked about, was like wanting to do a wire and stone around this particular tree. Which agency would be responsible for escalating it beyond just a treatment of the burrow?
Under those DPW, so DPW trees don't fall under DPW. We do trim vegetation in alleyways, but remember, trees fall under urban forestry, which is in the Department of Transportation. If it was something directly related to the tree under district control, then DPW would refer it to DDOT and make sure that Department of Health is also aware of the burrows around the tree. But if it's something related to the pruning of the tree, cutting down the tree, removing the tree, that would have to be urban forestry.
Okay. So I think in the span of a minute, we've talked about 5 different agencies for one rodent issue, which you could see could be frustrating for the outside public in terms of like, how do you navigate what happened, right?
Right.
So let me ask you this, Dr. Mori, when you guys get the 311 requests, does any other agency get them as well? Or is DC Health the only responding agency? You guys turn your mic on.
Other agencies gets them as well. We are currently working with OUC.
Okay.
311 and how to better streamline that. For example, let's say you get a call of illegal dumping and DOH get it. When we typically get that and we work with our sister partner, DPW. How best as a caller, when you call about illegal dumping, that call goes straight to DPW. Or if you get something about rodent sightings, that call goes straight to DOH. As he stated, DDOT is responsible for the trees and things like that, but how can calls go straight to that particular agency? So we are in conversations, and we have had meetings, so we are discussing that.
Okay.
And we are expecting to make that work.
Okay. Director Crispino, how many citations have you all issued in terms of rodent issues from your sweep inspectors this year?
I figured you were going to ask, so I came prepared. Between FY 25 and 26, sweep in the categories that are related to rodent control violations issued 28,947 NOIs.
I'm sorry, did you say 28,000 notice of infraction?
28,947.
Okay.
And there, again, there's also the first course of action. We try not to go straight to an NOI. The sweep inspectors definitely like to educate residents before they resort to civil infraction.
All right. DC Health, currently the DC code authorizes DC Health to issue citations and fines against residents who have issues on their property causing rodent infestations. How often do you all use that enforcement authority?
So like DPW, like to educate our residents first. So we issues what we call, a notice of abatement. Once we issue the notice of abatement, we go back 14 days. If the findings that we cited have not been fixed, we will issue an NOI.
Okay. How much is the fine?
Our fine starts at $500.
Ooh.
But it can go up.
Okay. How many have you guys issued?
I don't have that information readily available, but we can submit that after this hearing.
Okay. I don't want to fine people, but I think you guys know with some of the landlords that we're dealing with, right? It's not always just commercial. Sometimes it's dealing with the residential properties, and some of these building owners just don't care. They don't live here. They don't live at the building. They just don't care. And so sometimes you have to use a little bit more. Yep.
Well, before we move on from that point, because I do want to just flesh it out a little bit further. So a case that I was directly involved with right across the street from DOES on Minnesota Avenue. I think that's the 4,000 block. that apartment complex across from the government buildings was going through a change in management, and DPW had to remove the waste from the dumpster in the surrounding area 3 times. I think we issued a combined total of $30,000 or $40,000 in civil infractions. And it took working with MPD to actually get the owner to acknowledge the problem and pay it off. But since then, we have also started to work with my Office of General Counsel has started to work with the Office of the Attorney General, because they have the ability to engage in actual lawsuits against some of these property owners that are just not taking care of properties and creating the conditions that we then have to abate.
So I'm sorry, Councilmember Jeff, for going over, but just to sort of wrap this up, it sounds as though you're suggesting that, yeah, you might have done 28,000 NOIs, but that doesn't mean that there have been 28,000 resolutions.
Correct, because once the NOI is issued, then it has to go to the Office of Administrative Hearings, and the adjudicative process has
yeah.
to play out.
Thank you.
Remember, we've talked about that, how
I
they
know.
need more money.
I know.
Yeah, okay. Councilmember Louis George is with us for a round, I believe, online. Okay. Councilmember Louis George, if you'd like to ask questions, you may do so now. Oh, did she leave? Oh, move her over. Sorry, yeah. We're gonna move you in. There she is. All right, now, Councilmember Louis George, you should have control of your microphone and your camera if you would like to ask a round of questions now. If not, we can come back to you. Okay. Well, we'll come back to her. Okay. Okay, so some DPW questions on the RAD Act. The RAD Act would require DPW to notify ANCs before removing public litter cans in residential zones. I believe that Councilmember Louis George and her staff were moved to introduce this after DPW removed cans from near some decommissioned bus stops, and residents were understandably unhappy. What are some other common reasons DPW decides to remove litter cans?
Typically, the only reason we would remove a can, other than the number that were related to the decommissioned WMATA stops, would be illegal dumping where the can is just being abused at the request of an ANC. I believe one of the ANCs in the final panel referenced that it's rare, but it does happen. And then if the can is damaged, it's removed with the expectation that it's going to be either repaired and replaced or just replaced outright.
Okay. At last year's trash roundtable, we discussed how DPW's litter can removal practice is basically ad hoc, and that notice is rarely given to the community, which leads to confusion and frustration. Can you provide an update on the litter can removal policy since that discussion?
Well, the expectation has always been that our folks that are handling the public litter cans consult with the ANCs, because as one of them testified, just like I receive angry emails, they're a step closer to the constituency. And when a can is removed without notification, regardless of the underlying reason, it is a flashpoint of emotion or feelings for the surrounding community. So the expectation is that our folks should be working with the ANCs to avoid those flare-ups. So the proposed bill essentially codifies my expectation of my employees.
And who would be the person or the people that are interacting with the ANCs at that point?
We did have a long-standing employee who primarily handled public litter cans. He is no longer with the agency, so we're in the process of determining who that POC will be. But we will have to designate somebody because it will also require the coordination of ordering new cans, replacing cans, repairing cans, the whole litany of services related to that.
Got it. So it's always been one person. So it's not like the sweep folks or the other inspectors working in the wards.
You mean to identify cans for removal?
To communicate with ANCs about it. Also to identify, I suppose.
I mean, the sweep inspectors can reach out and work with the ANCs. Primarily, it has been one of our communication specialists who one of her sole responsibilities is to communicate with the ANCs, not only about things like public litter cans, but if we have carryover routes, delayed routes, making sure that the ANCs are aware that their particular jurisdiction is impacted.
The RAD Act suggests you would only be allowed to remove cans in residential areas if a district resident requests it. Do you have any concerns with that?
It will pose a bit of a challenge. I'm not going to lie. With everything, every service that DPW provides, whether it's street sweeping or something else that's imposed upon the community, like for instance, with sign street sweeping, it requires the residents, if they want it, to go and get a certain number of signatures from the community so that we know that this is something that is actually supported. There are always the follow-up emails. I didn't want this. The ANC bamboozled us, is one I've dealt with. The signs were posted illegally. DPW did this unilaterally. So there will be a challenge, especially if it is something where DC Health's inspector or our rodent inspector comes through and determines that the can is actually creating a harborage. I'm just kind of spitballing. This is all hypothetical, but there may be a circumstance that I'm not aware of. If the ability in certain circumstances for the agency to unilaterally remove the can after notifying the ANC, under those circumstances could be problematic.
Mm-hmm. The bill would also require DPW to refer evidence of active rodent or vector activity to DC Health. Does DPW track rat infestations during solid waste enforcement?
So when the inspectors are going out and they are noticing those issues, Mr. Thompson has informed me that yes, the inspectors are emailing that to DC Health now. And it may not have been as robust in the past, but with the ongoing efforts since the spring and the collaboration, and that is something that they are doing more regularly, and it will continue.
Okay, so you kind of already have a referral process in place.
Correct.
And it's typically an email.
That's my understanding, that right now it's an email.
Okay. Any sort of software, anything used to track these?
Some of the sweep inspectors may also put it in 311, which would then allow us to actually track it like any other service request with SLAs.
Makes sense.
But mostly it's through emails.
It's mostly
Yeah,
email.
we coordinate in partnership with DPW on a regular basis. One thing about the bill, the abatement bill, it just formalized the work that we currently doing, the partnership, the collaboration that we're doing with DPW. With the DPW and the 4 rodent waste inspectors, we currently just train them on methods on how to identify rodent infections, rodent sightings. So we're in constant collaboration with DPW.
And under the right circumstances also, where the sweep inspectors are putting it into 311. But the primary mode right now, as indicated, is email.
Okay. Would it make sense to more formally to also, I mean, ideally everything is getting into 311, right? I mean, if it comes in through DC Health, are you guys also putting it into 311, or you track it on the back end in Salesforce?
We track it on the back end in Salesforce. We
Okay.
can put it in 311, but I have to say I did like the idea of DPW and DOH coordinating the data.
Yeah.
That was a great idea. We welcome opportunities for great ideas.
Yeah. And then it's just that 311 already exists. So that would maybe be a good place to keep the initial data anyway, rather than setting up something different. Because can't you overlay a dashboard into the 311 data anyway with some GIS mapping? Now I'm just saying words. So
I'll give you, yes, with more words. Yeah. So yes, there are, yes, our GIS analysts have been successful in other areas of our operations with overlaying heat maps and other data that is scraped from 311 data and then overlaid on our routes.
okay. Right. See, some of the words I said are words that you said, so they must have been not totally wrong. How quickly does that referral happen from DPW to DC Health? Like immediately?
Less than 24 hours.
Yeah. Okay.
Yeah,
Less than
emails
24
are like
hours.
text messages these days.
Okay. Yeah, fair enough. Well, I'm glad that you feel that way about being responsive to email. And how, I mean, how does DPW know whether DC Health is responding to the issue? How do we know that it goes somewhere?
From what I have seen, especially, I cannot remember the address, but the alleyway, the one alleyway in question where there has been a lot of back and forth, most of the time, the sweep inspector is present at the same time that the DC Health abatement team is there.
Mm-hmm.
So it's direct knowledge. They're both on scene at the same time.
So what kind of thing are you responding to when they're on site together? What is what's the request that generates both agencies being together?
So the case continuing with this case in question, I believe it started with the initial resident's complaint had to do with cans in another yard, multiple cans. And I can't remember if the cans were orphaned or not, but they were not being utilized correctly. And it was becoming, as someone said, a smorgasbord for rodents in the area. That then triggered sweep to get involved, DC Health to get involved, and then there was a walkthrough through the initial walk through the alley, and then there have been repeat visits, I believe, where the inspector has been issuing NOIs or attempting to make contact with the neighbors, and then working with the abatement team to treat the yard in question and where they could gain access on the adjoining properties where the troublesome cans were, treating there as well, is my understanding.
Okay.
Let's use an example of an apartment building.
Great.
Okay, so apartment building, trash garbage, and we know trash are rodents, breakfast, lunch, and dinner, correct? So that will initiate both agencies to get together to do abatement for the trash and for the rodent activities.
Great. Okay. All right. Well, I am going to turn it back over. Oh, Councilmember Lewis George is here for a round of questions. Hooray.
Thank you so much. I'll get right to it, Dr. Murray, on measuring progress and the dashboard. As you know, my bill calls for DC Health to publish its latest estimate of district's rat population and say what it would take to reduce it by 20%. Can DC Health actually produce a reliable citywide estimate? And if not, what should we use instead to set a baseline and to tell whether we're making progress or not?
We are currently assessing the dashboard and updating the dashboard. However, it is manual work. The question is, what can you currently use? Again, the dashboard is transparent data. I feel you can use the dashboard because the dashboard is not just encompassing, again, just the 311 service request. It's also encompassing our hotspots and even areas we treated through email responses. So yes, the dashboard.
Okay, so, and what would be a reliable citywide estimate of our rat population now?
Are you asking how many rodents in DC?
Yes, I am.
That's hard to say.
Okay. Earlier today, go ahead.
I believe the number of burrs that we will be a good metric. I really do. That that when the inspectors go out, they see the number of burrs, and then once they treat it, when they return back, the number of burrs afterwards. I feel like that will be a good baseline metric. But to count number of rats, we don't count the number of rats in DC.
Okay. Earlier today, my team went to the dashboard in preparation for the hearing, and the dashboard appeared to be blank. Is it experiencing an outage currently?
That has been updated since mid-afternoon, so it should be up and running.
Okay. How, if at all, does the dashboard differ from the requirements set out in the RAT Act? What would you need in as far as staff, systems, or help from other agencies to meet those standards by January 1st, 2027?
So we don't have a dedicated staff to update the dashboard. It does get updated, but we do need FTEs. And I know that's a common answer, but we do, because it is manual work to update the dashboard.
And so based on the dashboard you all have just recently rolled out, is there anything different in my legislation as far as requirements that are set out in the RAT Act that is currently That is not currently in the new dashboard that you all rolled out recently.
I don't believe so. I believe what you roll out, you want to see complete transparency, just not with the number of boroughs, the number of inspections, the number of our hotspots, where we going to do those inspections, as well the community education that we doing.
Yeah. I think what I'm hearing you say is one of the measures can be and should be rep boroughs. The number of rep boroughs.
Yes.
Okay. As far as 301 request, a closed 301 request does not necessarily mean the rat problem was solved. What can the dashboard show residents about what was done, who handled it, and whether the underlying condition was actually fixed?
So the dashboard does not currently have the type of treatments or who treated the boroughs.
Okay.
So again, we definitely welcome ideas and thoughts on how to improve and add to the dashboard. Let me think about that, because we have filters, but not those specific filters.
Okay.
Yeah.
Can you walk us through on enforcement how DC Health uses notices to abate today? So over the last 3 fiscal years, how many were issued? How often did the district have to step in to do the work? And how much of those calls were actually recovered as we look at the enforcement overall?
So I don't have readily available the notice of NOAs issue. Oh, I have to
Okay.
follow up with you.
Okay, taking the numbers out, how does the system currently work in practice?
So
The
yes.
to abate.
So yes, our inspector go out to address, let's say, a complaint. They go there, they see things that needs to be cited. They speak to the person on charge. They give them a notice of abatement saying these things needs to be corrected within 14 days. After 14 days, we do return. If those findings are not fixed, we do issue an NOI.
And if I could also jump in, council member, it's now a multi-layered approach. So in addition to whatever efforts the DOH inspectors are doing, the focused sweep inspector for that area would also cite for whatever violations fall under DPW's purview. So for example, if the vector was an improperly secured trash can or the improper storage of commercial waste, in addition to the notice of abatement, DPW sweep inspector would issue an NOI for the appropriate violation. And as I told the council members earlier, between the last 2 fiscal years, we issued 28,947 rodent vector related NOIs. So it's become a multi-layered approach, and we'll continue to work with DC Health to ensure that we're hitting at both levels.
Now, after these NOIs are issued, how many fines are actually assessed of the amount that you are issuing?
So that comes down to what happens when we get to OAH, the Office of Administrative Hearings, and that adjudicative process. Sometimes it depends on the hearing examiner, it depends on the case. Sometimes we get all of the NOI substantiated. Other times there is an agreement with the hearing examiner where certain charges are dismissed, fines are reduced. So it really just depends on the case and the hearing examiner.
Do we have that breakdown? Because what I'm wanting to make sure, enforcement doesn't mean anything if it's not followed through on, right?
You would like to see
You can give out as many NOIs as if you want to, but if people know that they're going to be dismissed or they're going to be unsubstantiated or they're going to be settled, then there's no real deterrent. So I guess I'm trying to get a sense of how many of those NOIs are being found substantiated, how much are you all collecting in fines versus how much you're expending to help mitigate this or enforce it?
That information can be easily retrieved. We have access to OAH e-court system, so we can tell you what's the status of the NOIs. For example, if they open or they're closed, for example, did they admit with explanation or deny? So we can pull that.
Okay.
And I can get back to you with the same information on our side.
Got you. Because my legislation would let the district charge up to 3 times its reasonable cost. And I'm curious, when would DC Health actually use that authority, and what guardrails, such as clear criteria, notice and appeal, should we put in place to actually, so that's fair? And I want to make sure we are holding owners accountable for conditions they can fix, not simply because rats show up on the property. Does the bill's harborage language make that distinction clearly enough? And if not, how should we tighten it?
For DPW, let me circle back. I mean, there is an existing model within the system already. So when DPW assists Department of Buildings on abating nuisance properties, we can submit our costs to DOB, which are then transmitted to the property owner. And it also is similar to what you have just stated with your bill. It is a treble amount.
Gotcha.
So there is a model for it. Let me work with our sweep folks to get you that information on our side.
Okay. And Dr. Mori, on the vector-borne infectious disease control fund, before we repealed the fund, is there any money in it, any outstanding obligation, or any reason DC Health still needs it?
Allow me to follow up with my internal partners, and I get back with you with that answer.
Okay. And in answering that, if you could also ask them, after the repeal, where would recovered abatement costs go? And would that change DC's Health ability to carry out corrective action? Because that's what we don't want to happen. Mr. Crispino, on my office received reports, as you know, about the removal of trash cans that located next to bus stops that had been moved due to the better bus network changes, but that these removals had occurred anyway without notification to ANCs. I know I did a bill, oh gosh, 4 years ago, it was literally directly related to this. And then DPW, instead of my bill needing to be passed, DPW just said, you don't need to legislate it. We'll do it. We will do this in practice. So we didn't need to do the legislation. So I guess now I'm confused as to where we are in the implementation of that policy internally. How does DPW decide when to remove a public litter container from a residential block? And how often has that happened in the last year? And who are you all now notifying before the container is removed, if you're notifying anyone?
So my expectation, as I stated earlier, my expectation is that my folks should be working with the ANCs, similar to the previous testimony by either myself or my predecessor regarding the bill you're talking about. I know that's not a perfect system. It hasn't always happened in the past, but that's the expectation. Other than the WMATA bus stop, the decommissioned WMATA bus stop removals, I don't know of many removals. We haven't pulled any, and the circumstances that we would pull cans upon consulting the ANC would be for abuse, like if it was a subject of illegal dumping, if it was at the request, which is rare, but it has happened, at the request of an ANC or residents, and then if it needs to be removed and replaced for damages.
Okay. All right. My time is up on this round. I am just curious. I don't understand why the public abusing a trash can is the reason the trash can would get removed. It seems like an enforcement issue and not an access issue. And then everyone is punished for bad actors, but then the trash and the litter still plague the community.
It's not a perfect system, admittedly. It's one that we're trying to work through. We will keep working at it till we come up with a better solution. But in the cases where they have been removed for that purpose, it was the circumstances where I don't know if the can was in front of a multi-story unit building and folks were just coming out on their way to the metro or wherever they're going. But these were the cans where literally the can couldn't be used because of the amount of smaller trash bags associated with like a kitchen trash can are piled up on top and plugging the entrance into the underlying liner. So it was more of an illegal dumping type situation, and without more specific, because I'm going on generalities here.
Gotcha.
We would
Okay.
typically go into those bags, look for some sort of identifying material within it, and then try and issue an NOI. But we can work on it with you.
Okay. Thank you.
Thanks, Councilmember. And Director, the smart cans will help with that too, right? The ones with the sensors.
Ah, glad you brought that up.
Okay. Well, it's not my round, but you can answer quickly.
I'll wait. I'm all about procedure. I'll follow procedure.
Oh, okay. All right. Councilmember Henderson will come back to smart cans unless you want to use your time on it.
No, I'm going to talk about REMY for a little bit. So the REMY Act establishes within DC Health a commercial corridor rodent-proof dumpster pilot program to install at least 10 rodent-proof dumpsters in commercial corridors with high rat populations. In an ideal sense, bids, main streets, private food serving businesses would be able to apply for the program. Given that most restaurants contract with waste haulers, how could grantees use the funds to upgrade their bins with waste haulers?
So as I understand it, I heard the bid talking about this, and I know that Metro Store, which is the supplier of the standalone composting bins, has been working with one of the bids in a particular alley to address commercial waste. This would be akin to the Empire bins that have been in the news that New York City's rolling out. So how it would work here, the bid would work with the manufacturer. I don't know which one would be selected, but essentially they would work to place in an area that's either an identified hotspot or that we have some sort of heat map showing that there's illegal dumping or something related to commercial entities. The container would be placed there, and then essentially the dumpster would be enclosed in a rat-resistant receptacle.
Yeah. The thing that I want to make sure is that when we're rolling out the pilot or we're designing it, that yes, there are probably going to be lots of businesses who apply, but the important piece is that it needs to be in a concentrated area for us to understand whether or not it works, right? So like everybody on the block gonna need to join in, or at least be encouraged to do so, in that, let's say everybody moves to these new cans. You're the only business that hasn't. Now you're the business that has a rat problem because you're the only one who is still feeding everybody.
So you just nailed it. So before he retired, and Mr. Brown was in the audience.
Yeah.
And I believe even the gentleman from New York even said it as well. So one of the things that Mr. Brown told me when as we're looking at the public litter cans is your point exactly. If you don't replace all of the receptacles that are open vectors for the rodents, then you've not solved the problem. In fact, you've just moved them from that area and concentrated them in an area where they do have food available. So if all of the businesses in the impacted block are not using the equivalent of the Empire bin or whatever we're going to call it in DC when this gets off the ground, if they're not all using it, it's all for naught.
Okay. The act requires that DC Health report to the council after the pilot program on outcomes, recommendations, which types of dumpsters were most effective, et cetera. Do you, Dr. Morey, have any concerns with this reporting requirement? I mean, your mic is not on. Sorry.
How many times are we gonna do that this evening?
I didn't.
No, I do not. I do feel that multiple reports or reporting does require certain type of admin staff to assist with that. But I do not have any major concerns with that. I do believe in being transparent with our data. I do feel we need to be a little bit more aggressive in communicating what we're doing.
Yeah.
And maximizing social media, especially the neighborhoods app like Nextdoor. But no, I do not.
Okay. The REMY Act also restricts the usage of anticoagulant rodenticides to users only to users who have been certified to apply the pesticides in the district. When DC Health and DPW are out doing inspections, how often do you see evidence that a private resident or business is using rodenticide on their property?
That exceeds my expertise. I'm not going to lie.
Okay.
I'd have to defer to the sweep inspectors that know what they're looking for.
Okay.
I couldn't tell the difference between the different types of poisons, I guess, or rodenticides.
Same here. I would have to refer to the inspectors, but we're mandated report any misuse of poison to DOEE.
Yep. So what happens in a case of, I've got a hospital who is reporting 12 cases of minors who have injected or who have ingested rodenticide. Does that get reported to DC Health for you all to do follow-up?
So secondary poison is not a reportable action. We do have data here from emissions between January 2025 to July 2025. There have been 5 emergency department visits associated with rodenticide poison among DC residents. Of the 5 ED, 2 ED were associated with patients under the age of 18.
Okay. All right. So it's happening. It's not some myth that's occurring, but there are people who are having to go to the emergency room due to this. I believe that DC Health applies anticoagulant rodenticides as part of your rodent abatement strategies. That's correct, right?
Yes, we
Okay.
provide.
What process do you all go through in determining which type of rodenticide to use? Anticoagulant versus toxicants?
So currently, the inspectors utilize 2 brand rodenticides, Ditract and Blue Mass.
Okay.
So Ditract is, I don't know if you know this, it's 2nd generation. It contains a chemical, difacilon, and it is multiple feeding. So what happens with that, the rodents get the chemical on their fur and they ingest it. And then Blue Mass is our 1st generation anticoagulant. Basically with Blue Max, it's a meal bait and it contains the chemical, and excuse my pronunciation, difafilon.
Okay. What steps do you all take when you're applying it to ensure that it's not posing a health risk to the surrounding community?
So we follow IPM standards, integrated pest management standards. What our inspectors do, they put the rodenticide in a duster, they put it inside the rural burrows, and then they cover up the rural burrows.
Okay. Now that's part of it, but of course we heard some testimony today around the transfer that's occurring when a rodent who has injected the rodenticide is now eaten by another, circle of life type of situation, and not even just city wildlife, but also cats, dogs, pets, etc.
Yes, there are very unintended consequences, but it's very minimal with our inspectors. We acknowledge that secondary poisoning takes place into our pets and wildlife, but we do not support self-treatment. Let that deal with people who are certified to apply pesticides. I hear what you're saying, those small amount of unintended consequences, but our inspectors know what they're doing. They're certified individuals.
Yeah, and the legislation isn't talking about removing it from those who are certified. It's around people who are purchasing it on Amazon, or you saw it at Home Depot. I don't even think they sell it at Home Depot, so let me not put a lie out there. But you know what I mean? Like finding it in terms of online. The bill as introduced only restricts the use of anticoagulant rodenticides, but there was some testimony suggesting that we should expand to more types of rodenticides. Does DC Health have a thought on that?
Rodenticides are effective. We are considering rotating within, and there we have a discussion of rotating our products.
Okay. Let's see. REMY also requires DC Health to establish a public education program on effective rodent prevention and abatement strategies and public health risks connected with improper use. Do you all have any concerns with administering this public education program?
I feel like we're currently doing it. I mean,
Where?
we do the annual Rodent Academy there, education, please. We also do education when we collaborate on our walks with local authorities. We coordinate annually with DPW during the spring corridor. We coordinate with the mayor's walks, and we also work with the mayor's operations of infrastructure.
I know, but you've just listed government, and government, not community or.
What about the community presentations that we attend, as well conducting informal information sessions in which we educate the public on pest control methods and interventions?
Okay, so what goals are you all setting as as a EOM, right? Not just from an agency standpoint, but like, we had a number of public witnesses who were very frustrated in terms of talking about like people come, they talk at the meeting, we don't see any change. People come, it's just getting bigger, right? Or it seems like there are now more rodents that are. So what are the measurements of success that we should judge you all on in terms of the efforts around rodent abatement? What are the metrics?
I mean, for DPW, some of the metrics are what I started off with in terms of the food compost program. It's for us, it is removing the food source. I think we can all agree that if the food source is gone, the rat population decreases, especially when it's coupled with the efforts by Department of Health. So our milestones are expanding all of the composting programs and then just doubling down on our existing core services.
No, but if you guys aren't even keeping data on how many rats or like what the rat populations look like, how do you determine whether or not you've actually moved the needle? Like what is success? Seriously, I think y'all have something called a rat stat. Maybe, maybe not with the city administrator. Like what's success on rat stat?
I mean, I think ultimately it would be the number of complaints go down. If the less we're getting called out to deal with rats, the less rats there are. It means that the measures that we're already doing and that we are proposing, like the dashboard and other things, that is an indicator. When the number of complaints go down and residents are not reporting rats, we are meeting the milestones for success.
And when 311 goes down for 2 months?
Wow, that's true.
Okay, I'm over my time, but I'm just saying, I'm suggesting, because I can see where this is going, right? We're gonna get to the end of the year, running through the tape and all, and y'all are gonna say, look, the number of complaints are down X compared to last year. Asterisk, 311 was not able to accept requests from X date to this date.
I mean, I'll acknowledge there are issues inherent with any system that you use, but this is not a 1-year program. This is an ongoing issue that both agencies as well as other sister agencies are going to have to continue to address until we start to hit working with the council and other oversight bodies as to what success looks like, what the residents think success looks like. This is not a one and done. This is an ongoing issue. The rats aren't stopping. We can't either.
So can I also add, along with 311, 311 we can use metrics from 311 as well. This rodent abatement blitz pilot program, we have pre and post surveys. You can use that as a metric. And then lastly, internally, again, go back to my point, we do need to do better in communicating what we're doing. We are developing an internal metric on how to measure our success.
Okay, I'm over my time. Thank you.
Thank you. Okay. All right. So DC Code 82103.04B allows DC Health to recoup rodent abatement costs from anyone found to have contributed to rodent infestations. The RAT Act would allow up to triple damages. How often does DC Health use its existing recoupment authority?
Is this in reference to the NOI?
No,
Or
the ability to actually get people to pay you for what you spent to abate on their private property. How often do you use that authority?
So currently, we're not using that.
Okay.
This app will allow us to. We will have to really get together internally and with rulemaking to determine how will we assess and recoup that cost.
So you have the authority now. I mean, are there rules and regs on how to use it?
Let me follow up with that because
Okay.
I'm uncertain.
Okay, yeah. Because what the bill does is actually just triples what you're allowed to recoup, but technically you do have the authority under the code now. So I guess it's a question of whether it's ever been. Yeah. Do you think the ability to recoup up to triple the damages would be an incentive to use it?
From DPW's perspective, yes. I mean,
Yeah.
I mean, this is no different than when we staff special events. We know what each employee's hourly rate is. We know what the burn rate for fuel is. We know what each piece of equipment costs. So we can easily calculate, and those costs add up quickly. And if we're back out, for going back to my alley example, if we're there 3 times in a very short period of time, and I'm bringing a 10-person crew to do cutbacks. I have to bring in all of the vehicles that transported them. Let's say I need to bring in a Bobcat, the trailer, that adds up very quickly. And when you multiply that by 3, it will start to catch the attention of individuals that have out of compliance or nuisance properties. I think that's what this is intended for. It's not the one time that I have to send a sweep inspector to go talk to Mrs. Smith because Mr. Jones said that she's not closing the lid to her trash can, and it's only happened once. Would that be appropriate use for triple damages? Probably not. But when we're talking about some of these blighted properties or just repeat offenders, yeah, I think that'll start to catch people's attention really quick, especially when you start to couple that with NOIs.
Ditto.
Ditto. Okay, good. Love it. Thank you for your being concise. The RAD Act would require DC Health to report on abatement public education efforts. How are you currently measuring public education efforts?
So, right now, we're manually tracking our public education efforts, along with the community walks. We also track the presentations that we do, the talks that we conduct, and any outreach that we do. Currently, as I mentioned, we are working with the 311 OUC in tracking our community education. So right now, what we did, we reformed 311 to actually give us better insight of what we're doing during the actual inspections. For example, if our inspector are giving them materials or educate them on rodent abatement, that is now being tracked.
Okay, so you track your education efforts in 311?
It's listed as an activity.
Huh. Okay. So, can I see that at some point? Just show me like where it is. We don't have to do it right this second, but I want to I want to figure out how to nav to that. Okay, great. Yep.
Can I circle back on one point on the previous, the recouping of the costs?
Absolutely.
I'm not sure if it's in the bill. I did read it, but I'm not sure if it's in the bill. But one of the things you would want to take into consideration is that because we're issuing NOIs, you would want to make sure that whatever the recoupment is that based on an adjudication by OAH saying that the person actually did commit the offenses, and that would allow us the government to recoup the cost? Or is it just, hey, this has come up, and regardless of the outcome in the administrative process, we had to come this many times to reduce the number of rats in this particular area. Here's what it cost.
I hear what you're saying.
So
Maybe the triple damages should go to OH for adequate staffing to administer NOIs from DPW. Okay, we'll figure it out. I hear what you're saying. And that is a good point because we need to know it'll actually have teeth. How does DC Health currently measure prevention campaigns targeted at changing social behaviors? How does DC Health currently measure prevention campaigns targeted at changing social behaviors?
We have to start tracking that. I mean, we do so many things. Again, I feel like the challenge is we do so many things. We really do need to be concise. And the dashboard has been very helpful in which we can transmit all that information into that. And we can utilize that to show that metric. So let me think more about that.
Okay. All right. I'm moving to the REMY Act and I'm hoping to wind down here. So how common are rodenticides used by homeowners and businesses? Does anyone know? We don't know. Okay. Are there rodenticides that are more harmful than others, or do they all share the same active harmful ingredients?
It's dependent on their chemical makeup.
Okay. So some are more harmful than others.
Yes.
Okay. Does DC Health have data collected to date on injuries to pets, wildlife, or people that you can share from rodenticides?
When you mean injuries, are you talking about secondary poisoning?
All of the above, yep.
All the above. So currently, right now, secondary poisoning is not a reportable action. The data I just read, I just got that from our hospital administration, but for example, poison control, we have limited reporting.
And what about to pets or wildlife?
So our veterinary community and even our animal services contract, they would have that and they're equipped to handle that. That should take place.
So that data should exist?
Allow me to follow up.
Sure. Okay. And do you have any data collected on the demographics or wards of where rodenticide is used more? For the purposes of this, I'll say by DC Health.
So our inspectors are required, anytime they use chemical, to denote the chemical they use, the amount, as well any wind factors.
Okay. So you would be able to break that down geographically?
It would take some time, but yes.
Okay. And how does the agency currently educate the public on rodenticide use?
So we distribute materials, education materials, and that is our main talking point. We also work with organizations whose mission is to protect wildlife and pets.
Mm-hmm. Okay. And so if this bill were able to, if REMY was to go into effect, what would be different with respect to prevention from what you're doing now?
It would enforce prevention. Sanitation is prevention, and we need everyone involved. So this bill, we 100% support it with some assistance to implement it effectively, but everyone needs to understand, my predecessor used to say, you know what, we can't do it alone, you can't do it alone, we have to do it together. It is a partnership.
Mm-hmm. How is certification for the sale and use of rodenticide currently enforced in DC?
I would have to defer that to DOEE because they're the one that approves the certification, the sales and use of rodenticide.
Got it. And would anything be different under this bill if it passed?
Not to my knowledge.
Okay. All right. You want to talk about your smart cans in the 1.5 minutes and no more?
Is it that time of the evening?
Yep. Smart can time. Let's
All
go.
right, so yeah, smart cans. We have a pilot that Ms. Hoffman Graham has been working very hard on. We were able to identify $100,000 in funds. We identified a vendor. We've been working with OCP. We expect the PO in place next week because we had to work through some of the contracting issues like CBEs and things like that. But the PO will go again. The PO will go in next week. We'll be able to place the order, and then we're gonna get about 20 to start. I know that it's been a long time coming, but it's 20.
Can I suggest a ribbon cutting? I have been known to hug a recycling can at installation. So
I remember you at the ribbon cutting for the throne and the big
yeah, we started that. Washington, D.C. was the first place to cut toilet paper for a throne opening. I just
with giant gold scissors.
Yeah.
I remember.
Okay. All right. We'll follow up on, now they do it all around the country. We are trendsetters. You know, I won a plushie this year. Okay. I think we've done some good work here today. There's obviously a lot more to do. And we're going to have some follow-up questions just in the interest of time. We didn't want to barrage you with things that were slightly off topic, but also related. So, because you know, the two of us can go all day. So I'll say I want to thank all of our public witnesses and our government representatives. This is going to conclude today's hearing. If anyone watching wishes to submit, you're done, right? Okay. If anyone watching wishes to submit written testimony on the bills we discussed today, please do so by submitting that on the council's hearing management system page for this hearing, which you can find at lims.dccouncil.gov/hearings. The record will close at 5:30 p.m. on July 27th, 2026. The time is now 6:52 p.m. and this hearing is adjourned.